Okay, all right. So we are live now. Hi everyone. Let me just check if I'm audible.
Everyone, let me just check.
Yes, correct. Good evening, good evening. I have got a lot of beautiful audience. बहुत ही प्यारे प्यारे बच्चे हैं जो कि हमारे साथ जुड़े हैं आज. There is a huge number of people and huge number of winners, I should say. All of you are winners. Hello, Asik Ali. Hi, at it BRS. Hi, Amit Singh. Hello, AAD 000. Hello, Doctor. Hello, Vedant Rai. Hi, Medical Guideliner. Hello, Batu Prakash. Hi, Maurya. Hi, Jensi. Hi, Minaji. Hello, Varun. Hi, Suraj. Hi, Tofika. Hello, everyone. And yes, first of all, my warm greetings to all of you. Jenny, Dr. Amen, Sabit, Abawari, Dr. Reshma, Dr. ANN, Little Squid, Jayeshri Devi. Hi, Om Meena. Bapre. There's so many students, so many students. Okay. So, hello, dear students. Myself, Dr. Parv Luthra, and I am your pediatric faculty for Remarkable Rapid Revision 2.0, and super excited to work with you all because I am not alone. Okay, so I was reading the comment section, and in the comments, somebody wrote that you are a newbie, huh? You are a beginner. So just one reply: I was a beginner until I was alone, but now I am having 200, rather I should say 300 something, a big team with me who is there, who themselves are the winners. So all of you in the comment section, you are my real strength. Meri jeet aapse hai. My win is totally and totally connected with you all. So now today, uh, oh, Meena ji is saying cute ho aap sir. Cute तो पता नहीं, I don't know if I am or not, but then but then I'm super excited. Very good. Asik Ali says we are with you, sir. Okay, so quickly type in the chat box who all are with me to win the session. Type win for writing, for telling me that you all are with me, and we are going to win the battle of FMGE soon. Okay, yeah, huh, right. Yes, win. Yes, we will win. Definitely we'll win. Amazing. Yes, we will win. Definitely we are going to win. Definitely we are going to win. Yes. अब की बार 200 पार. बिल्कुल सही बात है. अब की बार 200 पार फोड़ देंगे. बिल्कुल फोड़ देंगे. और I'm fond of writing shairis. I'm fond of listening to shairis. So there's a Hindi shairi says कि जब से मैंने महसूस किया है कि मेरा खुदा मेरे साथ है. हाँ. So with the blessings of Lord Krishna, जब से मैंने महसूस किया है कि ऊपर वाला मेरे साथ है, मैंने ये सोचना छोड़ दिया है कि कौन मेरे खिलाफ है. मेरे पास वक्त नहीं है उन लोगों के लिए जो मुझसे नफरत करते हैं, क्योंकि आज मैं उनमें व्यस्त हूं जो मुझसे प्यार करते हैं. सो ऑल माई लव फॉर ऑल ऑफ यू. और आप सबके लिए ये एक ब्यूटीफुल सी पेंटिंग जो है वो मैंने तैयार की थी कि मेरे सभी बच्चों में से किसी को भी नजर नहीं लगनी चाहिए. राइट. सो बिल्कुल 200 पार सबकी. Yes, definitely. अब की बार 200 पार. 110%, 120%. We are going to rock. Definitely we are going to rock. चलिए. Yes, I'll speak in English also. So for all of you who understand English, this is something. Yeah, this is something which I've brought for you. So basically, I love shairis, I love poetry, and I love to sing as well. So singing from my heartache, from the pain, taking my message from the veins, speaking my lesson from the brain, seeing the beauty through the pain. You made me a believer. So all the students who have joined, right? They are the believer, and you made me a believer, right? Yeah, okay. Great. अब की बार 200 पार. बिल्कुल जी बिल्कुल. 110% अब की बार 200 पार. So basically, let me just tell you how this session is going to be. So this session is going to be approximately 4 to 6 hours of session. Okay, so depending upon when you guys need a break or how much do you need a break, we'll try to finish up all these things in 4 to 6 hours. Somebody is writing Marathi. Kasha ahet tumi? Sagde. So just let me know. Okay, so 4 to 6 hours session it's going to be, and a lot of students I've seen in the previous sessions that they say, sir, we have read from a particular textbook, or we have not textbook, but we have read from a particular material, and now when people say that, okay, revise from our rapid revision or something, it becomes difficult for us. So for you guys, let me just tell you that I have written the name of the topics. Okay, I've written the name of the topics, just like, see, neonatology. So in neonatology, this topic is important, jaundice. So what you can do after my rapid revision, you can actually go to your main notes, you can revise it from there as well, no problem. Okay, so it's going to be 4 to 6 hours or 5 hours of approximately 5 hours of pure content of pediatrics. Okay, then the main important thing is going to be that it's going to be extremely mnemonical. So I think that you have downloaded the PDF, and now yeah, you will be able to annotate. So of course the notes are available, and I think you have okay, you have seen this. Now I'm getting a very I should say a very famous question from all of you, that, sir, is this complete, this video is enough or not? So basically, dear students, let me just tell you that the rule is of priority. Okay, the rule is of priority. So first of all those topics which I'm going to give you in this PDF, in this video, should be on your fingertips, so that you don't do something wrong, which everyone is going to do correct. Okay, so which everyone is going to correct. Okay, you are not supposed to do that wrong. And believe me that 70% of your questions will be from these topics only. I have tried and include the important topics, the previous year topics, the previous year questions, how to solve the questions, the anticipated topics. Some anticipations are always there, because for many of you, I'm a new person to teach, but then I'm myself studied. I'm myself studying this pediatric subject from now 4 5 years now. Okay, so basically, try and understand that the entire game is of priority. So 70% you are going to get it from this. Okay, and the remaining 10 to 20% depends upon your question solving. Okay, we'll give you some of the tricks also how to do the MCQs. Okay, and for those of you who were telling, sir is new, sir is new, even Maithili Thakur was new from Bharatiya Janata Party in Bihar, and now she's an MLA. So yeah, and out of there are many students who are watching us. Out of these, I am surely going to get the super 30, getting the top 30 ranks. Okay, of course, PYQs you have to solve, and this is a live session. I just want everyone to focus into this live session. Why live session? Because, see, understand, uh see, recordings are available everywhere. The problem is discipline. Okay, and one more remark. Okay, one more remark. Okay, in this schedule thing, in the discipline thing, is please focus on one habit at a time. Okay, please focus on one habit at a time. So the habit which you are going to develop from the coming days is that you will not miss the live session, whatever it be. You will not miss the live session, because so many people right now are playing BGMI or watching YouTube or Instagram. Not BGMI, what's that? PUBG, yeah. So they're playing here and there. Somebody might be talking, hello Janu, how are you, had your dinner or not? So all right, so basically competition overall is decreasing. Okay, start subject please. Okay, we'll start. Okay, so just one thing, only one thing, last thing. This is my favorite story, which I always tell in my classes, that so one day, Draupadi, Draupadi was Krishna's sister. Okay, so Draupadi was very angry. She said, Krishna, tumhare hote hue, you were there, and all my 5 husbands, they lost the battle with the Kauravas. How is this possible? So Krishna replied, that sister, please don't be angry. You know what? When Kauravas and Pandavas were decided, okay, they decided to, that play the game of Chaurus. Chaurus is the game which we call it as. So the Kauravas told that okay, हमारी तरफ से हमारा मामा जो है वो पासा फेंकेगा, that from our side our uncle is going to play the game. So Krishna says that Draupadi, if you or any of your husbands would have told that we might lose, but from our side Krishna is going to lead, Krishna is going to play, I am promising you that your husbands must have won the battle. So when we think that we are going to do anything, we might lose, we might win. But dear students, when you decide that not you but Krishna is fighting from your side, that your Lord is fighting from your side, the win is definite for you. You are going to win, and 100% you are going to have the 100% you are going to have 100% strike rate from these classes. And not only Krishna, any god you believe in, even if you don't believe in God, you must believe in your parents, in your parents' blessings, you yourself. So okay, yeah. So let's start. Okay. So let's start the neonatology. So what is neonatology? You very well know that study of neonates is actually neonatology. Okay. So in neonatology, the very first important topic is going to be jaundice. Okay. And in jaundice, the very first thing is that you must know the basic of bilirubin metabolism. So what is important in bilirubin metabolism? So you must know that there are two types of bilirubin. One is called as unconjugated bilirubin, other is called as conjugated. Okay, unconjugated, and then there is conjugated bilirubin. Sir, important topics alag se remark kar. हाँ बच्चे, yes, definitely I am going to tell you in the end what are the important topics. Yes, definitely I'll tell. Okay, so bilirubin, you very well know that there is unconjugated bilirubin, and then you have got conjugated bilirubin, and the enzyme which is responsible to convert this unconjugated bilirubin into conjugated bilirubin is called as UDP glucuronide transferase, that happens in liver. Okay, so UDP glucuronide transferase that happens in liver. Okay, so let's understand what is physiological jaundice and what is your pathological jaundice. Okay, so I am going to teach you now physiological jaundice. Okay, so physiological jaundice we can have in term babies also. Physiological jaundice we can have in your preterm baby also. Okay, so you can have it in term babies as well, you can have it in preterm babies as well. So please understand, dear students, that in term babies the rule is 3 12 7. Okay, or you can remember 31 27. 31 27, this is physiological jaundice rule. And what is in term babies, and what is the rule in preterm babies? So 51 52. Okay, 51 52 is the rule in preterm babies. So what does this mean? See, understand, 31 27 means that in physiological jaundice, if it is occurring in term babies, it is going to peak on third day. It is going to peak on third day. So one more mnemonic is T for term baby, T for third day. Okay, so bilirubin is going to peak on third day. And how much it can peak? It can peak up to 12 mg per deciliter. So the maximum bilirubin is going to be 12 mg per deciliter in a term baby, and it is going to return back to the normal on the 7th day. It is going to return back to the normal on the 7th day. Okay, so 31 27 is the rule for term babies. But what about preterm babies? Preterm babies, understand 51 52. Okay, so P for preterm, and in Hindi we call 5 as 5. Okay, so you can take this P to remember that it is 5 wala. 51 52 is in the preterm baby. 51 52. So just remember 51 52. That means if it is a physiological jaundice in case of preterm babies, it is going to peak on the 5th day and up to 15 mg per deciliter, and normalizes in 2 weeks. Normalizes in 2 weeks. Okay, so it is the time when you are supposed to open your comment section and quickly write in the comment section that pathological jaundice is going to appear within dash of life. Okay, dash days of life. Tell me, quickly tell me. Yes. So pathological jaundice appears in how much days of life? Yes, 1 day. Very good, very good. So the person who told this answer first is Amit Singh, Sneha, Nana Pot. Very good. First, second, and third. Amit Singh, Sneha, and Nana Pot. Good. Very good. Very good. Very good. So now coming on to the FMGE question. Okay, the FMGE examiner is fond of asking this question, that what is the most common pathological cause? Most common pathological cause or most common cause of pathological jaundice is RH incompatibility, and next is going to be your ABO incompatibility. RH incompatibility is the most common, and then of course is going to be ABO incompatibility. Okay, so RH incompatibility is the most common cause. RH incompatibility is the most common cause. Okay, not ABO incompatibility. Please don't do this wrong. RH incompatibility is the most common cause. Okay, now second question for you guys. All right, take the comment section in your hands and tell me this answer. ABO incompatibility, if it is going to be there, so of course you're going to get some hints in the question. So what will be the blood group of mother? Yes, what will be the blood group of mother and what is the blood group of baby if we are highly likely to suspect ABO incompatibility? Quickly tell me. So if you are suspecting, if you want to suspect ABO incompatibility, tell me what should be the blood group of mother and what should be the blood group of the baby. Yes, quickly, quickly. So I'm waiting for you all in the comment section. Okay. So waiting for you all in the comment section. If the blood group of mother is dash and baby is dash, we can suspect ABO incompatibility. Okay, so I've not got much answers. Okay, beta. So just understand like this. This is your mother. Okay, so mother has got this O. Okay, mother has got this O in the spelling itself. So mother ka blood group, mother's blood group is going to be O blood group, whereas the blood group of baby is going to be AB blood group. Okay, so in if they say that the blood group of mother is O and the blood group of baby is AB, so can you understand? AB baby, AB baby. Huh? So mother blood group is O, baby's blood group is AB. So there are high chances that there is a ABO incompatibility. Okay, but we can't explain it for in much detail. Why? Because we have to finish up this rapid revision, and our main concern in FMGE exam is to solve the FMGE questions, and nobody is going to ask you, do you know the concepts or not? Okay, okay. Now next question, quickly tell me if you have written clay colored stools, clay colored stools as a hint. Okay, what are you expecting? Which type of jaundice are you expecting if they have written clay colored stools? Yes, quickly tell me if they have written clay colored stools. Very good. Dr. Reshma is the first one to answer. Nirisha, very good, Nirisha. Very good, very good, very good, Surekha. Yes, yes, correct, 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 Vijay. So it is the obstructive jaundice. It is what? It is the obstructive jaundice. Very good, very good, very good. Coming on to the next question for you all. Yes, my little kids will tell me, FMGE warriors, FMGE winners, if you are giving phototherapy, what should be the color of light? Yes, what should be the color of light? FMGE graduates, FMGE warriors will tell me. Very good, Vishwajit. Very good, Shahama, Vishwajit, Sneha. Very good, amazing, my dear kids. It is going to be blue-green color. It is going to be blue-green color, and the lambda is going to be 460. Okay, so 460 to 490 nanometers. So I have seen people, they forget the wavelength. So beta, here is a mnemonic for you. Blue has got 4 letters, green has got 5 letters. So anything between 400 to 500 nanometer is going to be the wavelength. It is going to be the wavelength. So I am sure that you are liking the small tricks and mnemonics which I'm giving you in between. And if you're liking it, just give me a chotu sa heart. A chotu sa heart. Give me a chotu sa heart, and give me a chotu sa heart for this cutie Billy also. All right. So coming on to the next. Okay. I just love you guys. Energy in the comment section is superb. The preparation is superb. FMG graduates, FMG people soon becoming IMGE, serving Indian patients, are rocking like anything. I am already witnessing winning, and super winning spirit in my comment section. I just love you all. Okay. So yeah. So next question is when you are not going to give phototherapy. Dekho, there are a lot of things. Okay, there are a lot of examples and everything. I'm not going to cover everything. I am just going to tell you what you can't forget in your exam. Okay. Okay, what I'm going to tell you is that this thing you can't forget in your class. Okay, so coming on to the contraindication of phototherapy, please understand that phototherapy is contraindicated in children who are having conjugated bilirubin jaundice, who are going to have conjugated bilirubin jaundice. So for example, if the bilirubin is conjugated and then it is going in the bile duct, but if there is an obstruction, of course my dear children, you are not going to have what? You're not going to have the excretion of the bile and there will be obstructive jaundice. But this kid is going to have a conjugated hyperbilirubinemia. Conjugated. So in this patient, if you give phototherapy, the child is going to have a bronze skin, that is called as bronze baby syndrome. It is going to have a bronze baby syndrome. So conjugated jaundice, bronze baby, contraindication. Okay, so you know that in alphabet B and letter C come very close. So B for bronze, B for baby, okay, and C for conjugated jaundice, and C for contraindication. Contraindication to what? Contraindication to phototherapy. Oh my god, see this comment section, and you guys are writing the answers before I am even speaking. So that means your preparation is superb. So all the students who are attending today's lecture are rising, are shining, and I am just feeling very happy that I am going to be the part of my kids' journey, winning journey. I'm just, I'm just overwhelmed. I'm so happy. Okay. Coming on to the next part now. Breast milk jaundice, breastfeeding jaundice. Okay. Okay. So what is breast milk jaundice? See, in some females, the breast milk contains beta glucuronidase. Okay. In some of the mothers, they have got what? Beta glucuronidase activity. Okay, and this beta glucuronidase is going to decrease, is going to do what? It is going to convert, or it is going to convert the conjugated bilirubin into unconjugated bilirubin. Okay, so in some mothers there is something which is called as beta glucuronidase, and you very well know, whenever we see the word days, ase means something is cutting. So it is cutting the conjugation, it is converting the conjugated bilirubin into unconjugated bilirubin. Okay, into unconjugated bilirubin. And because there is increase in unconjugated, that means it is not going to pass out, not going to get excreted. And what my kids are going to have? Yes, what my neonate will have? It will have breast milk jaundice. Breast milk jaundice. Okay, good. Okay, now my FMG students, my FMG warriors, quickly type in the chat box that if there is a beta glucuronidase activity increase, if we are suspecting breast milk jaundice, at what day, during what day you can expect a breast milk jaundice? Breast milk jaundice. Yes, quickly tell me. Day 6 to 7, after 7 days. Okay. Seventh day. Okay. Yes. Second to third week. Okay. So first correct answer is given by Dr. Reshma. Okay. Dr. Sushil Thakur, Dr. Shagun Thakur, Isra, Madasu, Banu Priya, Kirti. बच्चे लॉट्स ऑफ लव, लॉट्स ऑफ ब्लेसिंग्स, और मेरे बच्चों को नजर नहीं लगनी चाहिए. हाँ, दे शुड बी ऑलवेज हैप्पी. ओके, चलिए. सो बेसिकली ब्रेस्ट मिल्क. ओके, सो कैन यू सी? Now see here, bache, breast milk has got 1, 2, 3, 4. 4 words are there. So 14th day is the day when we expect this. But yes, most of you, as you are writing, that after 7th day. Okay, after 7th day. So 7th day to 14th day, okay, we expect the breast milk jaundice, okay, and please understand breast milk jaundice, MIL. So this L is going to tell you that it is going to happen late than the breastfeeding jaundice. So what is breastfeeding? See, in the primary mother, okay, so so you know, so I mean, some people say, oh, you are a new person, you are a primary person, huh? So they think that I've got a poor feeding habit, huh? I'm a poor feeder, which I'm definitely not. But then some people say that. So poor feeding, okay? Some primary female, they don't know how to feed the baby properly. So there's going to be poor feeding, okay? Then if there's poor feeding, of course the baby is going to do starvation, and if the baby is starving, there will be decreased bilirubin excretion in these babies, and because there is decreased bilirubin excretion in these babies, there is going to develop what they are going to have. They are going to have breastfeed jaundice. And when you will expect this breastfeeding jaundice? After second to third day. After how many days? Second to third day. Breastfeeding jaundice is going to develop after second to third day. Yes, yes, yes. Correct, correct, correct. Coming on to Crigler-Najjar syndrome. Okay, coming on to Crigler-Najjar syndrome. Quickly type in the chat box which enzyme is deficient in Crigler-Najjar syndrome. Yes, my dear children. Yes, quickly. Can we watch it later? अरे why to watch it later? अभी क्या कर रहे हो? गर्लफ्रेंड से लड़ाई हुई है तो then it's okay. UDPGT, very good. Murtaza Bhatt, amazing. Very good, Sushil. Very good, Bhanupriya. Very good, Sushil. Correct. Crigler-Najjar syndrome is going to have the UDP glucuronide transferase. Now, see, understand. Now, there are a lot of students who know this, but there are some students, some newbies like me who don't know this. Let me just tell you, bache. See, understand. C for Crigler-Najjar syndrome. Okay, Crigler-Najjar syndrome. And then you have got glucuronide transferase that is going to start from the letter G. Okay, glucuronide transferase. Okay, so my dear students, please see this. The C and this G look very similar. Okay, so C for Crigler-Najjar, G for glucuronide transferase. So UDP glucuronide transferase is absent in Crigler-Najjar syndrome. Very good, very good. Okay, coming on to a neonate with jaundice with clay colored stool. Can you tell me what is the most common surgical cause? Yes, most common surgical cause in neonate with the jaundice with clay colored stools. Nice trick, sirs. Dil Tuta Ashik, thank you so much. Dil Tuta Ashik, I'll have a shairi for you in the end. Billy. Bache, biliary atresia, very good. Nana Pot, very good. Biliary atresia, very good, very good. So the answer is biliary atresia. Okay, so the answer is nothing else but biliary atresia. Amazing, my dear children. Amazing, amazing. Biliary atresia is the most common cause of obstructive. So can you see clay colored stools कब दिखते हैं आपको? Clay colored stools are yes. So clay colored stools कब दिखते हैं आपको? That is seen in obstructive jaundice, and obstructive jaundice has got this B word, so B for biliary atresia. Okay, so B for what? B for biliary atresia. And what is the most common medical cause? See, this has not has been asked. Okay, but since we are writing those questions also which are anticipated, so medical cause is neonatal hepatitis. Okay, okay. What is the name of the surgery we do for biliary atresia? Yes, what is the name of the surgery? Quickly tell me. Yes, yes, yes. Quickly tell me. Quickly tell me. Good, good kids. Yes, Kasai surgery. Very good, Nirisha. Very good, Asik. Yes, it is Kasai's portoenterostomy. Of course, I'm going to teach you. Don't worry. आगे जा करके हम पढ़ेंगे. This is Kasai's surgery, and which has to be done when? Which has to be done within 8 weeks of. Okay, so Kasai's portoenterostomy, which has to be done in the 8 weeks of life. So how to remember? So this is K. And if you just join these, this becomes like 8. You know? So it has to be done in 8 weeks of life. Okay. Yeah. Correct, 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 my dear students. Correct, correct, correct. Okay, bache. Coming on to the radiological sign in biliary atresia. So it is called as triangular cord sign. Triangular cord sign. Okay. So let me just show you the picture. Yes, bacha. See this. So this is a triangular cord sign beta. This is a triangular cord sign. So what happens in triangular cord? ये थोड़ा सा समझ लो. This needs a little attention. So this is your liver. Okay, this is your liver, and then liver has got the bile duct. Liver has got the hepatic artery, the hepatic vein. Sorry, portal vein, and this becomes a triad. Okay, this is a triad which is called as porta hepatis. This is called as porta hepatis. And you know what happens in biliary atresia? Biliary atresia means that the bile duct, see atresia, whenever this word comes anywhere, na atresia, that means this, the lumen is not patent. The lumen is not patent and it is fibrous. So can you see this glowing structure? Yes, can you see this glowing structure, dear kids? Yes, this is nothing else but a fibrous cord remnant of bile duct in biliary atresia. So it's a fibrous cord remnant of bile duct in biliary atresia, but it's okay. It's completely fine even if you don't remember what is the logic behind it. What you have to understand is this. This is my mnemonic. This is my trick for all my superb kids, huh? For all my superb kids. So see, if the triangular cord sign is seen in torn cord, टूटी हुई cord, torn cord, triangular cord, torn cord, triangular cord. So that means the cord is not patent, cord is torn. Okay, so answer is biliary atresia. Okay, and I've told you that the location is going to be what? Location is going to be porta hepatis. Porta hepatis. चलो, ये अगर torn cord वाली trick पसंद आई है, if you have learned this, if you have understood this, quickly give me so many hearts. ठीक है? And I just don't want the hearts to be from only boys side or only girls side. I just want both of you to give me hearts and hearts. आ गए बहुत सारे दिल आ गए. Yes, yes. Okay, so Asik Ali, Isra, Vishwajit Singh, Sushil Yadav. So all of you are going to get a seat. You give me heart, I'll give you seat. You give me heart, I'll give you knowledge. Aruna, Krishna, so much love in the comment section. And believe me, this is the feeling which I work for. You know, the day when your results will come and you'll write, sir, you know, all my questions in pediatrics are correct. I'll just give you guys love, and love only. Okay. Chalo bache. Coming on to, yes. So coming on to radiological signs. So I've told you, if it is a torn cord, radiological signs. Yeah. So what is the investigation of choice in biliary atresia? So in atresia, the investigation of choice is going to be HIDA scan. Okay, the investigation of choice is going to be HIDA scan, but the best test is going to be biopsy. Okay, the best test is going to be biopsy. So B for best test, B for biopsy. I've seen students doing this wrong. Sir, investigation of choice पूछा था, हमने biopsy कर दिया. No, बच्चा. B for best test, B for biopsy. Investigation of choice, of course, is going to be HIDA. But what is gold standard? I always teach you like this, that C and G are, you know, similar looking. So gold standard, that is starting from G, the gold standard is going to be C. What is C? C is going to be cholangiography. Okay, cholangiography. Okay, समझ में आ गया? Okay, is it clear? Okay, bacha. So best test is going to be liver biopsy, B for biopsy, B for best test, and G for gold standard. So C and G come together. Gold standard cholangiography. Okay. One more question is that which is the stain used for iron? Okay, if you want to stain iron, which is the stain used for staining iron? So that is going to be Prussian. So iron Prussian. Okay, iron Prussian. Okay. Sadaf, daily you will get the updates when we are going to come live, so you can join the Telegram session. Okay, coming on to scalp edema. Chalo bacha, let me test your knowledge. Let me check how much my students are prepared. Quickly tell me, in the scalp edema, which of the two conditions, cephalhematoma or your caput succedaneum? Cephalhematoma or caput succedaneum, which is going to cross the suture? Yes, which is going to cross the suture? Which is going to cross the suture? Caput. Very good, Shagun. Very good, Priyanka. Joshna, Sushil. Very good. Somebody has written only C. सर जो लगाना है लगा लो, think whatever howsoever you want to think, it is starting from C. अरे बच्चे, both of them are starting from C itself. Okay. चलो, caput, very good बच्चा, very good. So but lot of my dear students were wrong. So बच्चा, I have got a trick for you. Success extends from birth. Whether a teacher is a new teacher, whether a teacher is an old teacher, success extends from birth. This is my mnemonic for this class. This is my mnemonic for you all people. So success means what? Success means succeedinum. Okay. So success means what? Caput succeedinum. Okay. Right. Extends from birth. So, if you want to get successful in life, you have to proceed. So extends means it is going to extend. It is going to cross the suture line, my dear kids. Okay. It is going to cross. It is going to cross the suture line. Okay. So which is going to cross the suture line? This is the one. Caput succeedinum is the one thing which is going to cross the suture line from birth. From birth means it is present since birth. Okay. So extends from birth. Extends means crossing the suture line, and from birth it is present since birth. Success is succeedinum, and you very well know that in alphabets, letter S and letter T come very close. So what is T? T for 2 days. So caput succeedinum is going to get relieved in 2 days. Okay, so S and T come very close. TWO2. So it is going to get relieved in how much days? In 2 days. That is 48 hours. And S for succeedinum, S for soft tissue edema. Soft tissue edema. So entire caput succeedinum is because of what? It is because of the soft tissue which is getting edematous. So success extends. So crossing the suture line, birth, that means it is since birth. And S for soft tissue edema, T for 2. Okay? Yeah. Don't say bacha. नहीं, you all are my bachas only. किसी को पता नहीं अपनी गर्लफ्रेंड की याद आ गई बच्चा बोलते ही. हाँ. या. चलो, इट्स ओके. चलो, अगर ये ट्रिक पता लगी, समझ में आई, अच्छी लगी, सक्सेस वाली ट्रिक, तो लिखो फटाफट. All you are successful. So write success in the comment section. Write success in the comment section. Yes, all my successful kids, write success in the comment section. Yes, Priyanka is going to be successful. Fatima is going to be successful. Dr. Bug, Aruna, Banupriya, everyone is going to be hugely successful. है ना? बड़ा success मिलेगा. Very good. Love you all, बच्चे. Love you all. So caput succeedinum, as I've told you, S for succeedinum, S for your soft tissue edema. S for succeedinum and S for soft tissue edema. Then extend. So I've told you that it's going to extend across the suture line. Present since birth. So our mnemonic says success from extends from birth. So it is present at birth and it is going to disappear. Mnemonic says S and T together, T for 2. So remember that it is going to disappear within 48 hours. What is cephalhematoma now? Yes, what is cephalhematoma now? So remember, hematoma has got this T word, T for trauma. Cephalhematoma comes from trauma. Cephalhematoma comes from trauma. Cephalhematoma comes from trauma. So what does this mean? Remember, T for trauma. So collection of, so first of all, it is going to come from, yes, it is going to come from a trauma. Usually due to the trauma at birth, cephalhematoma is going to come. So collection of blood, please understand, it is the collection of blood between the periosteum and the skull. Okay, it is the collection of blood. So I've seen one of the FMGE papers, they have asked which is incorrect regarding cephalhematoma. So all these were the choices. So this is how I am going to give you. So remember, collection of blood between periosteum and the skull. The swelling is not going to cross the suture line. Of course, it is not success. So success is something which is going to cross the suture line. Okay. So swelling does not cross the suture line. And then you have got increase in size over first day. Yeah. So cephalhematoma will show increase in size over the first day. Any trauma, if that happens in your life, a lot of students I can see in the chat box, they are saying, sir, please bacha mat bolo, don't say bacha, because I remember my girlfriend. So any trauma, ex-girlfriend, trauma. So any trauma for that matter is going to increase in size. So increase in size over the first day. So cephalhematoma is going to develop after trauma, and any trauma is going to expand a little initially, right? And cephalhematoma has got this M word, so it is going to take months to resolve. Okay, it's going to take months to resolve. Honey Mehta says game over. बच्चे जो ये सेशन नहीं देख रहे हैं उनका गेम ओवर है, उनका गेम ओवर है. But those of you who are watching this session, my FMGE winners, my FMGE winners. Okay, so see here बच्चे, see this is caput succedaneum. Okay, so see here, this is the edema. Okay, caput succedaneum, and see this is the subgleal hemorrhage, although this image is not asked. And then you have got cephalhematoma, this is going to be there. So can you see that caput succedaneum is something which can even cross the suture line? Yes, which can even cross the suture line, but this is something which is not crossing the suture line, and this thing you have to be very sure. Okay, be very sure. Yes, correct, very sure while attempting that image. Coming on to this neonatology topic, this was a recent year concept which was asked in INI-CET. So let me just teach you this also about the breast milk. Okay, about the breast milk. So bache, they have asked what is the daily fluid requirement. So let me tell you, for the kids, the daily fluid requirement in ml per kg per day, in ml per kg per day is going to be like this. So on day one, on day one, if the baby is less than 1500 grams or if the baby is more than 1500 grams, so how you are supposed to remember? See, you have to remember this, that you are supposed to add plus 15 ml per kg per day in the successive days. So from 80, 95, 95, 110, then 120, then 130. So even if you remember like 15 ml per kg per day, roughly, okay, that's going to be the normal thing only. Okay, then 60, 75, 75 to 90, 90 to 105, 105 to 120, like this. Okay, so what you have to understand is like the first thing. So if the baby is a chotu baby, if the baby is a chotu baby less than 1500 grams, the baby is going to have a much higher requirement of breast milk, because the baby needs some energy, the baby needs the immunity. So the requirement of the breastfeed is actually is more. Okay, so less than 1500 gram requires 80 ml per kg per day, more than 1500 grams requires 60 ml per kg per day. So this is extremely important and you have to remember this. Less than 1500 80, more than 1500 60. Okay, good job. Next important part. Yes, next important part. Dr. Keval, you want to read colostrum composition. But we will have a separate doubt solving session. Okay, I'll take your doubts. Okay, don't worry. We'll take your doubts in the end. Okay, coming on to modes of feeding. Yes, modes of feeding. Okay, so देखो बच्चे, modes of feeding ना रट्टा मारना है, रटना है. ठीक है, you're supposed to cram the modes of feeding anyhow. That if the baby is 28 weekers, how to feed the baby. If the baby is more than 28 weekers, how to feed. If the baby is 32 weekers, how to feed. If the baby is 34 weekers, how to feed. अब इसको याद करने के लिए, just to remember this, just to retain this in your brains, you have to understand that the feeding, okay, the feeding has got these letters FEEDING. So you have got in total 7 letters. Okay, you have got in total 7 letters, my dear friends. So 7 letters is this 7, and 7 is a sum total of 3 plus 4. So 3 plus 4 is equal to 7. That means whenever they will ask you this question of mode of feeding, you have to remember that feeding has got 7 words, and 7 means 3 plus 4 is equal to 7. So remember that 3 plus 4, that is 34. So your ultimate thing is 34 weeks. So if the baby is 34 weeks, give breastfeeding, no problem. So can you remember 34, F for 4, F for feeding. Okay, 34, F for, yes, 34, F for, okay, clear. Okay, F for 4, F for feeding. Coming on to next one, 32 weeks. So can you understand this 2 and S looks very similar. Okay, 32. So 2 and S looks very similar. That means for 32 weeks you are going to use spoon, you are going to use paladi for the feeding. Okay, and what about 28? So this is 8 and you cut it. So once you cut it, you will have 2 small golu golu things, gol gol. So gol gol is OGT, oral, okay, orogastric tube or nasogastric tube. So repeating, 34 3 + 4 7 फीडिंग का निमोनिक है ये, breast feeding. 32 2 and S looks very similar, so S for spoon feeding. 28 8 को कट करो, O for OGT, oro gastric tube, oro gastric tube. And if it is less than 28, so remember less than 28 कितना जिया, few weeks तो baby जिया है, because baby is less than 28 weeks, so baby has lived only few weeks. So few means fluids, so you are going to give IV fluids, you are going to give the nutrition IV, you're going to give the nutrition IV. Sometimes in their question they write if not tolerant, if not tolerant. Now what does this mean, if not tolerant? See, at 34 weeks, if the baby is not tolerating breastfeed, you are going to give spoon. If the baby is not at 32 weeks not tolerating spoon, you are supposed to give OGT. If at 28 weeks baby is not tolerating OGT, you have to give IV. ठीक है, तो एक बार फिर से मैं आपको बता देता हूँ. 34 F for 4, F for feeding. 32 2 and S looks very similar, so you have to feed by spoon feeding. Then 28, so 28, that is few for fluid. Okay, so अगर ये ट्रिक पसंद आई होगी तो फटाफट से एक हार्ट जो है वो ड्रॉप कर दो. इफ यू हैव लाइक्ड दिस, ओके, इफ यू हैव लाइक्ड दिस ट्रिक, quickly give me hearts in the comment section so that you know we can quickly go ahead. Yes, thank you Irsa, thank you so much bache. Okay, thank you Vishwajit, thank you Bilal Hussain, Manisha. Amazing, good bache, good. Coming on to next FMGE question. This is itself a previous year question of FMGE, my dear chotu bachas. What are the contraindications of breastfeeding? So understand, contraindications of breastfeeding can be because of baby, can be because of mummy. Okay, so if the baby is having galactosemia, if the baby is having galactosemia, or if the baby is going to have lactose intolerance, please don't give milk to my baby. Okay, if the baby is having galactosemia or lactose intolerance, please don't give feed to the baby. Okay, coming question for all my FMG bachas, for all the superheroes sitting on that side of the screen. Tell me which is the enzyme deficient in galactosemia. Yes, quickly tell me which is the enzyme deficient in galactosemia. Very good, quickly tell me. And also tell me what is the eye manifestations in galactosemia. Yes, eye manifestation in galactosemia. गाल्ट, वेरी गुड, अमेजिंग. यार तुम लोग, यार तुम्हें पढ़ने की जरूरत ही नहीं है, तुम लोग सुपर. मेरे मुंह से कुछ निकल, आई मीन क्या मैं तुम्हें बोलूं, यू गाइस आर सुपर. यस, व्हाट इज द आई मैनिफेस्टेशन? रवि भाई, रवि डॉन, तौफिका, मदासुजी, करेक्ट, वेरी गुड. ऑयल ड्रॉप्ड कैटरैक्ट. ये तो तुमने क्या किया, ऑल दोस पीपल हु आर नॉट स्टडिंग पीडियाट्रिक्स विद अस, उनके सपनों पे तेल फेर दिया, पानी नहीं तेल फेर दिया. ऑयल ड्रॉप कैटरैक्ट. सौरभ, मेडिकल एस्पिरेंट, अमेजिंग. ऑयल ड्रॉप कैटरैक्ट, सुपर्ब किड्स. Coming on to mother, chalo, let's understand about the mother. So if the mother is having taking radiotherapy, if the mother is having taking chemotherapy, please don't give feed to the baby. But what are the relative contraindications? Okay, relative contraindications. So please understand that breastfeeding, a mother should be advised. Mother, if you want to breastfeed, please don't chit chat. Mother, if you want to breastfeed, please don't chit chat. Okay, so so breastfeeding, and of course B and C comes very close. So the contraindication to the breastfeeding can be remembered with this mnemonic of CHAT, chat. So what is CHAT? C for chicken pox. If the mother is having chicken pox, oh my god, active lesions, not healed one, active lesions of chicken pox. Mother, please don't feed the baby. Active lesions of the chicken pox. H for herpes. H for herpes. H for HIV. Please don't feed the baby, mother. A for abscess. If there is breast abscess, please don't feed the baby. And what about T? T is TB. So anti-tubercular drugs less than 2 weeks. Okay, if you are giving the anti-tubercular drugs to the mother, and mother less than 2 weeks, okay, in all these conditions, advise the mother not to, okay, advise the mother not to feed the baby. Chalo, all my dear FMG students, a question coming to you. What is the most common cause of breast infection during lactation? What is the most common cause of breast infection during lactation? And what is its source? Yes, what is its source? Quickly tell me. स्टाफ विश्वजीत, विश्वजीत तुम्हारी विश्व में जीत होगी. स्टाफ वेरी गुड, वेरी गुड. विश्वजीत इज द वन टू टेल. वेरी गुड. यस, व्हाट इज द सोर्स? यस, व्हाट इज द सोर्स? बेबी सलाइवा. नलिन जी, नलिन, नलिन प्रभात, नलिन, यू आर गोइंग टू secure first rank in FMG. Pakka, promise. That's going to be the saliva of the baby. ठीक है, बेबी सलाइवा इज द सोर्स. अमेजिंग, अमेजिंग यार, सुपर्ब किड्स यार, सुपर्ब किड्स. चलो बच्चे, coming on to the next part. Okay, now tell me the answer. If a fetus is born to a diabetic mother, if the fetus who is born to a diabetic mother, the fetus is going to have hypoglycemia or hyperglycemia. Quickly tell me in the chat section, the fetus is going to have hypoglycemia or hyperglycemia. Yes, bachon. Quickly tell me. Hypo, hypo, hypo. Vishwajit says hypo. Vishwajit says hypo. Shagun says hypo. Taufika says hypo. Okay. But DDD says hyper. Okay, 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 okay. Everybody is saying hypo. Oh my God. So the glycemia might be hypo, but your victory is going to be hyper. Victory is going to be hyper. So my dear kids, yes, this is a very good concept. Please understand that till the time the baby is a fetus, till the time the baby is a fetus, that means the baby is inside the mother is going to give insulin. Okay, the mother is going to give insulin, okay, via the placenta. But in infants there is no insulin which is going to be there. Okay, infants, there is no insulin which is going to be there. Okay, right? Okay, okay, okay. So समझ में आ गया आप लोगों को? Yes, is it clear to you? Yes, I think students have written hypo. Oh, hypo, hyper, hypo, hyper. Okay. Okay, okay, okay. So because of baby insulin hypoglycemia. Yes, bache. So bache, please understand that, you know, the question is baby. Okay, the baby, I mean, the question is fetus. Okay, the question is fetus. It is not the infant. The infant is going to have hypo. Okay, the infant is going to have hypoglycemia. Definitely the it is going to have hypoglycemia, but the fetus is going to have hyperglycemia. Okay, the fetus is going to have hyperglycemia. Okay, Vishwajit, bache, you are slightly I mean, not only Vishwajit, but there are so many kids who did it wrong. Bache, please understand, the question is about fetus. It is not about the infant. The infant is going to have hypoglycemia, but the fetus is going to have hyperglycemia. So please read the question carefully, bache. Please read the question carefully. See, what happens in fetus is that the mother is going to supply the or give the glucose. So the baby is going to have hyperglycemia. But in infants, the mother is not going to give the glucose. Plus, the insulin levels in this baby is high. Why? Because, see, understand, during fetal life there was a lot of glucose which was entering in this fetus. So fetus was in habit to increase the amount of insulin in them. So that's why in infant there is a lot of insulin but no glucose, since there is cut off from the mother. Okay, so you will have what? You will have hypoglycemia. Honey says I wrote hyper. Honey बच्चे, you will be getting a superb seat. You will be getting a super seat. ठीक है? And of course screening exam है, तो वो तो आप लोग बहुत अच्छे से clear करोगे ही. चलो बच्चे. Now quickly tell me, what is the most common heart abnormality in infant born to a diabetic mother? What is the most common? Yes बच्चे. What is the most common heart abnormality? Most common heart abnormality. Quickly tell me, bache. VSD. Very good, Tejasri. Very good, Meena ji. Very good, Nalin. Very good, Shagun. This is VSD. Now, quickly tell me, what is the most specific abnormality? What is the most specific abnormality? Hanji, bacho. Oh shit. I show you the answer. Most specific, bache, most specific. No, bacha, TOF is not the right answer. VST, VST. Dr. Y.M. Bharul, it is VST. Hanji. What is the most specific sacrilegenesis? Tejasri, Saurav Kumar, Sushil, Meena ji, all of you are going to become Indian medical graduates and you are going to treat Indians from Gujarat, from Punjab, Sindh, Gujarat, Maratha. Soon you are going to treat every one of them. Great, bache. Great, 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 great. Okay, okay, okay. My superb children, my beautiful children. Okay, but you please don't make it wrong. VST is actually very common. Okay, so V for VST, V for very common. Okay, V for VST, V for very common, and caudal regression syndrome is actually the most common one. So more, I mean, more specific. So S for specific, S for sacrilegenesis. This is how you can remember. Okay, very good, very good. करेक्ट 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 चलो बच्चे चलो 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 अमित से सिंध पाकिस्तान हाँ तो पाकिस्तान वालों का भी इलाज करना है आप लोगों को इनफैक्ट दे नीड मोर डॉक्टर्स coming on to APGAR score now. Okay बच्चे, so we have seen this lecture, I mean we have seen this question so many times. APGAR score they have asked. So my dear children, you just remember that what is APGAR. So APGAR has got three things. Okay, so APGAR has got three things, three scores. This is 0, this is 1, this is 2. And the mnemonic to remember APGAR is APGAR itself. APGAR. The mnemonic to remember APGAR is APGAR itself. A for activity. A for activity. P for pulse. G for grimace. A for appearance. R for respiratory effort. Respiratory effort. Okay. So, uh, um, so pulse is an activity, isn't it? So pulse is an activity, right? And the pulse is an activity. One thing which you can remember. Okay, so I used to remember like this, that whenever my crush, okay, so beautifully appearing crush, whenever my crush used to used to just smile like this, I used to take a sigh of relief, and my heart rate, which is an activity, goes increasing. So this is my way of remembering it, that whenever my crush used to smile, that is grimace. Crush, that means beautiful appearing crush. तो जब भी वो हंसती थी, grimace, I used to take a breath of sigh, and then of course pulse rate goes to increase. That is pulse activity, pulse, which is an activity. So APGAR, A for activity. So please understand, 1 is something that is actually normal. Okay, and 0 everywhere is going to have nil, 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 nil. Activity, nil. Limp. Okay, so you will see the child will be limping. No tone, no activity. Pulse. Okay, pulse. Okay, pulse, nil. Grimace, no response. Appearance is going to be blue appearance. Okay, appearance is going to be blue. Why? Because see, there is no oxygen which is reaching to the baby. Okay, oxygen which is not reaching to the baby. Okay, so since it is not reaching to the baby, what is going to be there? It is going to be blue. Okay, and after that you have got respiratory efforts. Okay, after that what you are going to have? You are going to have respiratory efforts. So these are also nil in case of what? In case of 0. But what about 1? So please understand that 1 is going to show you flexion. So please understand, somebody who is going to have rank 1 in FMG is going to flex their self, their rank is going to flex their rank. So 1 is going to be whenever there is some flexion. Okay, and from 1 you can remember less than 100. Okay, less than 1, less than 100. Grimace is going to be grimace. The baby is not going to show much things, but then the baby is going to smile a little or like that. Okay, coming on to the most important point, where most of the FMGE examiner are going to, yeah, they are going to, yes, they are going to do what? They are going to confuse you. Okay, so pink body, extreme extremities are going to be blue. Pink body, blue extremities. See, the extremities are going to be blue, but the body is going to be pink. Body is going to be pink, the extremities are going to be blue. Okay, clear? So in this case, so please understand that the extremities are blue. The extremities are blue, the body is actually pink. Okay, so there is peripheral cyanosis only, that is called as acrocyanosis. Acrocyanosis. So how to remember? See, one, the first letter of ABCD is going to be A alphabets, and the child is going to have acrocyanosis. The child is going to have what? The child is going to have acrocyanosis. Of course, there's going to be a slow breathing if the respiratory efforts are not good. Okay, but what happens in 2 we will have good flexion, more than 100 per minute of rate. Grimace, the child is going to cry, cough, sneeze, pink all over the body. Now see, understand, there is no cyanosis if you are going to give 2 points. Okay, and the child is going to have a good cry. The child is going to have a good cry. Okay, good bache. Coming on to the total. So please understand, APGAR, APGAR has got 5 letters. Okay, and 5 twos are 10. So total, if somebody asks you, APGAR score is going to have 10 in total. And you know, APGAR 5 letters, SEVEN 5 letters. So 7 is also going to have 5 letters. So the less than 7 is considered to be low. Okay, and the reason is going to be birth asphyxia. Okay, okay. Yes, so birth asphyxia, and normal is between the 7 to 10 is considered to be normal. Okay, considered to be normal. Acha ji, acha. So Desi is writing, sir, we have notes. Yes, I know that you have got notes. I was hiding some of the parts to ask you the questions. And एक बच्चा है डॉक्टर केवल, he writes, एक आशिक ही शायर बनता है जैसे आप हो. अच्छा जी, ओके. सो और शायरी सुननी है तो लिखो कमेंट सेक्शन में शायर शायर शायर, और फिर सुनाते हैं आप लोगों को एक शायरी. क्योंकि पीडियाट्रिक्स से ज्यादा तो आज हम एक दूसरे का मोटिवेशन बढ़ा रहे हैं, है ना. आप मैं निमोनिक लिखता हूँ, बच्चे लिखते हैं नाइस निमोनिक्स. बच्चे ये आपका जो छोटा छोटा मोटिवेशन है ना, ये हम लोगों को बहुत मोटिवेट करता है आगे बढ़ने के लिए. ठीक है. इरशाद, अरे बाप रे, विश्वजीत जी. आशिक अली, आपका तो नाम ही आशिक है, आप तो बदनाम हो गई ना. आशिक तो बदनाम होते ही हैं. हाँ. चलो 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 चलो, अभी शायरी नहीं सुननी. शायरी नहीं, गजल. अच्छा, मीना जी गजल भी सुनाएंगे. ठीक है, गजल भी सुनाएंगे आपको. हाँ, चलो बच्चे. ओके, coming on to next part, that is called as modified Bell's staging for NEC, that is necrotizing enterocolitis. necrotizing enterocolitis. देखो, वैसे तो ये पूरा टॉपिक ही बहुत इंपॉर्टेंट है, necrotizing enterocolitis, but the main important part for NEC, for necrotizing enterocolitis, is going to be, yes, is going to be what? The staging. The staging is the most important part of necrotizing enterocolitis. ठीक है, necrotizing enterocolitis. अच्छा, ठोकोदार. बच्चे शायरी सुनेंगे, एक बार पहले ये पढ़ते हैं ये टॉपिक, उसके बाद आप लोगों को एक शायरी भी सुनाता हूँ. ठीक है, चल. So coming on to stage 1. So remember, stage 1 has got 1A, stage 1B. Okay, stage 1A, stage 1B. ठीक है. अच्छा, देखो मेरा मन ही नहीं लग रहा है. हाँ, कौन बच्चा था जिसने बोला कि दिल टूटता है तो ही शायर बनता है इंसान? कौन था भाई? नाम भूल रहा हूं मैं. मुझे नाम ही नहीं मिल रहा है. ठीक है. चलो जी. ठीक है ठीक है ठीक है. हाँ जी हाँ जी, बिल्कुल बताएंगे, बिल्कुल बताएंगे. चलिए, डॉक्टर तितिक्षा इज ऑल्सो विद मी. हेलो हेलो हेलो. चलो जी. अच्छा, मॉडिफाइड बेल स्टेजिंग की हम लोग बात करते हैं बच्चे, नेक्रोटाइजिंग एंटेरोकोलाइटिस की बात करते हैं. हाँ, डॉक्टर केवल जी, केवल जी आपके लिए एक शायरी जरूर सुनाएंगे. ठीक है. चलो, सो बेसिकली प्लीज अंडरस्टैंड द इम्पोर्टेंट पार्ट. 1 सेकेंड. हाँ बच्चा. चलो बच्चे, सो अब मैं आप लोगों को बता रहा था अबाउट द नेक्रोटाइजिंग एंटेरोकोलाइटिस. तो देखो कैसे इसको याद करना है, हाउ टू रिमेम्बर. ओके, see bacha, stage 1 has got 1A 1B, stage 2 has got 2A 2B, stage 3 has got 3A 3B. So how to remember? See, 1A is going to have abdominal distension. ठीक है. So A for A means A for abdominal distension, which is actually non-specific sign. So 1A has got some non-specific signs. Okay, 1A has got what? 1A has got a non-specific sign. ठीक है, non-specific sign, that is abdominal distension. then you have got 1B. So please understand, see, focus here, it has got B and L, it has got B and L. So L is less looking like 1 and B is B. So 1B is actually BL, okay? 1B is actually B and L. So remember B and L, okay? Blood in stools. What about stage 2A? So please remember A for air, A for air. So pneumatosis means you have got air filled in the intestine. Air filled in where? Air filled in the intestine. So 2A is going to have air in the intestine, but in 2B there's going to be air, but where? Air in the portal vein, air in the portal vein. So can you understand बच्चे? देखो B और P एक जैसा दिखता है. B and P looks very similar. So stage 2B is going to have P. That means P means portalis, pneumatosis portalis. Stage 3A is going to be peritonitis. So देखो peri 3 peri. So this is how you can remember that stage 3 is going to have what? Peri 3. So peritonitis is 3A and 3B is going to be pneumoperitoneum. So whenever a word peritoneum is coming, just like peritonitis is going to be 3A, whereas pneumoperitoneum, this word is going to come in 3B. This word is going to, yes बच्चे, air in the intestinal wall. Correct है केवल, बिल्कुल सही बात, correct एकदम. Okay, so what you are going to do now, whenever you are going to have air in the peritoneum, you are going to perform laparotomy. You are going to perform what? You are going to perform laparotomy. Otherwise the only treatment is that don't give anything extra into the gut. So keep them nil per oral, keep them in total parenteral nutrition, and of course antibiotics have to be added. Broad spectrum IV antibiotics have to be added. Chalo bachcho, time for the question. Now quickly tell me, what is the location of Morgagni's hernia? Yes, what is the location of Morgagni's hernia? चलो बच्चों जल्दी जल्दी बताओ. Yes, tell me quickly. Pneumoperitoneum, football sign. Yes, partially correct. Diaphragm. Lulu says diaphragm. Diaphragm, anterior, left posterior. Posterior, lung left. कुछ भी चलेगा आप. Anterior right, correct. Very good. Anterior right is the correct answer. And the first one to give the correct answer of Morgagni's hernia is Dr. Reshma. Very good, Dr. Reshma. Saurabh. Very good, bache. Very good, Kalingiri Prabhat. Anterior part of the diaphragm. So very simple, very understand. This is my mnemonic to teach you. Yes. Okay, bacho, quickly see here. Intestinal air bubbles. Can you see? So why there are air bubbles in intestine? The diagnosis is congenital diaphragmatic hernia. That means in the diaphragm there was space. So the loops of intestines have have entered in the thoracic cavity. That is called as intestinal air bubbles. That is called as congenital diaphragmatic hernia. Yes, left is some other area hernia, that is called as Bogdalik's hernia. So the mnemonic is Morgagni's hernia. So R for right, A for anterior, M for Morgagni's. Okay, so Morgagni's hernia is going to be what? Morgagni's hernia is right anterior, whereas Bogdalik's hernia, B for Bogdalik's hernia, and Bogdalik's hernia is going to be L for left. Okay, L for left. Very good, मेरा बच्चा. Very good. Good बच्चे हैं सब. All the बच्चास are actually good बच्चास. Okay बच्चा, चलो. Now coming on to some IBQs. What is IBQs? Now IBQs means image based questions. Okay, so IBQs means what? IBQs means image based questions. So what are the image based questions, bache? Okay, somebody is telling that these hernias are contraindications to positive pressure ventilation. Yes bache, that's absolutely correct. Chalo bache, so image based questions, they will ask you which is this image. This is erythema toxicum, which is a normal newborn finding. This is erythema toxicum. Okay, what is this bache? This is pustular melanosis. Can you see? These are the pustules. These are what? These are the small chotu pustules. Pustular melanosis. Okay, erythema toxicum, pustular melanosis. This is what? This is called as milia. So these are milky white spots. This is also a normal finding. This is called as milia. Okay, this is called as milia. What is this? This is Bohn's nodules. Bohn's nodules. This is some TD appearance in the gums. This is Bohn's nodules, and this is actually normal finding. Epstein pearls. Yes, can you see this? These pearls on the palate. These are the Epstein pearls. Okay, so remember this Epstein's pearls, P for palate. So Epstein's pearls are going to be there on the palate. These are the images, important newborn images. This is also important, strawberry angioma or stroke bites or salmon patch. Okay, these are what? These are all your strawberry angioma. Okay, strawberry angioma. चलो my dear छोटे छोटे बच्चे फटाफट बताओ. If I ask you, strawberry tongue is seen in. Yes बच्चे, strawberry tongue is seen in. Quickly tell me. Yes, quickly tell me. Strawberry tongue. Scarlet Kawasaki, Scarlet Kawasaki, Scarlet. All of you are superb, guys. All of you are actually superb, huh? Kawasaki disease, scarlet fever, both of them are going to have what? They're going to have strawberry tongue. Very good, very good, very good. And what is this? These are the Mongolian spots. What are these? These are the Mongolian spots. Very good, bache. Okay, so do you know some more normal findings? Yes, quickly tell me. Do you know some more normal findings? Chalo batao. One is going to be vaginal bleeding. Yes. Next, pre-deciduous teeth. Okay. Yes. Some more. Quickly. Hanji. Some more. Some normal findings. Monisha says, okay. Yes, hymenal tags. Yes, hymenal tags. These are also normal finding. Very good. Very good, kids. Very good. So all these are also normal findings which you have to understand. Chalo bache, coming on to the normal newborn. So what is the length of the normal newborn? 50 centimeters. Okay. So normal length of the normal newborn is going to be 50 centimeter, and the head circumference of a normal newborn is going to be 35 centimeters. Okay. So head circumference is going to be 35 centimeters and the length is going to be 50 centimeter. But I have seen people, they get confused in remembering this. So just remember HEAD, head. So head has got 1, 2, 3, 4, 4 letters. So one thing before 3, one thing after 5. So 35 centimeter is actually the head circumference. Okay, this is the head circumference. Head is equals to chest circumference at what age? This is an FMGE question. Okay, so FMGE, it was asked in FMGE. Yes, it was asked in FMGE that, the head circumference becomes equal to the chest circumference when? So remember, at 9 to 12 months, there is no difference between the head and chest circumference. They become equal. So remember, no means no means no difference. So no difference. Okay, so there is no difference in head and chest. Okay, head and chest circumference becomes equal at 9 to 12 months. Bache, jaise hi, whenever I write a mnemonic and you like that mnemonic, just write down, just give some good emojis in the comment section, some stars, some first rank, some gold medal, some hearts, some, so that we can motivate each other. Yeah, this is not a journey where I will win. Okay, if I teach good, I'll be the winner. No, it's the journey where my students are going to win, and once my students are going to win, I will be the winner. Yes, I will be the winner then. Okay, I can see so many hearts coming. Thank you so much, my dear kids. So lovely to see you. I'm just overwhelmed, thankful to the God, and just praying for all of you to win. Okay, I'm just waiting for the victory of all my little kids. Anji, the Glenmark, Siddhartha, Monisha, Kalingari, then you have Tofika, Shakil, Fatima. सब लोग जीत जाओ, सब लोग जीत जाओ, इतना लड़ो, fight as much you can, and once the day when you will win na, I will give my hearts to you guys. I will give you the surprise. You will be the people who will decide where my victory is. Okay? Aruna, hmm? Asik Ali, huh? So my victory is your victory. Your victory is my victory. Huh? Siva Bharati. I'm going to give my 100% for you guys. But if you want me to come prepare for some other lectures for some other subjects lecture also, I will be there for you. But I just want you people to win in your life. Imagine that beautiful smile your parents are wearing when you are selected in FMGE. I can still, I can still feel that one vibe when I cleared my NEET PG, and I was crying, my mother was crying, everybody in the family was crying, was hugging each other for that one feeling. Mere bachon, put your heart and soul in it. Chalo, coming on to upper segment to lower segment, upper segment, lower segment. And you know what, I am not the teacher who is going to teach only to the toppers. My goal is to make a super 30 batch. I just want that the people who are, low, they have to come up, and the ones who are up, they have to, sorry. Okay. So basically, I am focusing on those students who don't know anything. I just want them to rock. Okay. Right. Because agar main lower ko or lower karunga, if I will make the lower people lower, the people who don't know sufficient things, if I'll discourage them कि जाओ तुम्हें कुछ नहीं आता, मैं हार जाऊंगा, मैं हार जाऊंगा. Okay, so this is my mnemonic. बातों बातों में mnemonic आ गया. I was talking and I gave you a mnemonic. What is the mnemonic? Mnemonic says that upper segment to lower segment ratio, upper segment to lower segment ratio is disturbed, is reversed. That means lower is getting more lower, upper is getting more upper. So upper segment to lower segment ratio, if upper is getting more upper, lower segment lower is getting more lower, what is going to happen? This upper segment to lower segment ratio is increased, and this is my mnemonic, that is HAR. H for hypothyroidism, A for achondroplasia, and R for rickets. Okay, so have you got my mnemonic? मैंने कहा upper segment to lower segment ratio is going to increase, is going to increase if LS is decreasing, if US is increasing. What does this mean? Lower is getting more lower. यदि lower वाले बच्चे और lower हो जाएंगे, 140 130 पे अटके हुए बच्चे अगर और कम हो जाएंगे, तो मैं हार जाऊंगा. हार is hypothyroidism, achondroplasia, and rickets. So upper segment to lower segment ratio is going to increase. Okay, is going to increase. Yes, but checking of alpha, yes, you are correct. So what is the normal upper segment to lower segment ratio? So in newborns it is approximately 1.7:1. It is 1.7:1 in the newborn. Okay, so people come and say, sir, hum bhool jate hain, sir, we forget what is the normal upper segment to lower segment ratio. Bachcho, don't worry, I am there for you. I am there for you. Newborn, 1, 2, 3, 4, 5, 6, 7. 7 letters. 1.7:1 is the upper segment to the lower segment ratio. 1.7:1. And at 7 years, is going to be 1:1. In adults, it is approximately 1.9:1. Chalo, theek hai. Don't learn these values, I'll tell you. But at newborn, you should know that it is 1.7:1. 1.7:1. Dinesh Reddy says, I love your teaching, sir. Are bachcho, Dinesh, I love you guys. You are the reason why I'm teaching this. You are the reason. Your victory is my victory. एक तो दिन आएगा ना जब तुम लोग जीतोगे, उस दिन मेरी जीत होगी. आई एम जस्ट वेटिंग फॉर दैट डे टू कम. आई एम जस्ट वेटिंग फॉर यू पीपल to keep your eyes into the eyes of FMGE exam paper and tell the FMGE paper that I am the winner. I am the winner. Huh? Correct, बच्चे. चलो बच्चे, चलो चलो चलो. That's great. That's great. Coming on to Meconium Passage. So please understand, हम लोग बोलते हैं if you want to pass the stool, we say 2 number जाना है. And stool, S for stool, S for second. So just remember that the stool is passed at second day. The stool is passed at second day. Stool passed second day. So 99% of the people of the newborns within 40 to 48 hours, second day, they are going to pass the stools. And urine passage, that's हम बोलते हैं 1 number जाना है. So 95% pass in 24 hours, 99% pass in the 48 hours. Okay. Coming on to one important thing, that if there is a delayed passage, what can be the cause? So Hirschsprung disease and cystic fibrosis. See, in both these conditions, what is the problem? The problem is with the ganglion. So the ganglion which are responsible for doing the peristalsis are not working properly. That's why you are going to have retention of meconium. You are going to have what? Yes, correct. you are going to have what? Cystic fibrosis, and in Hirschsprung, you are going to have what? You're going to have delayed passage of the meconium. Urine not passed. Oh my God, urine not passed. So what can be the case? See what happens in no urination. Okay, so so you know what? Remember this, that there is something which is called as Potter's sequence. Now what is Potter's sequence? So Potter's sequence means that you have got bilateral renal agenesis. You have got bilateral renal agenesis. Kidney nahi hai. Kidney nahi hai, then what? Then you know very well that the amniotic fluid is because of what? Amniotic fluid is because of urination. Now if there is no kidney, there is going to be maternal oligohydramnios. Maternal oligohydramnios is going to be there, and that is why the child is going to get no fluid, no fluid outside around them. So the child is going to stuck itself on the walls of the uterus. That is why the face is going to be like Pichkavamu, and the child is going to have Potter's facies. The child is going to have Potter's facies. So what is the triad of Potter's? What is the triad of Potter's? So remember this, that the Potter's triad is going to be renal agenesis, oligohydramnios, and Porter facies. Renal agenesis. Okay, so renal agenesis is going to be there. So just remember. Okay, I'll give you the mnemonic here. So Potter, Potter. So Potter has got mnemonic. What is the mnemonic? Remember, ER or RE is going to be renal agenesis. Okay, O for oligohydramnios, and P for Potter's face. Okay, P for Potter's face. So this is how you can remember, my dear good children. Okay, bacho, coming on to the next important part. If urine is not passed, of course, one of the causes Potter's problem. Next is going to be posterior urethral valve. Next is going to be posterior urethral valve, and this posterior urethral valve has got a mnemonic of PCM. C for cystoscopic fulguration. C for cystoscopic fulguration. That is actually the treatment. So देखो क्या होता है? What happens in posterior urethral valve? So this is your bladder. This is your bladder, and in this bladder, this is the urethral valve. So if the urethral valve is posterior, okay, if the urethral valve is posterior, of course the urine can't come down, and if the urine can't come down, there will be no urination. So what you have to understand, that this posterior urethral valve is also responsible for no urination. So the mnemonic you have to understand in posterior urethral valve. So they go medical people, they take PCB, they go ahead in life. PCM, they fall posterior. So P for posterior. So P for posterior urethral valve. Okay. So take PCM, you will be for backward. We are taking medical, we are medical graduates, we will go ahead. So what is PCM? P for posterior urethral valve. C for the treatment. What is the treatment? Cystoscopic fulguration. So you put a cystoscope inside and you burn that valve. Cystoscopic fulguration. And what is M? M for micturating cystourethrogram is the investigation of choice. Okay, is the investigation of choice. Jai Dr. Dikshit. Are bapre. Hi everyone. So just remember this, that you know, this is, yeah, this is going to be micturating cystourethrogram. Okay, cystourethrogram. Okay, my dear. जय लक्ष्मी, बाप रे चलो बच्चों, चलो अच्छा बच्चों, आ जाओ इस वाले क्वेश्चन पे आ जाओ. Come on to this question. Hirschsprung disease. The hint in the question is going to be explosive stools on DRE, explosive stools on digital rectal examination. So whenever you will perform a digital rectal examination, there will be explosive stool that is going to come out. Okay, so the explosion of the stool is going to come out. Okay, so this explosion of stool you must have seen in Rahul Gandhi's speech also, sorry, but then explosive stools on digital rectal examination. Okay, yes, correct. Okay. Chalo bachcho, chalo. Coming on to okay, just let me ask you a question. In Hirschsprung disease, there is an absence of which ganglion? There is an absence of which ganglion? Chalo, quickly tell me. Absence of which ganglion is there in Hirschsprung disease? Yes, keyhole sign is there. Correct, bache. Hi, Dinesh Reddy is from Procyon. So, okay. So if Dr. Dinesh is the Dr. Dinesh which I am suspecting, thank you so much, sir, for all the opportunities. And I can see my beautiful children, they are working hard. I am there for them. We both are rocking and we are both are going to be very successful. Neuronal Miziners or my Miziners, very good. Sushil Yadav and Dr. Keval. Miziners is the correct answer. Orobex is the another name for that. Very good. Very, very good, very good, very good, very good, Nirisha. Yes, amazing. Yes, Vishnu, it's important. All these topics are important. Are your previous year questions also? Very good, Saurabh. Very good, Tofika, Asik. Superb, bache. Superb. You are the shining stars. Chalo, bache. Coming on to cardiac arrest algorithm. I know that, I have seen this cardiac arrest algorithm is a weakness of a lot of my FMG graduates, but don't worry, अपुन है, अपुन तुम्हारे लिए सब कुछ करेगा. ठीक है, अपुन जो है ना वो तुम्हारे लिए सब कुछ करेगा. I am there. I am going to do everything for you, make everything easy for you. So, do you know this man? Yes, who is this man? Quickly type in the chat box. Who is this man? Hmm? Who is the man? Who is this man? And who is this man? Huh? Bapre, bapre. Chalo, chalo, chalo. So there is a very famous dialogue. Huh? Modi ji has got a very famous dialogue, and the dialogue is "Wah, kya scene hai." Huh? So Modi ji has got a dialogue that says "Wah, kya scene hai." And this guy always says "Pakak." This guy always say "Pakak." Okay, so this is something which you have to remember, and if you remember this, the things are going to be क्या बहुत simple हो जाएगा, बहुत simple हो जाएगा याद करना. So this guy always says pakak, this guy always says pakak, and this guy says वाह क्या सीन है, वाह क्या सीन है. देखो ये निमोनिक पसंद आएगा ना तो चॉकलेट्स भेजना है मेरे को, ठीक है. You will give me chocolates. Aruna says, is this enough? बच्चे इतना तो करो, do this at least, and then I'll conduct another class also. If you want now, I'll conduct another class, another subject class, everything I'm going to give you, but just focus on what you are doing, my dear Aruna. Asik says address भेज दो. Address क्या? अरे chocolate में give chocolates in the comment section, don't give chocolates physically. चलो चलो, listen to the mnemonic. वह क्या scene है? So please understand, if you are suspecting cardiac arrest, please understand, if you are suspecting cardiac arrest, you have to check the pulse. Check the pulse. P for pulse. ठीक है. So check the pulse. Okay. So if the pulse is if you see the pulse and the pulse is there, then you have to check that is the rhythm shockable rhythm or not shockable rhythm. If the rhythm is shockable, that means the condition is either ventricular fibrillation or PVT. Okay, ventricular tachycardia. So either it is ventricular fibrillation or it is going to be ventricular tachycardia. Okay, right? Understood? So ventricular fibrillation, ventricular tachycardia. So anything for that matter is going to start from V, and V is going to be ventricular. Ventricular fibrillation, ventricular tachycardia. So wah kya scene hai? So what is the sequence? Now what you will do? So S for give shock. Okay, and then start CPR. S for shock, C for CPR. Okay, then N for, now you have to reassess the rhythm. Okay, you have to reassess the rhythm, and then you have to reassess the rhythm. And once you reassess the rhythm, okay, so this is R for reassess the rhythm, and then you have to repeat the cycle. So R is reassess, and after reassess you have to repeat the rhythm, and once you repeat the rhythm, that is shock, that is CPR, and then again you check the rhythm, and now you are supposed to give what? Epinephrine. You are going to give what? You have to give epinephrine. Okay, epinephrine. Okay, epinephrine. So this is the mnemonic you are supposed to remember. Okay, this is the mnemonic. So वहाँ क्या scene है? V for ventricular, either ventricular fibrillation or paroxysmal ventricular tachycardia. Just 1 second. Okay, paroxysmal ventricular tachycardia, and then of course 1 second, बच्चे. Paroxysmal. So sorry. Now I think it's fine. Yeah, paroxysmal ventricular tachycardia and ventricular tachycardia. You can easily remember that you have got the shock, then CPR, reassess, repeat, and then epinephrine. Whereas, yes, coming on to this man, Pakak, yeah, sitting on the lap of Sonia Gandhi ji, Pakak. So what is Pakak? P for either P wave absent or pulseless. Either P wave absent or pulseless. So please, my dear, understand that P wave absent or pulseless means, see, if the P wave is absent, this is asystole. If the P wave is absent, this is asystole. And next P is pulse. Pulse absent means it is electrical activity. So pulseless electrical activity. So P for pulseless electrical activity. So in both of these conditions, see, the rhythm is not shockable. Okay, the rhythm is not shockable. So if the rhythm is not shockable, what we are going to do? PCAC is the mnemonic. P for P wave or pulse is going to be absent, and PCAC is C for give the CPR immediately, then give epinephrine, then give CPR, then E for epinephrine. So this is how you are supposed to give the treatment. This is how you are supposed to give the therapy. चलो, अगर राहुल गांधी और मोदी जी की जो भी नोकझोंक है, so if you have liked this mnemonic, quickly send me the chocolates. I'm waiting for the chocolates. I'm waiting for the chocolates. Dear children, I'm waiting for the chocolates. Waiting for the chocolates now, huh? So Papu Pakak, oh, good mnemonics, huh? Chalo, thank you for the chocolates. Thank you for the chocolates. Is it stuck? No, it is not stuck. Okay, no, it is not. Okay, okay, Asik. Okay, bache. Okay. Coming on to the next important thing. So what this lady is doing? Yes, what this lady is doing? Chalo, quickly tell me what this lady is doing. So she is performing which maneuver? Yes, which maneuver is this lady performing? Very good. She is performing Heimlich maneuver. So now coming on to a important thing. Chalo, let me just ask you this question. So a child was found choking after consumption of peanut. The child went unconscious after, yes, child went under unconscious after choking. What is the next step? What is the next step? Yes, quickly answer this question. What is the next step? Asikali says endoscopic. Nitish says backslap. Keval backslap. Nirisha CPR. No, bache, these are not the correct answers. The correct answer is going to be, yes, what you're going to do? Yes, what you're going to do? You have to start CPR. You have to start what? You have to start CPR. Why CPR? So the first person to give the correct answer is Nirisha Tipanna and Madusu Dipa Selvi. Yes, correct. So bache, next step they have asked and the patient is unconscious. So whenever you will see this word unconscious, C for CPR. C for CPR. Good. Dr. Strange. Tofika. Yes, Russian diary name. Yes, correct. Okay, so this is absolutely correct, Mera bacha. That's absolutely correct. So please understand, in choking algorithm, you have to check. The step one is going to be assessment if the child is conscious or the child is unconscious. If the child is conscious or the child is unconscious, Then if the child is conscious and less than 1 year, then you have to give 5 back blows, 5 chest thrusts. Okay. And what about the child who is more than 1 year? So you have to perform Heimlich maneuver. Heimlich maneuver in which you give abdominal thrusts. Okay, right? If unconscious, the best step is CPR, and then after each cycle you have to check the mouth. Okay, so you give the CPR, dishum dishum dishum, check the mouth, dishum dishum dishum. Okay, so remove the visible subject object. If anything is visible, just remove. If it is visible, don't blind sweep. Okay, blind sweeping is not recommended. Just remove. Okay, and continue the CPR cycles till the child is going to gain the consciousness, till the child is going to gain the consciousness. Okay, yes, got it. Okay, okay. Chalo bache, now let's understand about some questions. Like, they are fond of asking that if the child is unconscious, what are the next steps you are going to perform? Okay, unconscious child, and then they ask about the next steps. Okay. Uh, yeah. So this compression and everything I'm going to teach you. Don't worry. Let's understand about the unconscious, the next steps. But okay. So dear students, let me ask you something. Do you guys need a dinner break right now or not? Okay. So I can give you a dinner break for 30 minutes. You can take a dinner break and then we can resume. Yes. So if you want a dinner break, type dinner break in the chat. Okay. So everyone is saying, sir, complete complete this topic and then we will go for a dinner break. Okay, bache. Okay, I will complete this topic and then we can go for a dinner break. Okay, we will complete this topic and then we will go for a dinner break. डॉक्टर केवल सेज ब्रेक से पहले एक शायरी हो जाए. चलो ठीक है, एक शायरी सुनाते हैं, फिर टॉपिक पढ़ेंगे और उसके बाद ब्रेक पे जाएंगे. तो शायरी ऐसी है. या देखो, मेरा कोई दिल विल नहीं टूटा हुआ है, बट क्योंकि सब लोग सुनते ही वही लोग हैं जो यू नो जो लोग दिल टूटे होते हैं, तो एक शायरी सुना देता हूँ कि मैं खुद को इस कदर बर्बाद करता हूँ. मैं खुद को इस कदर बर्बाद करता हूँ कि जिस दिन शर्त होती है तुझे ना याद करने की, मैं उसी दिन तुझे याद करता हूँ. मेरी इसमें क्या गलती, मेरी इसमें क्या गलती कि मेरा दोस्त एक शायर है. शायरी तो वो करता है, मैं तो सिर्फ इरशाद करता हूँ. तो मैं मेरे सभी बच्चों के लिए शायरी करता हूँ, ठीक है, और बच्चे इरशाद करते हैं. हाँ, बहुत ही प्यारे बच्चे, बहुत ही अच्छा क्राउड है, बहुत ही गुड स्टूडेंट्स हैं, बहुत ही अच्छे डॉक्टर्स बनने वाले हैं. एंड सून यू विल सी दैट यू आर गोइंग टू हैव ब्रिलियंट रिजल्ट. हाँ, यू आर गोइंग टू हैव ब्रिलियंट रिजल्ट. चलिए बच्चों, चलो 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 चलो. अगर अब ऐसा कुछ क्वेश्चंस में दिया होगा तो आपको क्या करना है, नेक्स्ट स्टेप, ठीक है, आपको ऐसे देंगे वो लोग कि the child is unconscious. Okay, they'll give you like this, that the child is unconscious and the heart rate of the child is less than 100 per minute. Okay, and the heart rate of the child is going to be less than 100 per minute. So if that's the case, what you are going to do, so please remember, if heart rate is less than 100, so मैं क्यों बोलता हूँ, why I always say heart, ठीक है. So just remember one thing, that if the heart rate is there less than 100, you have to remember my name. My name is Parv. And second thing you can remember is I'm 100% right. So heart rate 100, less than 100, so 100, and remember my name Parv. So if heart rate is less than 100, you have to give P for positive pressure ventilation. You have to give positive pressure ventilation. 100 hearts de do, ठीक है. So heart rate is less than 100, so you have to start positive pressure ventilation if the heart rate is less than 100 per minute. And if there is cyanosis which is present. Okay, next is going to be the child is unconscious and there is the cyanosis which is going to be there. So from C you have to remember C. If there is cyanosis, you have to give CPAP. So consider CPAP. So CPAP is continuous positive airway pressure, so you have to consider CPAP in that case. And next you are having what? So after 1 minute of positive pressure ventilation, so if heart rate was less than 100, you started positive pressure ventilation. If there is cyanosis, you started CPAP. So after 1 minute of PPV, you have to reassess the heart rate. Okay, so they're going to ask you, the child was unconscious and then we gave 1 minute of PPV. Now what will you do? You are going to check the heart rate. You're going to check the heart rate. Now if the heart rate is less than 60, okay bacho, dekho. Now if the heart rate is less than 60, what you will call it as? If the heart rate is less than 60, it is called as bradycardia. It is called as what? It is called as bradycardia. And remember, I have already told you that P and B looks very similar. Okay, so P and B looks very similar. So see here, bradycardia, P and B. So P means you are supposed to give positive pressure ventilation. You're going to give what? Positive pressure ventilation is something which you are going to give. And of course B and C are close, so B and C. So C for what? C for chest compression. C for what? C for chest compression. So this is another thing which you have to remember. So if heart rate is less than 60, you have to give chest compressions. You have to start with PPV, and you know this, that the ratio of chest compression to PPV is 3:1, 120 events per minute, 90 compressions, 30 breaths. This is a potential question, potential area for question. So 3:1, 120 events per minute, 90 compressions, 30 breaths. This you have to understand. Oxygen, of course, 100% oxygen has to be given. Okay, and yes, after 1 minute, yes, after 1 minute of CCV and PPV, you have to reassess the heart rate. Okay, and if the heart rate is persistently low, so see here, persistently low, P has got E. So what is this E now? What is this E? E for start giving epinephrine. Start giving what? Start giving epinephrine. And what is the dose of epinephrine? So understand, epinephrine can be given with the help of endotracheal route, with the help of IV route or IO. So IV and IO you have to place them together. So IV and IO ko साथ में रख दो. IV and IO you are placing them together, and 1 + 1 is equal to 2. So remember, this is 0.02 mg per kg. 0.02 mg per kg. This is the trick to remember. Okay, so IV, IO, 1 and 1, 2. This is 0.02 mg per kg. And what about the epinephrine dose endotracheally? That is 0.1 mg per kg. Okay, देखो, याद रखो. Remember this, 1 + 1, 2. So that's going to be 0.02. And after how many decimals? 2. Okay, so this is also important. In IV and IO, please keep 2 words after the decimal, 0.02, and also remember this is 2, whereas you have endotracheally 0.1 mg per kg only. Okay, right? And we have to repeat the epinephrine every 3 to 5 minutes if heart rate is less than 60. Now coming your question, right? Now coming your question. Now coming on to the questions of my dear kids, like chest compression to PPV, chest compression to PPV. So if the child is older and you have got 2 rescuers, then you have to do 15:2. If the child, if there is 1 rescuer, then the compression to PPV is 30:2. Now how to remember this? How to learn this? So remember that the main concern in chotu bachas is respiration. So chest compression to positive pressure ventilation, PPV is maintained 2 only. कुछ भी होने दो, PPV has to maintain the 2 only. It's just that if there are 2 rescuers, 15. If there is 1 rescuer, 30. Okay, right? So how to remember this? How to remember this? The 15 into 2 is equal to 30, and 30 into 1 is equal to 30. So if there is 1 rescuer, then 30:2. If there are 2 rescuers, then 15:2. Okay, 15:2. And of course 3:1 in every 2 seconds. Yes, 3:1 in every 2 seconds is something which you are supposed to give. Bacha wants break. Bacha bas 1 minute de do. Let me just finish up with this chotu sa little sa table, and then I'll give you the break for sure. Amit Atul Sharma, pakka. Anna says, biotrics, it's getting easy for solving MCQs. Anna ji, definitely it's going to be easy. Definitely इट इज गोइंग टू बी इजी। तू भी पढ़ाई कर, मैं भी पढ़ाऊंगा, इकट्ठे मिलके मचाएंगे बवाल। तू भी पढ़ाई कर, मैं भी पढ़ाऊंगा, इकट्ठे मिलकर मचाएंगे बवाल। मैं तो रहूंगा तेरा अन्ना हजारे, तू मन के दिखा मेरा अरविंद केजरीवाल। Yeah, I'll do images also. Don't worry. Don't worry. I'll do images as well. Anna ji, I will do images as well. सबके लिए एक एक शायरी। केवल जी saying, don't go to jail, sir. Yeah, yeah, I'll not go. I'll not go. चलिए, Silverman Anderson scoring. Silverman Anderson scoring. बच्चे, Silverman Anderson scoring. It is actually for the respiratory distress syndrome. Let me just write down. Respiratory distress syndrome has got a Silverman Anderson score. So how to remember? See, R and E coming together. Okay, R and E coming together. Respiratory distress syndrome. Huh? Respiratory distress syndrome in preterm. So the mnemonic is lungs. L for lower chest retraction, U for upper chest retraction, N for nasal flaring, G for grunting, X for xiphoid retractions. Okay, X for xiphoid retractions. Okay. You are best. Bache, I am not best. You are best. You are best. Huh? So L for lower chest retraction, upper chest retraction, nasal flaring, grunting, and xiphoid retractions. Priyanka says you are the best faculty I've came across in pediatrics. You are just amazing. Wow. वाह प्रियंका, वाह प्रियंका, मेरी तरफ से ये तुम्हारे लिए, भगवान करे तुम्हें कभी नजर ना लगे। भगवान करे तुम्हें कभी नजर ना लगे। प्रियंका, stay happy, live long, God bless you बच्चे। So L for lower chest retraction, U for upper chest retraction, nasal flaring, grunting and xiphoid retractions। ठीक है, चलो अब हम चलते हैं ब्रेक पे, और ब्रेक पे जाने से पहले एक छोटी सी शायरी सुना देते हैं आप सबके लिए कि ये चांद, क्योंकि चांद जो है वो निकल आया है बाहर। ए चांद तू इतना गुमा न कर, इधर भी एक चांद बैठा है। ए चांद तू इतना गुमा न कर, इधर भी एक चांद बैठा है। तुझ में तो फिर भी दाग है, इधर बेदाग बैठा है। ये बहुत ही प्यारे मेरे खिलते हुए चेहरे और बहुत बहुत अच्छे अच्छे बच्चे हैं, है ना। श्रेयस सेज डॉक्टर पर्व लुथरा, हमें भी याद करो। अरे तुम लोगों की वजह से ही हूँ भाई जो हूँ, दिस इज ओनली बिकॉज ऑफ यू पीपल, है ना। आई एम टीचिंग यू, यू गाइस आर रिस्पॉन्डिंग सो वेल, सो हैप्पी टू बी योर फैकल्टी, है ना, फैकल्टी सॉरी। So sweet of me, so sweet of you all guys. Blueberry, you are just amazing. Chalo bachcho, we will call it for a break. Okay, we are going on a break. So this is 8:15. Okay, 8:17 IST. We will meet at 8:40, 8:50. Okay, we will meet at 8:50 and we will have the session going on, right? And bus ek promise. Okay, give me one a help. Okay, I just want one help. So every one of you is going to go to break. Okay, and you are going to pick up your mobile phones. Okay, so in the mobile phones, just call your friend. Okay, call your friend and tell him that an amazing pediatric session is going on. Tell them that an amazing pediatric session is going on. And then tell them to, yes, tell them to join this session. Okay, and I'll just be right back. ठीक है, चलो चलो चलो, we'll be right back. Okay, so now taking a break. All right, बच्चे. So I hope I'm audible. Okay, fine. चलो. तो अगर सब लोग वापस आ चुके हैं, yes, everyone, if all guys have joined the class, so just quickly write in the comment section that you all are here, you all have joined. Yes, just quickly give a hi in the chat box. ठीक है. I hope आप सबने dinner कर लिया है, and if all students have joined the class back, chalo. So I hope that all of you have joined the class back, and chaliye. So let's quickly start our class, and let's quickly do the class, because I can see many of the students. Yeah, study pediatrics as this session, but it is enough. It is more than sufficient for your pediatric preparation for your FMGE. Don't worry. Okay, so all of you have joined. Great. Chalo. So we are good to go. Let me just refresh. Let me just refresh it. Okay, bache. Okay. If a question. Thank you, Coco. Thank you. Coco says I have called my friends also. Okay, bache. Superb. So all my lovely dear kids, the question is coming on your screens now. Rather than questions, let us understand the concept now. So this is the concept which says that Sarnath and Sarnath staging. Okay, it is done for what? It is done for hypoxic ischemic encephalopathy. Okay, so Sarnath and Sarnath staging is something which is done for hypoxic ischemic encephalopathy. So how to remember? So remember that Sarnath and Sarnath, there are two people. Okay, yes. Rapid revisions. Yes, bache, I will. Yeah, I am increasing my speed. Don't worry. So Sarnath and Sarnath. So Sarnath, this is Mr. Sarnath, Mrs. Sarnath. Mr. Sarnath is saying hi to Miss Sarnath. Okay, Mr. Sarnath is saying hi to Miss Sarnath. So remember this hi, HIE is important. H for hypoxic ischemic encephalopathy. Okay, hypoxic ischemic encephalopathy. Okay, and you have to understand that the treatment of seizures. So of course, hypoxic ischemic encephalopathy is going to have seizures. Okay, and you want to say hi. Okay, so you have to say what? You have to say hi. To whom you are going to say hi? So you're going to say hi to the Barbie. Hello, Barbie. Okay, so remember Barbie, that means the treatment of choice is going to be phenobarbital. The treatment of choice is going to be phenobarbital. Okay, phenobarbital. And after that, remember therapeutic hypothermia is also done for HIE. HIE. Okay, so hypothermia is HY, and then HIE is the case. Okay, super, my dear little kids, understand about the respiratory distress syndrome now. Okay, respiratory distress syndrome. Yes, so I hope that you all are aware that respiratory distress syndrome occurs because of surfactant deficiency. Surfactant deficiency means deficiency of lecithin, deficiency of surfactant. Now surfactant has got two T's. Can you see surfactant, T and T? So T and T, remember from T, that is T for type 2 pneumocytes. Okay, type 2 pneumocytes. So remember this surfactant T for type 2 pneumocytes. Okay, type 2 pneumocytes. Okay, type 2 pneumocytes, which are secreted by surfactant is secreted by type 2 pneumocytes. Okay. Chalo bache, quickly tell me this this answer now, that the surfactant maturity. Okay, the surfactant maturity occurs by what week? Okay, in which week of gestation the surfactant maturity is going to occur? Yes, quickly tell me which week. 34, but it is 35. How to remember? See, maturity, MATURITY. Okay, so you have got 8 letters, so 5 plus 3 is 8. So surfactant maturity is going to come after 35 weeks of gestation. 35 weeks of gestation. This is the trick to remember, and if you're liking the tricks, जैसे ही कोई trick पसंद आती है, drop hearts in the chat box so that I will be able to receive your appreciation. Coming on to Silverman-Anderson score. I have told you lung X was the mnemonic for Silverman-Anderson score. Yes, lung X was the mnemonic. Now remember Silverman-Anderson score. So Ander and Son. Okay, Ander and Son. There are two words, Ander and Son. So SON Son, S for 7. So SON Son, S for 7. So this is you have to remember. And Ander has got 5 letters. So remember 5 and 7. So it is Silverman-Anderson score. If it is more than 7, it is severe. Okay, and less than 5 is going to be mild. Okay, more than 7 it is going to be severe, and less than 5 is going to be mild. Okay, less than 5 is mild, whereas more than 7 is silver. Okay, I've also told you. Okay, now tell me this question. Now this question I want you to answer. If the APGAR score is less than 7, is it good or bad? And if your Silverman-Anderson score is less than 7, is it good or bad? Yes, is it good or bad? So children are saying it is bad. It is, yes, bache. If the APGAR score is less than 7, it is bad. Even if the Silverman-Anderson score is less than 5, it is also bad. So this you have to understand. Okay, this you have to understand. Okay, great, bache. Great. Coming on to Down score. Please remember, Downey score is something which is also used for respiratory distress. So D for Downey score, D for your distress. What is the X-ray finding in RDS? You will have ground glass opacity. Remember this, you will have ground glass opacity as well as air bronchogram. Okay, quickly tell me, air bronchogram is the classical finding. Air bronchogram is the classical finding of which disease? Yes, air bronchogram is the classical finding in which disease? Yes, in which disease? People are writing asbestosis, bache. It is actually a classical finding of pneumonia. Okay, it is actually a classical finding of pneumonia. So Coco asked, how will be very good pneumonia? Yes, Nitish is the first person to give the most correct answer. Pneumonia is the correct answer. Now, how will they frame this? But all these have been asked as a previous year question. You know that your uh, Downey score is for what? Okay, and then shake test is performed for what? So shake test is also performed for respiratory distress syndrome. Okay, shake test, this you have to understand. How will you prevent this? Yes, again a question. Dexamethasone, betamethasone is something which is given, and you know, betamethasone is something which is also it is actually used, betamethasone and dexamethasone. Next, you have got initial management. So initial management, you have to understand that you have to give nasal CPAP to the patient, and in nasal CPAP the FiO2 should be 40%. How to remember this? F for FiO2, F for 4. So 4 you have to understand 40%. PEEP is 5 centimeter of water. So 1 2 3 4, 4 letters and then 5 centimeter of water. If the CPAP is failing, okay, yes, if the CPAP is failing, then you have to do INSURE protocol. IN for intubate, SUR for surfactant, EX for extubate. So in the CPAP is actually a protocol which is done for what? It is done for your respiratory distress syndrome. Chalo bache, very good. Coming on to this growth. Okay, coming on to this growth chart. Okay, now understand this growth chart, beta. They have asked a question in FMGE that, you know, which two things are going to overlap. So if you can see this A and, you know, the A and C, they are very similar. Okay, the brain growth, then the somatic growth. Okay, so they are like that. Okay, so similarly, they have asked these kind of questions, and this is something you have to understand. So before anything, let's understand about this graph. This graph They can ask you to label A, B, C, D as well. So understand what is A. A is actually this one. This green one is actually A. Okay. So what is A? A is the brain growth. Okay. Then what is this B? B is actually lymph growth. Okay. B is actually lymph growth. Then you have got C as the somatic growth and D as the gonadal growth. Okay. D as what? D as the gonadal growth. So how to remember this? Please understand, beta. See, this graph is actually a parabola. Okay, this graph is actually what? This is actually a parabola, and I have told this many a times that B and P looks very similar. So a parabolic graph is belonging to what? It is belonging to brain growth. It is belonging to what? It is belonging to brain growth. And then you have got this B graph, bache. This is actually lymph node. Okay, so lymph. So you count the numbers of the words. So 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. So 10 words means 10 years. So lymph nodes will have their peak at 10 years and then they are going to go down. So L is lymph node, L is low. So lymph node graph is the only graph which is going to come low. Can you see? Not coming low, not coming low, not coming low. So the one graph which is coming low is actually the lymph node graph, bache. That's why this B is actually a lymph node graph. So lymph node has got 10 words. So 10 words, from 10 words, you can remember 10 years. So it has shown a peak at 10 years. Coming on to somatic growth. Somatic growth, if you will count, it is 13 letter beta. So 12 years. Somatic growth is going to have a peak at what year? It is going to have a peak at 12 years. And next is gonadal growth beta. G for gonadal, D for gradual. That means something which is going to इंक्रीज ग्रेजुअली बच्चे, दैट इज द गोनाडल ग्रोथ. बच्चे बोलो अगर ये समझ में आया और ये निमोनिक पसंद आया तो एक बार फटाफट से चैट बॉक्स में स्माइली भेज दो, ठीक है. पैराबोला, ब्रेन ग्रोथ. लिम्फ नोड is, yes, lymphoid follicles. This is the lymph node. Lymph node is the only graph that is going to come down. Then somatic growth going upwards, and gonadal growth is the one which is going to have a gradual ascent. Okay, so that is gonadal growth. Thank you, Tofika. Thank you, Fatima. Thank you so much, bache. Thank you, Shakil Rahman. Thank you. Chalo. Thank you, Coco. Chalo. Coming on to the weight and height. So FMG people are fond of asking these questions. Oh, Kalingari has sent some cookies for me. Thank you, Kalingari. So FMG people are fond of asking these questions that, you know, the weight is going to double, the height is going to double, when they are going to double, triple. So remember, I'm going to give you a beautiful trick. और अगर ये ट्रिक आपको समझ में आती है, if you get to know this trick, I just want you to send some, what you will send? You'll send hearts in the chat section. Okay, you will send hearts in the chat section. See, triples, anything which is asked, ki when will the weight be tripled, when will be the height tripled. So triple always means 12. So T for triple, T for 12. Okay, so whenever the word triple comes, 12 is going to come. So if you will see 12 months tripling, 12 months tripling is for weight. That means the weight is going to triple in 12 months. And if the length is asked, the length is going to get tripled in 12 years. Length is going to get tripled in 12 years. So weight in 12 months, length in 12 years. Okay, so for weight, you can easily understand now that if weight is tripling in 12 months, then in half, that is 6 months, it is going to double. And in 2 years, it is going to be 4 times. Okay, so if I just tell you about the weight, it is going to triple in 12 months. Okay, triple in 12 months. So it is going to be quadruple in 2 years and double in 5 to 6 months. And height is going to, I've told you, height is, length is going to get tripled in 12 years. Okay, so if you loved this mnemonic of mine, you can send me some good emojis in the comment section. Coming on to average weight. Okay, average weight is 2.9 kgs. Low birth weight is less than 2.5 kgs. Low birth weight is less than 2.5 kgs. Okay, good bache, good Ravi, good Coco. Thank you so much. God bless you, bachcho. Chalo. Kalingari send burgers. Oh no, I'll not eat burgers. Coming on to increase in height now. Okay, so increase in height, I have already told you this, bache, that you know, it is going to triple in 12 years. Now remember, height has this word called as HIEGHT. Okay, so height has this spelling HIEGHT. So what you have to remember that it can be written as this: H for height, T for 2, H for height, T for 2. Now what is the best thing in this? That if you want to see height getting doubled, if you want to see the height getting doubled, you have to focus on the remaining letters, which are 4 in number. So HIGH, that is 4 letters, that is 4 years. So this is a very beautiful mnemonic, one of my favorite mnemonic. Easy, yeah, Reshma, easy. So remember, height, HIGHT, H for height, T for 2 times, that is height is going to get doubled in 1, 2, 3, 4, that is going to double in 4 years. So height is going to get doubled in how much time? Height is going to get doubled in 4 years. This is something which you have to remember. And of course, the weight is going to get doubled in how much time, bache? Yes, the weight is going to get doubled in, weight is doubling in your 2 years. Okay, weight in 2 years, height is going to be in 4 years. Okay, coming on to what is the normal height? So normal height is actually 50 centimeter at birth, and then at 1 year that's going to be 75 centimeter. So it's actually since the child can't stand, so we call it as length. Okay, this was a joke. Let's skip it. Prince Adhikari, this is enough for NEET PG. Of course, bache. Of course, bache. This is actually very important. Okay, very important. Coming on to Shakir's tape now. Okay, coming on to Shakir's tape now. So Shakir's tape is again important thing. Okay, so sorry. Shakir's tape is again an important thing which students are fond. I mean, the teachers are fond of asking. So remember this mnemonic now. Shakira. Shakira goes in bar. Okay, and in Hindi we call 12 as 12. Okay, we call 12 as 12. So this is something which you have to remember. So Shakira is going in bar is 12. So what to remember? Remember Shakir's tape is 12 bar. So 12 means normal, it is more than 12.5 centimeter. More than 12.5 centimeter is 12. Malnutrition is going to be 11.5 to 12.5, and severe is going to be less than 11.5. So this is the Shakir's tape. This is the Shakir's tape. Coming on to the height. So remember, there are two types of short stature. छोटे छोटे दो तरीके के बच्चे होते हैं. एक होता है constitutional delay और दूसरा होता है familial short stature. Okay, so एक होता है constitutional delay, एक होता है familial short stature. Familial short stature means mama papa छोटे हैं, baby भी छोटा है. Mama papa, they are short stature, baby is also short stature. So this is the familial short stature. Okay, familial short stature means that the adult height is going to be short. So when the baby is going to grow, the baby's height, adult height is also going to be small. Parents' height is, because the parents' height is short, but the puberty is normal for age, the bone age is normal for age. Okay, so familial short means family short, baby short. Constitutional delay means that parents' height is normal, so baby's height is also going to be normal when the baby will be grown up. But why short stature? Why short stature? Because they are late bloomers. They are what? They are late bloomers. They are late bloomers. Okay, they are late bloomers. Okay, so initially they will be chotu, but when the time comes when they want to be adult, they will be just like their parents. That means adult height is normal, parents height is also normal. Okay, but the problem is that they are late bloomers. So the puberty is actually delayed in these patients, the bone age is also delayed in this patient, and this is how you are supposed to remember this. And how to remember this? Remember, the mnemonic is B, B, C, D. A, B, C, D, B, B, C, D. That means bone is delayed. Okay, bone is delayed. Yes, bone age is delayed. Then B for boner. Oops. The puberty is delayed. So this is how you can remember. Bone is delayed, boner is delayed, bloomer, late bloomer, they are late bloomers, and then it is delayed. Everything is delayed. In C, C is actually what? They are constitutionally delayed. Constitutionally, there is going to be a delay in them. Coming on to upper segment to lower segment ratio, and before I go on to this upper segment and lower segment ratio, let me ask you a question. Okay, let me ask you a question. Tell me, upper segment to lower segment ratio increases or decreases in rickets? Tell me, in rickets, upper segment to lower segment ratio increases or decreases? Things are getting spicy. Oh, king of alpha, no. No spice. Increases. Meenaji says increases. Vishnu, Meenaji, you are absolutely right. Asikali, you are right. Dr. Priyanka, you are right. Very good, guys. Dr. Indra, you are right. Nitish, you are right. Bacha, for those of you who are telling the answer wrong, I've told you na, har is the mnemonic. Har is the mnemonic. अगर lower और lower गए, ठीक है, upper और upper segment to lower segment ratio, तो मैं हार जाऊंगा. So hypothyroidism, achondroplasia and rickets इसमें increase होता है, okay? The upper segment to lower segment ratio, they are going to increase. So upper segment to lower segment ratio, I have told you at birth 1, 2, 3, 4, 5, 6, 7. So at birth 7 letters, 1.7 is to 1. Otherwise, sometimes we write it as newborn. So it is also going to have 7 letters. Again, 1.7 is to 1. At 3 years, it is going to be 1.3 is to 1. At 7 to 10 years, okay, so some books write 7 years, some books write 10 years. At 7 to 10 years, it's 1 is to 1. But after 10 years, it's going to be 0.9 is to 1. This is something you have to remember. It is 0.9 is to 1. So upper segment to lower segment ratio is something which you have to understand. Now, okay, bache, coming on to one more thing, approach to short stature. So short stature, yes, I have asked you the constitutionally small baby, familially small baby. Yes, very good, Asikali. Good. Chalo. So coming on to short stature. See, now upper segment to lower segment, if it is normal, okay, if it is normal for age, then they are short stature. They are actually proportionately short stature. Proportionately short means what? They are actually the short ones only, okay? So normally they can be short, okay? Chronic malnutrition is actually stunting and growth hormone deficiency. So in all these cases, the upper segment to lower segment ratio is actually normal, but overall they are small, okay? Either it's growth hormone deficiency, normal variant, or chronic malnutrition, okay? But please understand, bache, that if you know if they are having short trunk, that means upper segment is small, okay? Upper segment is small, so the mnemonic itself is short, okay? Short means S for spondyloepiphyseal dysplasia. Spondyloepiphyseal, so vertebral column, they've got epiphysis, that epiphysis is not growing properly. So spondyloepiphyseal dysplasia, okay? This is S. What is H? Hernia vertebrae. Okay, then what is T? So T for TB spine, okay? TB spine is also called as spot spine. And S for one storage disease also, that is called as mucopolysaccharidosis. So this is the mnemonic which you can use to remember the disproportionate short stature. The mnemonic is short. Now can you see this? HAR? Yes, HAR, hypothyroidism, rickets, and achondroplasia. So you can remember that this is because the limbs are small. This is because the legs are small. Trunk is normal, the limbs are small, the legs are small, okay? Then so how to remember? So remember the mnemonic is short car or har. How you can remember, that's your wish. But then can you see the tires are small for this car? So short limbs, you can remember as if the car, as if the car is in the, as if the car is having the tires of the car are small limbs of the car. So CAR is the mnemonic, congenital hypothyroidism, achondroplasia, and R for rickets. Coming on to the most favorite topic of all my little kids, that is called as developmental milestones. Developmental milestones. आ जाओ बच्चे, ये पढ़ाता हूँ मैं आप लोगों को developmental milestones, and believe me, after doing these developmental milestones from me, you will never forget developmental milestones in your life. Okay. चलो, come on. अब हम पढ़ेंगे developmental milestones, and एक भी milestones, believe me, you won't get even a single wrong question in your life अगर एक बार इस milestone के lecture को यहाँ पर ध्यान से सुन लेते हो तो. Okay, for your words, it is for you, sir. Okay, so he's giving me strawberries. Okay. So just one thing, I'll teach you the milestone, and if you love the trick, give me some of the fruits to eat. Now I need some fruits from you guys, okay? So gross motor milestones, see here, gross motor milestones, this is, हाँ मीना जी, yeah, ये PDF में नहीं है, this is not in PDF. So if I get like around, I think 500 likes or something, I'll give you the PDF also, don't worry, but this is something which is required. So see this 3, so 3 you light it like this, and if you just rotate it, it becomes N. So it becomes N. So you can remember that 3 months is actually, yes, 3 months is actually N for neck holding. Coming on to 5. So can you see this? This is actually 5, and this is how, you know, there's a space to roll down in the 5. So rollover is actually done in 5 months. Coming on to 6 months. So 6 and SIT are actually same. So sit with S for support. So if you want to sit with support, this is actually the 6 months. Okay, sit with support is actually the 6 months. Coming on to 8. Okay, 8. So can you see this? See, there are two things. So 8, one is, you can see this. So the baby is sitting without support. Okay, the baby is having no support. Without support, baby is sitting, or you can remember like this. So if I just cut it, so it becomes like this, 0 0. So 0 support, no support. Okay, 0 support, no support. So at 8 months, the baby is going to sit without support. And then you can have this snake, you know, in your medical emblem also, we have got two snakes like this, which are, you know, giving you the appearance like 8. So 8 means you are going to crawl. Okay, so 8 means you are going to crawl. And then you have got 10. So 10 is just like this. So see this, the baby is standing with support of it. Okay, so this is, yes, so this is actually the stand with support. So, you know, crawling means that the chest and the abdomen are going to touch the ground. So chest and abdomen are going to touch the ground. But whereas if you see in this baby, at 10 months, the baby is going to creep. Okay, not touching the ground. So 10 is actually where the baby is going to creep. Okay, so here the baby is going to creep in 10. Okay, the baby is going to creep in 10. Okay, so just remember this, very very important, that, you know, you can remember by 10 horses. Okay, all leave it 10 horses. This is 1, this is 0, this is H, this is O. So they are actually looking very similar. So actually 10 months is nothing but just like horse, the creeping of the horse is similar to this. So 10 months creeping is going to be there. Coming on to 12 months. So 12 months means stand without support. Okay, stand without support and walk with support. Okay, so 12 is actually important. So I will write this now. 12 is like this. Okay, 12 is like this. So 12 is W for walk. Okay, walk. Okay, W for walk. So what you have to understand, that at 12 months they are going to walk, but they need what? They need an extra support. Okay, they can walk, but they need an extra support. Okay, right? And of course, one means what? They can stand without support. Okay, so one is actually ekla chalo re. So ekla means what? Stand without, stand alone. Ekla. Okay, stand alone, but you have to remember 12 has got walk with an extra support. And after that 15. So 15 is actually walk without support. Okay, 15 is actually walk without support. So 15 is written like this. So F for, remember, I am fine even if there is no support. Okay, so 15 says I am fine even if there is no support and I can walk properly. 18 months is going to be running. Okay, so 18 is actually running. So you very well know that, you know, once the child is of 18 years, they just run to go to bar to take some wine, to have some wine and say do good to pila de sakiya. Yeah, so 18 years is something which you have to remember like this. Okay, so 18 years and bar is going to be there. Then 2 years means 2 foot per step. So whenever you will see 2 foot, so you will have what? You will have 2 foot on single step. This is 2 years. And what about 3 years? Of course, the baby can ride tricycle, but 1 foot per step. Okay, 1 foot per step at 3 years. 1 foot per step upwards, that is 3 years, and 1 foot per step down is going to be 4 years. So down has got 1 2 3 4. So remember, this is going to be 4 years. Okay, so one step down. Okay, 4 years. And of course, if there is one step that is up, it is going to be what? It is going to be 2 years. It is going to be what? 2 years. Sorry, how much? It is going to be 3 years. Okay, so, you know, this is about your gross motor milestones. Let's understand. So I've told you that 3, and if you fold the 3, this becomes N. This is neck. Okay, so this is what? This is called as neck holding. Then 4 months, I've told you 4 months or 5 months is actually roll over. Okay, so remember ROLL, that is 4 months. Then 6 months, I've told you S, and then SIX, that is, and sorry, SIX and SIT with S, that is sits with support, and this is called as tripod position. This is called as what? Tripod position. Okay, and after that you have got 8 months, that is sits without support at 8 months. or the baby is going to crawl. So I've told you that, you know, crawling is just like two snakes, so two snakes together makes 8. And then stand with support, it's just like horse. Okay, so stand with support and stand without support, I'll teach you. Just remember, just like horse, it is like this, and stand with support means, see this picture, you will be able to understand. There's this baby, the 0 baby is standing with the help of this 1. So this is standing with the support. Okay, so this is the stand with support, and of course creeping, and then stand without support and walk with support, 12 months. 15, I've told you, fine even if I will not get the support. 18 is going to be running to the pubs, you know, to get the whiskeys. Then 2 years, I've told you, climbing with a feet or a step. So you know, 1 feet climbing, that means two 2 feet you are going to 2 feet will be there on single step. Then 3 means upstairs, climbing upstairs with 1 feet at a time, and climbing downstairs is going to be 4 years. Rides a tricycle, 3 years. And hops, so hops has got HOPS, so that's absolutely 4 years. Chalo, quickly tell me in the chat box, kaisa laga hamari tricks about the gross motor milestone. Yes, how were our tricks for the gross motor milestones? Quickly tell me. Yes, quickly tell me. Wow, amazing response, and for you kids, I'm even going to bring in more tricks, more mnemonics for you all. You guys are superb, so you know, mera bhi man karta hai that I give you more, much better things. Okay. Chalo, coming on to the next one. Next is going to be fine motor milestones. Fine motor milestones are also equally important, so just remember this. So this is how, you know, the mouth of the baby looks like. So this is like 3, and you know, if you just give a finger to the baby is going to grasp that. Okay, so this 3 is grasping the finger. This is mnemonic, a trick to remember the palmar grasp. Coming on to bidextrous. So remember, bidextrous is going to have words like this: bidextrous. Okay, bidextrous. So bi means 2, di means 2, so 2 plus 2 is going to be 4. So bidextrous grasp is going to come in 4, and of course if it is coming in 4, the 5 months, it is going to be a unidextrous. Okay, coming on to what? Coming on to 12 months, that is going to be what? See, in 12 months, if you want to understand, remember, 9 months as well as 12 months is something that is for grasp actually. Okay, 9 months and 12 months is something that is for grasp. 9 month is going to be immature grasp, and 12 months it is going to be a mature pincer grasp. So remember this 9. So how to remember? NINE. So NIM you can remember. So 9 month is going to be what? That is going to be an immature grasp, whereas 12 months is going to be a mature grasp. 9 months and mature grasp. ठीक है? Okay, 9 months and then 12 months. Okay, coming on to, yeah, clear. And one more thing, one more trick is actually, this is 9, and you know, the reverse of 9 is actually P. So you can remember that it is the pincer grasp. Okay, it is what? It is the pincer grasp. So 9 and P, this is how you can remember. This is pincer grasp. Coming on to 2, 3, and 5. So 2 for undressing. Okay, 2 for so remember, 2 is having 2 letters, that is U, and undressing ho jayega. 2 and 3. 3 is going to be dress, then undress, then dress, and then undress. So 1, 2, 3. So it's actually 3, but actually it okay, dressing and undressing. And 5 is something which is you know, responsible. 5 years, at 5 years the baby can even tie the shoelaces. Okay, so LACES, shoelaces, 1, 2, 3, 4, 5, the baby will be able to tie. Okay, the baby will be able to tie the shoelaces. Okay, baby is able to tie the shoelaces. So just 1 second. Yeah, so yeah, this I have told you. Now coming on to other fine motor skills. So at 18 months feeds with the spoon. Okay, so at spoon feeding can start with what? At 18 months. So just writing for you: 1, 2, 3, 3, 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12. Okay, 13, 14, 15, 16, 17, 18. So spoon feeding starts. Spoon feeding starts is actually 18 months. So this you have to understand. This is something which you can remember. And also one trick is there. that once the child turns 18, okay, जैसे ही कोई बच्चा 18 साल का होता है, he becomes boyfriend, so the girlfriend is going to bring in spoon for him and do the sorry, the as soon as he attains 18 years of age, there is no spoon feeding from the parents, and the child is, in American countries, in other countries, the child is sent out of the house to go and to, and to do what? To do, yes, to do their own income and everything. Okay, now coming on to this beautiful important chart, very very important chart, amazingly important chart. Remember this, that now I'm going to write like this. So first of all, scribble. So remember how to remember scribble. So this is how you write 15, and 5 and S look very similar. So at 15 months, the child is going to scribble. Then you have got horizontal line at 2 months and the vertical line at 1.5 months. Okay, so this is something you have to understand. The vertical line is somewhat late, so you can remember V for vertical, V for 1. Okay, V for 1 or ONE1, you can remember. So V and V, that vertical lines at 1.5 year. Okay, 1.5 years, and then 2 years horizontal line is going to come, and then circle is actually 3. Okay, circle is actually 3. You can see here, we can have a circle here also. Okay, we can have a circle here also. So this is circle. Then of course you will be having what? This is a plus sign. Can you see this is a plus sign? So plus sign is going to come at 4 years. So at 4, this is how we write 4. So this is a plus sign. Then triangle is going to be at 5. So please, triangle is not at 3. Triangle is actually at 5. So remember like this is 5, and this is something that I've covered. So remember, this is triangle at 5 years, and then diamonds at 6 years. So 6 can be, what 6 reminds me of this benzene. So benzene is more or less looking like a diamond. So you can remember diamond at 6 years. Coming on to the age. So just remember this, that you have got 15 months, 18 months, 2 years, 3 years. So very simple trick to remember is this, that if you can write it like 15. Okay, I'll write it for you. 15, 18, 2 year, 3 years. So multiply 3, multiply 3. So this is 6 cubes, 9 cubes, and coming on to 15 and 18. So 5 is mirror image for 2. So you will have what? You will have 2 cubes at the age of 15 years. And if you want to learn for 18, so just cut this 8. Okay, so this is 8, this cut this 8, it becomes 3. So answer is going to be 3 cubes. Answer is going to be what? The answer is going to be 3 cubes. Okay, so this is how you can remember very very easily. Okay, you can remember very easily. Or this is one more trick which you can use. So remember that if you can remember this, that at 2 years, okay, see this, that 6 years is actually 1 plus 5. So you will have 6 cubes. Okay, here I'm writing cubes. So 5 plus 1, 6 cubes will require 2 years. 8 plus 1, 9, then it will require 3 cubes, 3 years. So if so the converse is actually to 1 and 5, 15. So 15 is having 2 cubes, 18 is going to have 3 cubes. Okay, right? Yes. Okay. Yes, Oswin, you will be getting, definitely you will be getting, but then some 500 plus likes or something, they are actually important to get the annotated PDF. So just this is something that has been told by the institute to me. So this is something I have to uh, uh, see. Okay, got it. 1000 likes. Okay, Prabhat. If you'll do 1000 likes, I'll definitely give you an annotated PDF, one chocolate also from my side. Coming on to the language milestones. Now, language milestones. Yes. All the winners out there, quickly focus it here. 3 months cooing. Okay, 3 months cooing. So COO coo, that is 3 months. Okay, cooing is actually nothing but 3 months. Very easy to remember. Coming on to 6 months, like ma, pa. So remember, this 6 months is actually ma and pa, and 9 months is actually mama, papa. That is for your bisyllables. So I'm giving some bad, I mean, not good things. So if you have seen Samir Raina's show, ऐसे कुछ controversy, this some type of controversy was something which was there, है ना? So I'm sorry, I'm so sorry, but this is how we can just remember. So remember 69, MAPA, Mama Papa, that is 6 for monosyllables, MAPA, 9 for Mama Papa, that is going to be bisyllables. So sorry if I've hurt somebody, but then this is how you can remember this. At 1 year, they can speak 1 to 2 words. So happy birthday. Okay, 1 year is happy birthday, and you can remember that the child now can speak 2 letters, 2 words, 2 letters. So this is how we can remember. At 15, 15, yes. So they are going to speak some jargon speech, many words, but there'll be no meaning. That is 15 words. Okay. So 15 words is something which you can remember. Thoda casual hai. But this is something, I find it very easy for everyone to learn it. So that's why I keep on using this mnemonics. Coming on to jargon speech. So just remember this jargon speech is just like 15. Okay. So 15 is something which you have to understand. That is for jargon speech. So this is you write J and this is you write F. So J and F also resemble somehow. So jargon speeches at 15 months. Okay. Jargon speeches as 15 months. This is something which you have to understand. Coming to 18 months, so just remember 8 for 18s and 8 to 10 words. Then 2 years is 2 words in tense, like come and play. Okay. Then 3 years, name, age, gender. So 3 words, name, age, gender, easy to remember. Coming on to 4. So 4, just remember that 4 को हिंदी में क्या बोलते हैं? चार से याद रखेंगे चोर कौन होता है? जो क्या बनाता है? स्टोरीज बनाता है. ठीक है. चार से चोर कौन होता है? जो कि क्या बनाता है? स्टोरीज बनाता है. ओके. 5 पर पूछेगा. This is how you have to remember. 5 पर पूछेगा. That means they are going to ask the meaning of the words. Okay, they are going to ask the meaning of the words. Okay. Chalo. Coming on to this now, social milestones. Social milestones means, first of all, let's understand about the smile. So very easy to understand that this is S, this is S for second. S for social smile, 2S are there. So at 2 months, you are going to have social smile. Okay. This is important, bache. This has been asked as a previous year question as well, that social smile will be at 2 months. Okay. Social smile will be at how many months? Social smile are going to be there at 2 months. And then 6 months will be smiling in the mirror. Okay. 6 months will be stranger anxiety. So anxiety has got this X and I word, and 6 has also got an X, these words. Okay. X and I word. So it's very easy to remember that the stranger anxiety is going to be at 6 months, and smile at mirror image. So this is how you can remember smile at the mirror image. 9 months, of course, the baby at 9 months, baby says bye bye to the mother's uterus. So this you can correlate and remember that 9 months the baby is going to say bye bye. Okay. Coming to question peekaboo, the child is able to play peekaboo at what months of age? Yes, peekaboo at what months of age? Quickly, bache. Quickly tell me, peekaboo at what months of age? Ten months. Madasu. Very good, Prabhat Kalingari. Very good, Ravi Wali. Very good, Murtaza Bhatt. Very good, Meena ji. Very good, Manish. Very good, Nitish. Very good, Instant Tricks. This is 9 months. This is what? This is actually 9 months. Okay. Now, I think 9 months I've told you. Let's say bye-bye. And at 12 months, okay? 12 months. Remember this mnemonic. Mnemonic says 12. 12 is actually bahara. So bara means bahar gaya tha or bahar se andar aa gaya. So barha. Okay. So that means the child is going to come back. Okay. The child is going to come back when you are going to call the child back. Okay. Baraha. Okay. Clear? And 18. 18 what? At 18, the child is going to do domestic mimicry. Okay. So, very well, once you are 18 years of age, you just want to become like your dad, your mother. Okay. You are adults now. So that is called as domestic mimicry. That is called as domestic mimicry. But I know that all these are actually, some things which are really very difficult. So I have just tried to give you the list, the mnemonic, the trick. Let's just quickly revise. At 4 months, I've told you bidextrous. So bi is 2, di is 2. So 2 plus 2, 4. Bidextrous at 4 months, unidextrous at 6 months. Then at 8 months, I've told you unidextrous grasp is going to be there. 9 months, 9 is just looking like P for pincer grasp. So 9 is going to be immature. So immature pincer grasp means holding with the sides of the finger. Holding with the sides of the finger. just like this. This is immature. Okay, this is immature grasp. Okay, but whereas if you will hold it like this is actually the mature pincer grasp that is going to come at 12 months. Then I've told you 15, 18. So 15 is going to be making the tower of the cube. So this is 2 years. Okay, so how to remember? 1 plus 5 is equal to 6. 6 is actually 2 into 3. So 2. Okay, you can remember. And 2 into 3. 3 is just the constant. So 2 cubes. Okay, so remember 2 cubes. 2 cubes. Okay, so at 15 months, 2 cubes. 15 months, 2 cubes. 18 months, 3 cubes. Okay, like this. Then 2 years, draws a line, makes a tower of, I think I've told you that makes a tower of how much? So 2 years, that's actually 6 cubes. Remove this. This is actually the 6 cubes. And then at 3 years, I have told you that the child is going to make a tower of 9 cubes. Okay, so draws a circle. Okay, so remember this, draws a circle. So at 15 months, the baby is going to scribble also. Okay, the baby is going to scribble also. This is the scribbling. Okay, then I have told you horizontal lines at 2 years. Okay, draws line, then draws circle at 3 years, draws cross at 4 years, draws squares as 4.5 years. 5 years there will be triangles. 6 years there will be diamond. Okay, so see this is mature pincer graph, this is immature. This is, once again, I've drawn the diagram. Okay, to just remember you. 2 years. Okay, now you know, this was also an FMG question which was asked that 100 words will be spoken by the kid at how much time? So remember, 2 years, double zero. Okay, so double zero, how many zeros are there? 2 zeros are going to be there, so double zero. 2 years, then 3 years is actually 3 things. So name, age and gender, 3 years. 4 is actually fraud. F for 4, F for fraud. So fraud means telling the wrong stories. 2 months, 2 and S look very similar. Social smile. 3 months, regards to the mother. So 3 months, MOM, mom. This is the mnemonic to remember. Mother regards. 6 months, anxiety. Anxiety is going to have X and I. So I've told you. Mirror, mirror image, MIRROR. Again, 6 letters. So 6 letters, you can remember 6 months. Okay. So mirror is also for 6 months. 9 months, yes. Bye bye, peekaboo. 9 months, yes. Of course, it is important. Okay. Clear? Okay. Yes, 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 you got it. Correct, correct, correct. Chalo. Now quickly comment in the chat box. Okay, on a scale of 1 to 100, on a scale of 1 to 100, how was the mnemonic for developmental milestone? How was the mnemonic for for developmental milestones? Priyanka, let's see. Oh, Priyanka says 1000. Ravi says 100. Chalo, chalo. Beautiful, beautiful. Session will last. Okay, that's actually your your this thing, your speed. Wow, guys, you are so beautiful. फिर से एक बार लेकर के आते हैं इंपॉर्टेंट चीज, ताकि हमारी क्लास को किसी की नजर ना लग जाए. हाँ, हमारी क्लास को किसी की नजर ना लग जाए. कम ऑन, ग्रेट 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 ग्रेट. चलो, coming on to kwashiorkor and marasmus. So we are in the growth and development, long way to go. Let's finish the things very quickly. So this is kwashiorkor, this is marasmus. So please remember kwashiorkor, K for kwashiorkor, K for kharab, K for kwashiorkor, K for kharab. So what do you mean by kharab? Kharab means there is poor prognosis, and from P, poor prognosis, you can remember P protein. Okay, so K for kwashiorkor, K for kharab. Kharab means poor prognosis. Poor prognosis, P for poor prognosis, P for protein, and you can remember post 1 year. So this is the chain which you have to remember. Okay, whereas marasmus is just like in Hindi we call it as marasmus mara hua. Marasmus is similarly like marasmus. Okay, marasmus. So remember mara hua, marasmus, that the child is going to be thin. That means there is going to be no edema. Although, dekho, the child is thin, there is no edema. Although, A for alert and appetite. The child is alert. The child is going to be alert. The appetite is also going to be good, but the child is not motu. The child is not fat. There is no edema. The child is going to be thin. Okay. So this is how you can remember. Okay. This is how you can remember that there is going to be what? There is going to be no edema. And one more important thing, interesting thing is kwashiorkor has got O. That means the child is going to be obesity or obese. The child is going to have edema, whereas in marasmus there is no edema, although the appetite is good. Okay, So identify this. This is kwashiorkor, this is marasmus. Okay, this is kwashiorkor, this is marasmus. Age of onset is actually more than 1 year, less than 1 year. Problem is in protein, is in calories. Edema is going to be there. Here there is wasting of muscle and fat. The appearance is going to be alert. In marasmus there is preserved appetite. The prognosis is good, whereas KH for kharab. So coming on to flecky paint appearance. Yes, in what you are going to see flecky paint appearance. So flecky has got K for kwashiorkor. K for kwashiorkor, that is hyperpigmentation of the skin. Yes, can you see this? Can you see this? This is actually the flecky paint appearance, and there is flag sign, that is alternate black and white pigmented hair. Alternate black and white pigmented hair. Okay, alternate black and white pigmented hair. Okay, right. So I hope that this malnutrition mnemonic is clear. That K for kwashiorkor, K for kharab, poor prognosis, protein post 1 year, and marasmus mara hua, although appetite is there, normal and alert, the child is going to be alert. Coming on to malnutrition. So you know that there are two types of malnutrition: acute malnutrition and chronic malnutrition. So remember, as per WHO, acute malnutrition is something that is for less than 3 months, and chronic malnutrition is something that is for more than 3 months. That is for more than how much time? That is for more than 3 months. Okay, so just remember that acutely what you are going to see and chronically what you are going to see. So remember, there are two things, there are two parameters which you have to understand. And my students, of course, I don't I don't believe that I'll just give you the concept and then you'll go home and scratch your brain and you will try to inculcate the mnemonics and tricks. Here itself I'm going to give you a superb trick to remember this. Remember this: height for age and weight for height. These are the two important parameters. Height for age and weight for height are the two important parameters. Now height for age, so can you see this? Height for age A and C are looking very similar. Yes, the A and C are looking very similar. So since the A and C are looking very similar, remember, C is for chronic malnutrition. C is for chronic malnutrition. Okay, so height for age is going to have similar to C, and C is for chronic malnutrition, whereas weight for height is having this W, and W is having the space for the formation of A. So weight for height is actually the acute malnutrition. Now weight for height is something which is called as wasting, and the height for age is something which is called as stunting. The height for age is something which is called as stunting, whereas the weight for height is something which is called as acute malnutrition. So similarly, see here, acute malnutrition is wasting, chronic malnutrition is stunting. Acute malnutrition is decreased weight for height, and decreased height for age is actually stunting. Okay, so just remember this. This is something which is important. Now, what do you mean by moderate malnutrition? So moderate malnutrition is, and when it is acute, it is called as moderate acute malnutrition, and SAM is severe acute malnutrition. So this is -2 to -3 standard deviation, and severe is -3 standard deviation. Just remember that if the weight and height is less than 3 standard deviation, if there is bilateral pedal edema, and if the mid-upper arm circumference is less than 11.5, any one if it is positive is indicative of SAM. Either the weight to height is less than -3 standard deviation, bilateral pedal edema, and mid upper arm circumference. So just remember this. This is 1, this is 2, this is 3. So 3 is actually less than 3 standard deviation. 2 is actually both bilateral pedal edema, and 1 is going to be less than 11.5 centimeter. Okay, so less than 11.5 centimeter. So if you have liked both of these tricks, बच्चे एक बार अच्छे से emojis हो जाएं in the comment section. Okay, I just want very beautiful emojis in the comment section if you have liked both of these extraordinary mnemonics, sir. Thank you so much. Thank you Kalingari Pravat. Thank you so much, bache. So happy, so happy. Definitely Samir bro, you are going to pass. Definitely Samir bro, you are definitely going to pass. 120% you are going to pass. In fact, all of you are going to clear FMGE, and especially for Samir. This is for Samir. Huh? Samir, तुझे किसी की नजर नहीं लगेगी. Don't worry. This is for Samir. Okay. Amazing. Chalo bachcho, quickly tell me in the chat. Like if the ALP is high, alkaline phosphatase level, if ALP is high, then tell me, and you are having widening of the wrist. Can you see this is widening of the wrist? This is bowing of the legs inwards. This is genu varus. Okay, this is genu varus. Okay, No, this is not genu varus. This is actually, oh, no, they have written it wrong. They have written it wrong. This is the lateral bowing now. So this is bowing of legs outward. This is genu valgus, not varus, right? And this is varus. So this is wrongly written, varus and valgus. Yes, correct. So the answer is actually rickets. But FMG teachers are not interested in asking if it is rickets or not, but they are interested in asking like which type of rickets is this. So in order to check the type of the rickets, you have to first of all check the levels of serum phosphate. So there's a dictum which you have to follow in order to check that which type of rickets is this. So remember, first of all, you will take an idea of the level of phosphates. Okay, so first of all, you have to check for the phosphates, and after that you have to do an ABG. Okay, and after that ABG you have to check for acidosis actually. Okay, and then you have got something which is called as parathyroid hormone. So next you will see about the parathyroid hormone. Okay, so this is the workup in order to see what, in order to see the type of the rickets. So PAP is actually the mnemonic to see the type of the rickets. So first of all, P, so that is serum phosphate. So please understand, level is high. If the serum phosphate level is high, this is straight away going to tell you that this is actually the CKD. Why? Because in CKD, it's the chronic kidney disease and the phosphates will not be excreted out. Okay, it is not going to be excreted out, and since it is not going to get excreted out, the phosphates level are going to increase in the blood, and since the phosphate level are increasing in the blood, this is actually because of CKD. So a rickets with high phosphate is actually CKD, but if it is low, then you have to go to second option, that is acidosis. You do acidosis. If there is acidosis positive, it is acidosis. This is renal tubular acidosis. And if the acidosis is not there, then we have to go for P. What is P? P for parathyroid. So if the parathyroid levels are high, if the parathyroid is okay, if the parathyroid is normal, so what is the function of parathyroid? So parathyroid is responsible for decreasing the phosphate levels and increasing the calcium levels. Okay, so if the parathyroid levels are normal, there will be hypophosphatemic. There will be what? There will be hypophosphatemia. Why? Because the function of parathyroid is decreasing the phosphates and increasing the calcium. So if the parathyroid is normal, the phosphate will be low. So this is familial hypophosphatemic rickets. But if the parathyroid levels are high, it is highly indicative that it is the vitamin D dependent rickets. Vitamin D dependent rickets type 1, where there is decrease in vitamin D, and type 2, there is a resistance to the vitamin D receptors. So this is how you are supposed to take care. If they ask you which type of rickets is this, remember this mnemonic PAP. So PAP, you have to check for serum phosphate level. If it is high, then it is renal. Then if it is low, you have to check for ABG. If there is acidosis, this is RDA is going to be there. And in the end, you have got another P, that is parathyroid. So if parathyroid is high, it is YDDR. If it is normal, then it is familial hypophosphatemic rickets. Coming on to this vitamin, just quickly tell me, if they write pure vegetarian in the, if they write pure vegetarian in the question, which vitamin do you think it is deficiency? Okay, they write a pure vegetarian female is going to come B12. Very good. Abdullah Sheikh is the first person to give the correct answer. This is vitamin B12. Surya Prakash, Akash, Kalingari Prabhat, Dr. Priyanka, Joshna Joshi, Ashvi, Ravi, Sakil. Very good, bache. Very good. That's going to be vitamin B12 deficiency. Vitamin B12 deficiency. Coming on to the next slide, beta. So vitamin A. Okay, vitamin A can also be decreased. So you have to remember the dosage of vitamin A. So if the child is less than 6 months, we have to give 50,000 international units. 6 months to 12 months, and the weight is less than 8 years. So remember 12 months, that is 1 year. So you have to give 1 lakh. So it's very easy to remember, 1 year, 1 lakh, more than 1 year, 2 lakh, 6 months, 50,000. What is the schedule? Schedule is going to be day 0, 1, and 14. Day 0, day 1, and day 14. Okay. So you have to give this until how much time you're supposed to give it? Till 5 years of duration. Okay. Till 5 years of duration, you are supposed to give it. Okay. So 5 years of duration, or you can remember till 5 years of the age of the baby. Coming on to genetics. So Down syndrome. Yes, Down syndrome. Quickly tell me, what is the etiology of Down syndrome? Yes, 95%. What is the etiology? Yes, bache. What is the etiology? No, trisomy 21, I know. Okay, fine. Trisomy 21. This is something which I think everybody knows. But what is the cause of this trisomy? And the person who is going to give me the cause of the first right cause of trisomy 21, you are going to meet somebody. Okay, so somebody is waiting for you. Genetic maternal, nahi bache. So the most common cause is non-disjunction. Okay, non-disjunction. 4% causes Robertsonian translocation. Robertsonian translocation. And then Robertsonian translocation. And then 1% is going to be what? Yes, 1% is going to be what? Hanji, 1% is mosaicism. So ये इतना cute सा baby कोई मिलने आया था आपसे, but since you people were not able to answer, baby is not going to meet anyone. So okay, so coming on to the clinical features, these are important clinical features. We are in the topic of genetics. So remember that they will have what? They will have the mongoloid facies, they will have simian crease, they will have sandal gap, that is the gap between the first and the second toe, and there will be clinodactyly curved little finger. So little finger is going to be curved. Okay, so if I just try and make the Down's hand, so this is the Down's hand. So what is Down's hand? See, you will be having, sorry, this is the Down's hand. So what is this Down's hand? So there is a sandal gap. Okay, there is a sandal gap which is going to be there. What is this? Yes, what is this? This is the clinodactyly curved little finger. What is this showing? This is going to show you single transverse crease. This is going to show you what? Single transverse crease. So you can just take a screenshot of me posing like this, and later on tag me on Instagram. I'm posing like this. Okay, so can you understand? This is clinodactyly, this is the sandal gap, and this is what? This is the single palmar crease. Okay, single palmar crease is going to be there. Okay, what about the CVS? Now what about the cardiovascular system? So the most common defect in the Down syndrome is endocardial cushion defect. Most common is going to be endocardial cushion defect. And in the valvular defects, the mitral valve is the valve which is at highest risk. Okay, in the valvular defect, the mitral valve is the valve which is at higher defects. Leukemia, of course, everything is actually high cause, but then ALL is something which you have to understand, and ALL is the most common thing which is seen in the Down syndrome. Okay, leukemia. But if they ask specifically, like in less than 3 years, so AML M7 is something which is actually most common. So remember this I have told you. Okay, endocardial cushion defect, you can remember D and E. D for Downs, and D and E come very close in alphabet, so E for endocardial cushion defect. Okay, coming on to the genetics now. Coming on to this genetics, so how will you check for this? Is also a FMGE previous year question. Okay, previous year question. Okay, so this is yes. Okay, so is this line written correct or wrong? I have is something which is written here correct or wrong? Yes, quickly tell me. Quickly tell me. So send one India's flag in the comment section, showing your love to our country, showing your love to the nation. Send an Indian flag in the comment section. Okay, so remember this. This is one is Papa, PAPA. Then another is Beta. Okay, so what is this Papa and Beta? So remember this, in the first trimester, to see the Down syndrome, we do the dual marker. Beta is going to be beta HCG, Papa is going to be PAPPA. Yeah, very good. So I can see Sujala Sufala Malaya Shitalam. Great. So please understand this Papa and Beta. So Papa, India. Okay, so Papa, Beta, HCG. So this is the mnemonic to remember the dual markers. Okay, first trimester dual markers. Okay, so this is how you can remember that in the first trimester we can understand, we can remember this by this thing. Okay, papa and beta kalingari. Chaliye, in second trimester what, the second trimester, so I think that must everybody will agree to this, huh? घर में कलेश करने वाली, yes, who is the one? Bua. So in second trimester you have to remember Bua. You have to remember what? You have to remember Bua. So I was not able to download the image of Donald Trump, so I just called Bua. Otherwise, Trump was also the same only, huh? Bua-like condition. So Bua. So what is Bua now? So Bua is something which you can remember for second trimester. So Bua means B for beta HCG. Yes, B for beta HCG, U for unconjugated estrogen, A for AFP. A for what? A for AFP. Okay, A for what? A for AFP. So B for beta HCG, U for unconjugated, and A for alpha fetoprotein. And from BUA you can remember bi is 2 for second trimester also. Second trimester also. Okay, so this is BUA now. Coming on to quadruple test. Coming on to quadruple test. So quadruple test and the triple test. Okay, so quadruple test and the triple test. Now this is the next time to understand about quadruple test. So so remember the quadruple test and you will be able to understand the triple test, or you can simply remember the second trimester BUA, B for beta HCG, U for the unconjugated estrogen and AFP, and in quadruple there is inhibin A. One more is inhibin A. So if you inhibit inhibin A in quadruple, you will get triple. Okay, if you inhibit inhibin A from quadruple, you will get triple. So this is actually how to remember this. And then there is a mnemonic which says high. So high is H and I. H for inhibin A and beta HCG, it is high. So in downs, these both are high, whereas unconjugated estrogen and AFP is less. Okay, so if you got this, if you understood this, and if you like this mnemonic, just quickly write Vande Mataram in the chat box. One like, one comment, one love for the country, and tell your country mates that we are working for our country only. We are working. We are going to be the best doctors, but FMG बन के नहीं, IMG बन के best doctors बनेंगे. IMG बनेंगे. Screening exam फटाफट से पास करेंगे. Write down Vande Mataram. Write down Vande Bharat. Write down Jai Bharat in the chat box, and tell everyone that India is the best country. We don't need any bua, we don't need any beta. बाप तो बाप होता है. जय हिंद, जय भारत, वंदे मातरम. Superb guys, superb, amazing, amazing, amazing energy. Vande mataram, vande mataram. Coming on to the next disease, that is called as retinoblastoma. So what you're going to see in retinoblastoma, I think you people know that retinoblastoma is nothing but a tumor of the retina. Okay, so retinoblastoma is nothing but a tumor of the retina. So see here, in the tumor of the retina, what you're going to see, you are going to see bache like this. Can you see this? Can you see? This is actually white pupillary reflex. Okay, this is actually what? This is the white pupillary reflex. Okay, white pupillary reflex is going to be there. There will be strabismus also, there will be squint also, which is going to be there, and there will be secondary glaucoma. Now why there will be secondary glaucoma? See, because retinoblastoma is itself a tumor, so tumor is going to increase, tumor is going to occupy this space, and since it is occupying this space, there is very less time for the very less space for the intraocular pressure, so the intraocular pressure is going to increase. Okay, so because there is intraocular pressure increase, and it is occurring in the little babies, cute little children, the ciliary body can't grow properly. So when the ciliary body is not growing properly, the eye is not enlarging in size, so after some times when the IOP is going to be normal, the size of the eye will be seen and the size of the eye will be smaller. Why? Because when it was a time for ciliary body to grow, there was not sufficient space, so now the eye is chotu, so there will be subophthalmos, there will be small eye, subophthalmos, secondary glaucoma is going to be there, there is going to be strabismus that is going to be there. There is going to be white pupillary reflex which is going to be there, and on gross examination you will see a chalky white appearance, chalky calcification. On light microscopy you will see flexner, Winter-Steiner, true rosette, and small round blue cell tumor. So remember, this R for retinoblastoma, R for round cell, it is going to be there for retinoblastoma. Okay, retinoblastoma you have to remember. And remember, Winter-Steiner has got this word winter, and R and E are coming, so R and E for retinoblastoma. Okay, Winter-Steiner you have to remember for retinoblastoma. What is the treatment? So W and V. Okay, so VEC, okay, which is, you can remember, so V for vincristine, E for etoposide, and C for carboplatin. Okay, C for carboplatin. Okay, 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 okay. Chaliye bache, this question is for you. Yes, quickly type in the chat box, Vande Matram. Beautiful people, love you all. Vande Matram. Yes, quickly tell me. Meena ji says A. Very good, bacho. Meena ji, Vishnu, and Monster Hunk, AYR, every one of you, superb beta, superb. This is actually osteogenesis imperfecta. So multiple fractures with the blue sclera. Whenever this question is going to come, the answer is going to be osteogenesis imperfecta, which is actually a collagen defect, bache. So the collagen is not formed properly, and since the collagen is not formed properly, the sclera is not formed properly, so there will be underlying vessels which will be visible, and since the underlying vessels are going to be visible, you are going to have a blue sclera which is going to be there. Okay, 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 okay. चलिए, ये बहुत सारी ईंटें हैं, ये बहुत सारे पत्थर हैं, ठीक है. There are lot of bricks. Okay, so this is next question. Okay, so patthar ka dil. Some people have a stone like hard heart. Some people even don't have heart. So the question is for those people only. So the patient with no heart on the left side, that means the patient is having no heart on the left side. So the patient is having heart on the right side. That is actually called as situs inversus. That is actually called as situs inversus plus recurrent infection. Can you name a syndrome from this? Yes, can you name a syndrome? If the patient is having right-sided heart, ascites inversus, and recurrent infections, can you name a syndrome after it? Yes. What is the syndrome? Identify the syndrome. Yeah. Some people don't have even heart. Some people have a heart full of bricks. पत्तों की तरह बिखरे थे हम, किसी ने समेटा भी तो आग लगाने के लिए. So ये आग लगाने वाले ही होते हैं पत्थर दिल. कार्टाजेनर, ब्यूटीफुल बच्चे, ब्यूटीफुल ब्यूटीफुल, सुपर प्राउड ऑफ यू. दिस इज एक्चुअली कार्टाजेनर सिंड्रोम. कार्टाजेनर सिंड्रोम, साइटस इनवर्सस, रिकरेंट इन्फेक्शंस प्लस साइनोसाइटिस. Okay, now I can't see there was one student, I just forgot. Keval, yes, Dr. Keval. Dr. Keval has left the chat or what? Huh? So I was supposed to have a shairi for Dr. Keval, but Dr. Keval is not here. Chalo, coming on to the next, genetic disorders. Okay, so who is this singer? He is Farhan, and Farhan is very beautiful singer. So just remember that Farhan is actually a very beautiful singer. So Farhan gata hai. So Farhan gata hai. This is GAA, Friedreich's ataxia. So F for Farhan. Farhan gata hai, GAA. So genetic disorders. This has been a beautiful important question, that GAA trinucleotide repeat is in the Friedreich's ataxia. Then you have got a CAG that is seen in Huntington's disease. So can you see this CAG, cage? Yeah, CAG is actually cage. So cage is Huntington's disease. Hunter hunts and put animal in the cage. So cage is CAG and hunter is Huntington's chorea. Myotonic dystrophy, see, muscles are actually important when you are supposed to travel to Gujarat to play dandiya. So myotonic, the tone of muscle is important when you want to travel to Gujarat. So Chandigarh to Gujarat is the mnemonic CTG for myotonic dystrophy. You go to Gujarat and Ramtiya re mari Ramtiya re. So so this is how I just I just don't know the mnemonic properly, but then the song properly, but then something Ramti Are. I just used to enjoy this song a lot. Anyways, so CTG, Chandigarh to Gujarat, we need muscles. Okay, so this is how you can remember. Then CGG, Fragile X syndrome. So GG in Rajasthan is actually sister, and not nowadays, but there was a time when sisters used to be fragile. So just remember GG, CGG, Fragile X syndrome. Okay, GG is something you can remember. Okay, you can remember like this. Okay. Coming on to chromosomal translocations, again, very, very important. Ye mnemonic. This mnemonic is, again, personally my favorite. And if you like this mnemonic, just comment in the chat box superb. Okay, just comment in the chat box superb. So let me tell you the mnemonic now. Okay, chalo, see here. So this is 8 14 11 14 11 18 14 18. So first of all, you have to observe a pattern that the smaller letter is written first. 8 14 11 14. Okay, 11 18, just like this. Okay, 14 18, just like this. So the pattern is, once first we will write the smaller word and then the bigger word. So if it is 8 14, after 8 is coming, so 8 and B are actually similar looking. So 8 and 14 is going to be Burkitt's. 8 is going to be similar to B, and B is actually Burkitt. So Burkitt lymphoma is going to be 8 is to 14. After that, you have got 11. So 11 14 11 18. So remember, 11 18 is the 8 letters word. So 8 letters is MARGIANAL. Okay, MARGINAL, marginal. 8 words are going to be there. So 11 18, 11 18 is going to be marginal. So if 11 and 18, 8 word is marginal. If it is coming in 11 and 18, please understand mental is going to come in 14. 11 18 marginal, M for marginal, M for mental. F for okay, 14, F for 14, F for follicle. So follicular lymphoma is going to be 14 is to 18. So if 14 is coming, okay, then it is follicular. But I have tried to tell you this, okay, that it is 11 11 14 18, and this is like this. Okay, then you have got 15 is to 17. So remember, 15 is going to be promyelocytic leukemia. Promyelocytic leukemia. So remember, P for 15. So P for 15, then pro. So promyelocytic, P for 15. So this is how you can remember very easily. Then translocation 922 is very, very, very important. 922 is very, very important. Remember, all CML. So all and CML, everybody remembers that it has got 922. Just all is something which you have to remember. Okay, all CML is 922. 922. Priyanshu says loving this lecture even though kal OBGY ka exam hai. Chalo, it's okay, completely fine. So A all and CML 9 and 22. This is something which you have to remember. And if you have like this trick, like this mnemonic, now it's your time to tell me in the comment section. Quickly tell me in the comment section, how was the mnemonical chromosomal translocations? The chromosomal translocations which you people used to find very difficult, now I've made it super, super fun and super easy for all of you. Yes, amazing. Yeah, good, Ashvi, good. I'm so happy. Yes, thank you, guys. Guys, yeah, you are superb. You are wonderful. You are wonderful. Amazing. Chale, coming on to this one now, 15 and 17. This is again important. So 15 and 17, they both were actually fighting someday. Okay, 15 and 17 were someday fighting with each other, and you know what happened? Uh, I love the confusing tables more. Okay, Ji, okay. So now understand. So 15 and 17 were fighting each day. So 17 said that, oh, 15, you are only going to get fibrillin. Okay, oh, 15, you are only going to get fibrillin. Rest everything I will take. So 15 got fibrillin. So FIF for 15, FIB for fibrillin. So fibrillin 1 gene is going to go to 15. Rest everything like BRCA 1 to 17, NF 1 to 17. Okay, and P53 is something, so that is also going to go to 17. So P53, you can remember 5 plus 3, although it is 8, but you have to remember it is just like 17. So this is how remember. how to remember fibrillin 1, 15, Barca 1, so this is 1, 1 coming, go to 17, except if it is fibrillin 1, then you will have to go for 15, and P53 is going to be 5 plus 3, just like 17. Okay, and for okay, 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 okay. Okay, okay. Arka says, sir, आप सारे subjects पढ़ा दो. Okay. Sir, you please take pathology RR. All these mnemonics are very helpful. Oh my God. Oh my God. Thank you. थैंक यू. चलो ये टेबल पढ़ते हैं, उसके बाद मैं आपसे पूछूंगा आपको कौन कौन से सब्जेक्ट्स पढ़ने हैं, देन आई विल टीच यू ऑल दोस rapid revisions as well, don't worry. Okay, so let's see here. Barca 1, I have told you everything goes to chromosome 17, which is having 1 chromosome 17q. Barca 2, just remember Barca with two beautiful eyes ko patao. Okay, so Barca with two beautiful eyes ko patao. Okay, so Barca 2 means Barca 2. Okay, so Barca 2 means two eyes. Okay, Barca with two eyes. Barca BRCA2, that is going to have 13. Eyes means retinoblastoma. Retinoblastoma is also going to have 13. Okay, right? They are also going to have 13. And Pataus is also going to have 13. So this is how you can remember Barca with two eyes ko Patau. So this is 30, which you can remember. Barca that, no, not Barca. Coming on to NF1. So I have told you anywhere you see 1, you have to write 17. NF2. So from 2, you can remember 22, that is 22. Fibrillin, I have told you only 15. And fibrillin 2 is going to have 5. So 15 and 5, this you have to remember. P53, I have told you 5 plus 3 is 8, but you have to remember 17. Met. So if two people have met in Hindu culture, they will undergo 7 feras. So if two people have met, 7 feras. Chromosome number 7. Ret, so RET ret, T and 10, so T and E is coming, so 10, chromosome number 10. VHL, so from me you can remember like PARV. So if you remove V from my name for VHL, only 3 letters are remaining. So 3P is the trick to remember that. Coming on to APC, so APC has got A and P and A, so 5, PAA and CH, 5, and APC, so AP and PA are coming, so 5 is going to be 5. MHC, so MHC is actually major histocompatibility complex. Histo is just like 6to, so chromosome 6. So histo is just like 6to, that's going to be 6P. RB, I have told you 13, ठीक है, 13 बरखा की दो आंखें को पटाओ, ठीक है, पटाओ 13, everything 13. Then WT, so WW is something which you have to remember 1 1, so 11 11, WT 1 11. Okay, so just like you have to remember this. Okay, so this is all of the important genes on different chromosomes. Now tell me what all subjects rapid revision you want to read from me. Yes, what all rapid revision you want to learn from me. Yes, tell me. Yes, 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 okay. Surgery, anesthesia, medicine, PSM, medicine, pathology, surgery, anesthesia, PSM, physiology, पैथो, मेडिसिन, पीएसएम, सब पढ़ा दूं. चलो ठीक है, ठीक है, ठीक है. Okay, okay, I'll try and share your feedback to them. Okay, okay, okay. Coming on to, yes, 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 yes. Acha, now tell me, yesterday was your biochemistry class. So has madam covered the pedigree charts, or am I supposed to take the pedigree charts? Quickly tell me if you want me to take the pedigree charts, or if madam has already covered the pediatric, I mean the charts. Please take it. You take it. You can continue. Not covered. She didn't cover. Ma'am has already taken. Ma'am has already taken. Okay, 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 okay. I'll take it. I'll take it. I'll take the pedigrees. Don't worry. So, which is, see, in while pedigrees, you have to take two things in mind. One is you have to take that you have to take into account the generations. Like if all the generations are going to get affected, and then you have to check if all the genders are getting affected or not. So genders means male and female. You have to check. Okay, that who is going to get affected. Ma'am has taken, but it was in heaven. Heaven, Bapre. Okay, now see this. Now see this. See this, bache. So can you see there is no generation, there is no continuous generation. There is no continuous generation. So remember this, that generations can be either dominant, okay, either the continuous generations, or there can be no continuity. Okay. So all generations and not all generations. So if not all generations are covered, this is something which is called as recessive. And if all generations are going to have it, then this is called as dominant. Okay, so can you see this, that there is no all generations are there? Okay, all generations are not there, and since all generations are not there, this is going to be autosomal recessive. Since all generations are not there, it is going to be, yes, it is going to be what? It is going to be a autosomal recessive. Autosomal dominant means, yes, autosomal dominant means all the generations are going to have it. So they are also going to have it, they are also going to have it. So all generations are going to have it. So this is going to be dominant. So dominant is done, recessive is done. Now gender. So if there is any gender specification, if there is any gender specification, it is going to be X-linked. And if there is no gender specification, then it is going to be autosomal. Now, since in this you have already seen that there is, the girls are also affected, the boys are also affected, so it is going to be autosomal as well as dominant. What happens in X-linked recessive now? So remember, because it is recessive, there can be a skipping of generation which can be there. So can you see here? There is no disease, but the disease came. Okay, okay, right, right. So this is going to be the case. This is recessive. Now, how to check if it is X-linked recessive or not? If it is X-linked recessive or not? So remember this. If the mother, okay, if the mother is going to give, okay, if mother is going to give, the mother is going to give to both the children. Okay, the mother is going to give to both the children. But if it is father, the father is going to give to daughter. Okay, the father is going to give to daughter, mother is going to give to all children. Mother to all. See, mother is cute na. So mother never distinguishes. Okay, so mother is going to give to everyone, whereas the father is going to give only to what? To only to the daughter. Okay, so this is actually X-linked recessive, something which you have to understand. What about X-linked dominant? So of course, skipping of generation is not going to be there. Okay, okay, right. So the skipping of generation is not going to have there is no skipping of generation. This you have to understand. Okay, and X-linked dominant, if the father is going to be having, so all the daughters are going to be there. If a son has it, its mother has also this disease. Okay, so mother will also have this. I mean, if the son is affected, the mother has to be affected. If the father is affected, then daughter has to be affected. This is X-linked dominant, which you have to understand. Okay, right. So this is the cute little hint of pedigree. Now coming on to other trisomies. So this is something which you have to remember. Trisomy 16 is something which is there in the most common trisomy in spontaneous abortion. So remember S for 16, S for spontaneous this thing, spontaneous abortion. Then next is Edward. So E for Edward, E for 18. Okay, trisomy 18, Edward. This is actually the second most common trisomy. Okay, second most common trisomy. Okay, so the next important thing is move the rock with clenched fist. Move the rock with clenched fist. Chaliye, quickly type in the chat box, how is the Josh? Okay, are you ready to move the rock with clenched fist? Are you in to give your 100%? My dear FMGE warriors, my dear FMGE winners, क्या हुआ 10 बजे 10:20 हो गई sir, till what time the class will be? Guys, the people fighting there with the bad nation, with the worst nation at the borders are fighting in the night time, 2 o'clock, 3 o'clock, 4 o'clock, and you guys are like, sir, till what time the class will be? No. How is the Josh? Quickly type in the chat box. Yes. How is the Josh? How is the Josh? Whole night you can continue. Yes, bache, this is the Josh. This is something which should be there inside you. Yes. Yes, bacha. Yes, definitely. We are not the people who are going to throw our weapons and say, okay, fine, we are not able to do. And no, we are Indians. Bharatiya ho tum log. You are born with 110% of aggression, power. Strong, everything strong. Okay. मीना जी सिंह बस एक शायरी. Okay. 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 You want a शायरी? I'll give you a शायरी. I'll give you a शायरी. कि वैसे तो तेरी महफिल में, वैसे तो तेरी महफिल में मेरी हार देखने वाले बेकरार होंगे. वैसे तो तेरी महफिल में मेरी हार देखने वाले बेकरार होंगे. जीत का असली मजा तो तब आएगा जब मेरी हार की दुआ करने वाले 1000 होंगे. Okay. So everyone is waiting that you fall. Everyone is waiting that you lose. But believe me, when everyone is waiting for you to accept that you can't do, that is the moment when you will say to yourself, yes, I can. Yes, I can and I will. अपना टाइम जो है उसको हमें प्रिजर्व करना है, कंजर्व करना है, and we will rock. We will rock. Okay. Okay, so move the rock with the clenched fist. What is this? This is actually the Edward syndrome. Okay, move the rock, and rock को हम लोग ईंट बोल सकते हैं, and ईंट अगर बोलेंगे so E से ईंट हो जाएगा, E से Edward हो जाएगा. So just remember, move the rock with ईंट with the clenched fist. So remember, in Edward you will have a clenched fist. Move is the mnemonic. So MOVE, M for micrognathia, O for prominent occiput, V for VSD. Okay, and rock with a clenched fist. So E is actually Edwards only, and clenched fist ho gaya, and rock means rocker. Okay, so M for micrognathia, occiput, V for VSD, E for Edwards. Okay, and then you have got move the rock. Rock is actually rocker bottom foot, clenched fist. Okay. Great. चलो, coming on to pataus. So किसको पटाओगे बताओ? किसको पटाओगे? Yes, quickly type in the chat box. किसको पटाओगे? बोलो. Yes, किसको पटाना चाहते हो? बोलो. Okay, so this is the mnemonic as of now. Okay, this is the mnemonic as of now. So remember this, that whenever it comes to Patau syndrome, you have to remember my name. This is P and V. P for polydactyly. Post axial dactyly or polydactyly. Okay, post axial means, see this is actually the axis which is passing. So either post axial means like after this axis, so in little finger you will have a additional finger. So this is the polydactyly, little finger mostly. And holoprosencephaly, so forebrain is going to be incomplete. P for prosencephaly. Then again P for palate, so cleft lip, cleft palate. And then V for VST. So this is how you have to remember. Okay, you have to remember. Okay, yes, correct. Coming on to the Klinefelter syndrome and the Turner syndrome. One second. Coming on to the Klinefelter syndrome and the Turner syndrome. So remember that Turner syndrome is the most common. Okay, so this is actually aneuploidy. Okay, so 47 XXY, double XY is going to be Klinefelter. That's the most common cause in males. And then in Turners, it is most common cause in females. Like this is 45XO. Okay, so if you ask the patient, this is how we used to remember. Ask the patient to turn, and the patient is going to turn. Ask the patient to turn, and the patient is going to turn. Now, what does this mean? Ask the patient to turn and the patient is going to turn. That means the IQ of this patient is normal. Whenever you will ask the patient to turn, the patient is going to turn. Okay, so this is the mnemonic to remember. Although you understand that the S and T comes very close. Okay, so there will be short stature which is going to be there. There will be small distance which is going to be there. Oh, sorry, short distance which is going to be there. Okay, short distance is going to be there. Then shield chest is going to be there. Okay, flat chest or shield chest is going to be there. Then S for widely spaced nipple is going to be there. Widely spaced nipple is going to be there. Then you have got S for streak ovary is going to be there. Okay, streak ovary means rudimentary ovary. Okay, and cubitus valgus is also seen. Okay, valgus is just like this. Cubitus valgus is also seen in them. You know that it is 45XO, and that's why there is decrease in estrogen. So there will be low fertility and delayed puberty that's going to be there. And what we have seen in Turners, you have webbed neck. Okay, and remember this, that you have got a mnemonic says bhat. Okay, so bhat is going to be the mnemonic. B for bicuspid aortic wall, that's the most common problem. H for horseshoe shaped kidney. A for coarctation of aorta. Okay, and T for Turner. So B for what? Bicuspid aortic valve. H for horseshoe shaped kidney, and A for coarctation of aorta. Bhat is the mnemonic for your Turner syndrome. Now in Klinefelter, the IQ is low. Okay, the IQ is low. Then tall stature is going to be there. There will be gynecomastia, that is going to be seen in the Klinefelter syndrome. Okay, then after that you have got limbs, long limbs are going to be there. Then you have got cryptorchidism. Okay, in them. Okay, cryptorchidism is going to be there. Infertility, and yes, there is high chances of malignancies like male breast cancer and extragonadal germ cell tumors, which have highly going to go to what? Going to go to your mediastinum. So just remember K for Klinefelters, and in Klinefelter you have to remember K for Klinefelter. K and C are rhyming. So C for chest, and from chest you can remember that most of the times they are going into the mediastinum. So this was about the Klinefelter versus the Turners. Now this is Dehydration syndrome. I hope that you know that there is a mnemonic called as Catch-22. So C for conotruncal cardiac abnormalities. So remember which cardiac abnormalities are going to be there? Conotruncal cardiac abnormalities. So remember that in alphabet C and D comes very close. So C for conotruncal, D for digeorge, then A for abnormal facies, then T for thymic hypoplasia. So of course your the levels of parathyroid hormones are going to be decreased, and that is why there is hypocalcemia. Calcium is also less. 22 is 22q11, and then C for cleft lip and cleft palate also. Okay, okay. So for all the boys, quickly tell me in the chat box, do we have got balls to win the FMGE exam? Yes, quickly tell me, all the boys sitting in the class, do we have got balls to win the FMGE exams? All the boys, in fact all the students, do we have got balls? Yes, Krishna says yes. Krishna says yes. So we have got enough guts. So now, why did I ask? Because I want to ask this from you all. What is the first sign of puberty in boys? What is the first sign of puberty in boys? What is the first sign of puberty in boys? Very good, Meena ji. Meena ji is absolutely right. So the answer is testicular enlargement. That's why I asked you that question, that have you got enough balls to win over the FMG exam? So testicular enlargement. Yes, correct. सच्चिदानंद says आप टायर्ड लग रहे हैं. हाँ, आप आए नहीं थे तो मैं टायर्ड था. अब मेरे प्रभु, मेरे राम, मेरे सच्चिदानंद आ गए हैं चैट में. So I'm super charged. Yes, correct. Shobi Khan, are you faculty in? No, I am not faculty anywhere. I'm faculty here. The most important part is I am a faculty, and I'm so happy that all of you have joined. Yes, chalo. Good. Chaliye beta. Coming on to the very important table, what is the most common heart abnormality? So this question has also been asked many a times. So this question have been asked many times. Okay, in digeorge, okay, tell me, in digeorge, what you are going to have in congenital heart syndrome of digeorge, what is going to be there? So remember, digeorge, di is the word di means two. So di means two, t for two. Okay, t for t and t for t. So in digeorge, truncus arteriosus is the most common part. Truncus arteriosus. So di means two means truncus arteriosus. So t for two, na. So t for truncus arteriosus, and then you can remember two t's altogether. What is two t's? 22. So 22 is the mnemonic to remember the Digeorge syndrome. 22 is the mnemonic to remember the Digeorge syndrome. Okay. Then you have got Holtoram. So remember Holtoram. H for Holtoram, H for bhai kuch bhi ho jaye, hasde. So hasde H. H is ASD. So ASD. So Holtoram is going to be hasde. Okay. Hasde. अच्छा चलो अब सब लिखेंगे चैट में नादिया. Now everybody will write in the chat box. Nadia. Now I can see the chat box. Huh? King of Alpha, आपको पता नहीं है? This is a very famous thing right now. These days, Nadia. So whenever somebody says Nadia, everybody writes G. Okay. चलो चलो बाप रे आप तो नादिया पे ही भागे. So okay, Holtoram syndrome is going to be there. Holtoram is Hasde, ASD is going to be there, and Nadia is another mnemonic which you have to understand, that Nadia also always laughs. Okay, Nadia also always laughs. So just remember, yeah. So Nadia, you have to just remember that NOO, that is Noonan syndrome. Nadia always laughs. So Hasde is mnemonic for Nadia also. That means Nadia or Noonans is also going to have ASD always. Nadia is also going to have ASD always. Okay, right? So Los Janji says, after MBBS, I left medical field, and your video popped in my feed, bring back my MBBS memories. Thank you so much. God bless you. Okay, coming on to Alagille syndrome. Alagille syndrome. So Alagille syndrome, remember, FMG pass karna alag baat hai. Huh? So, so just remember this. What's the famous meme? सपने देखना अच्छी बात है. हाँ, just like this. So FMG पास करना अलग बात है. So FMG पास करना अलग बात है मतलब अलग is Alagille syndrome, and pass is something which you have to remember from P, A, and S. Peripheral artery stenosis. Peripheral artery stenosis. Peripheral artery stenosis. Okay, so अलग बात है पास करना. So pass peripheral artery stenosis. देखो कितनी मेहनत करता हूँ. See the amount of work I'm putting in for you. So next is Noonan. Noonan is Hasde, ASD, Down syndrome. I always say C and D come together, so you will have AV canal defect or endocardial cushion defect. Okay, so these are actually synonyms. C, D, and E. C for canal defect, E for endocardial cushion defect. Endocardial cushion defect. Coming on to Williams syndrome, so just remember it is supravalvular aortic stenosis. Supravalvular aortic stenosis. So V and V coming together and forming a W. So remember in Williams syndrome, you will have this V and V. Supravalvular aortic stenosis. Char syndrome, leave it. And next you have got Marfan's. So Marfan's has got this A and R word. This is aortic root dilatation. Okay, aortic this thing. Okay, you got it. Great. Okay, and this Hasde is actually beautiful. One one more meme is also nowadays very famous. हसदे चेहरिਆਂ ਦਾ ਮਤਲਬ ਇਹ ਨਹੀਂ ਹੁੰਦਾ ਕਿ ਉਹਨਾਂ ਦੇ ਜੀਵਨ 'ਚ ਕੋਈ ਦੁੱਖ ਨਹੀਂ ਹੈ. I am from Punjab. I love Punjabi and I speak Punjabi at my home itself. Okay. चलो. Good. Coming on to now this. चलो बच्चों बताओ जल्दी से. Yes. Identify the disease quickly identify the disease. जिसने सबसे पहले इसका आंसर दिया था, for the first person who will give the answer to this question is going to be the bravest soldier of my army, and मैं समझूंगा that you have killed one terrorist in Pakistan. Yes, who is the one who can kill? Yes, Fragile X, very good. Tawfiqa Nasreen, मार गिराया आपने एक टेररिस्ट को. Beautiful. Beautiful. Very good. Amazing. This is Fragile X syndrome. Fragile X syndrome. In Fragile X, you have to remember this F and remember this E. So what is E? E is actually for eyes and ears. So eyes have strabismus or squint. E for ears, protruding ears. Then you have got F. F for long face, broad forehead, and X is just like this, no? X is just like this. So what is this? X is just like this. That means a prominent jawline. That means what? That means a prominent jawline is going to be there. Okay, quickly identify this infectious disease now. Yes, quickly identify this infectious disease. Measles, very good, bache. Identify the infectious disease. This is measles. They will have a rice grain appearance. Can you see? This is a rice grain. This is a rice grain appearance. Rice grain appearance. So rice grain appearance with surrounding redness is going to be there, and the rash is going to start behind the ear in measles. So remember ME. So E means ear. So behind the ear it is going to start. Coming on to the acute problem, acute complication. So acute is most common. So CO is common. OM. So M. Yes, OM is the most common one. So most common acute is O and M. That is, so can you see most common has got this O and M word, and the answer also is O and M. That is otitis media. Otitis media. Okay, otitis media. And then you have got bronchopneumonia as well. That is the most severe one. Bronchopneumonia, that is actually the most severe one. Most severe one. Okay, correct. Next is chronic. So please remember, chronic is subacute sclerosing panencephalitis. Subacute sclerosing panencephalitis. Chronic. Okay, subacute sclerosing panencephalitis. That is the chronic one. So what you will get, you will get seizures and you will get the personality disorder in it. So remember, S for seizure and panencephalitis, personality disturbance, which is going to be there. Okay, chaliye. Yes. Quickly tell me, what is the most common cause of non-syndromic hearing loss? Yes, quickly tell me, what is the most common cause of non-syndromic hearing loss? I have bright future नहीं है. Yes, बच्चे, quickly tell me, what is the most common cause of non-syndromic hearing loss? Veneers? No. CMV. Very good, Dr. Reshma. Dr. Reshma. Very good. Very good, Dr. Reshma. Very good, Dr. Reshma. So what is the sample taken? So in order to see, you will take a urine sample. Okay, you take a urine sample. Yes. If the child is having this chorioretinitis and you are going to get this kind of experience, this is just like a, so can you see, this is just like a fog around and this is just like a headlight. So if you are having a headlight in fog appearance, yes, quickly tell me, which disease is having this headlight in fog appearance? Headlight in fog appearance. Headlight and fog appearance. Yes, my dears. Quickly tell me. Talk so. Very good, Deepti. Deepti Thakral is going to get a very beautiful seat. Yes, Deepti, which seat do you want in NEET PG? That also tell me right now. Okay. Coming on to this head, foot, and mouth disease, hand, foot, and mouth. This was once asked in your FMG. So I'm just quickly taking it. So you will have mouth is also going to have blisters, and there are some skin lesions in the foot also. So etiology was actually asked. So this is Coxsackie virus A16 and enterovirus, which you have to understand. Hand, foot, and mouth disease. Please understand that Coxsackie enterovirus. This you have to understand. Okay. So these both are actually important. Okay. These both are actually important. So you have to. Yeah. This was asked. This was asked just now. This was asked. So enterovirus, Coxsackie. So you have to remember this. This is important. Hand, foot, and mouth disease. Okay. Hand, foot, and mouth disease. Okay, so remember this. Yes. Okay, now identify this disease, this appearance. Top 100 in INICT. बच्चे you will get for sure you will get. बस किसी की ये सोलोस की नजर नहीं लगनी चाहिए. सोलोस कह रहे हैं मत पढ़ो. नहीं, सोलोस आपकी नजर नहीं लगेगी मेरे बच्चों को. Erythema infectiosum, Arshia Azim, very good. Oh, but who is the first one to check? First one to answer? Meena ji, Jyoti ji, Ashvi ji, Ravi ji, King of Alpha ji, Mani ji, very good. Yes, and you can take the hint of my name. I just hope you people will not give me this after my lecture. Huh? What? Slap cheek. ये मत करना. After my lecture, when Dr. Bhanu sir will write down to comment beautifully for me. Please write some good responses for me so that I can get promotion. Please, please, please. Huh? Okay. Okay. Chalo, quickly tell me. Cough plus coryza plus conjunctivitis. Yes. When do you see this? This is a triad of what? Cough, coryza, conjunctivitis. Measles. Very good. Elon Musk. Oh my God. I have got Elon Musk in my chat section. Superb. Huh? Measles. Very good. Very good. Very good. Measles. Very good. 100 days cough. Yes. Quickly tell me. 100 days cough. 100 days cough. At least 100 times I'm requesting you, when Dr. Bhanu sir will ask you about the feedback, please write some good things for me. My dear children, pyare pyare children, Ramesh Saran, email Gmail, Arka Prava, Madasu, Chetan, Deepti, King of Alpha, Ravi, Nalin. Please write some good feedback for me. Bacho, you will write good feedbacks for me and I'll pray to God to give, to bless you. Yes, correct answer is pertussis. Correct. Okay, Bacho. So I have seen Madam Pablo. Thank you, Pablo. So I have seen Madam yesterday. She covered a lot of things in your pediatrics. Yes, she covered a lot of things in your pediatrics. I mean, from pediatrics and biochemistry. So let's just quickly go through all these things. So glycogen storage disease. So you have this mnemonic. Okay, you want me to cover these diseases, or Madam has already taken this? Yes, quickly tell me. Love from China. Thank you. We would love to hear it from you. We would love to hear it from you. Okay, I'll quickly summarize. So, of course, the mnemonic is वो physics, chemistry और maths में होशियार था. So, von Garkes, Pompey's, Cory's, Anderson, M for McArdle's and Hers. So, if you want to know what is the enzyme which is deficient, so remember von Garkes has G. G is glucose 6-phosphatase. Pompey's, remember from my name P and V, that is Parv Luthra. L for lysosomal alpha 1 for glucosidase, or you can remember the acid maltase also. Okay, so both of them have got same name. Then you have got three, so C and D, A and B. So C and D, A and B means what? Cory's is the debranching enzyme, Anderson is the branching enzyme. Cory's is the debranching enzyme and Anderson is the branching enzyme. Next you have got next you have got McArdle's, that is muscle glycogen phosphorylase, and then hepatic glycogen phosphorylase, that is absent in hers. So this is something which I have told you. Okay, so shadi se pehle, so before the girl is married, the girl is going to eat less. So the girl is eating less. Then she's going to be a mother. Mother is like this. So remember, organs are fat. And then after she's having children, she's going to be she's going to be toxic like an acid. So acid is just like angry young woman. So this is the journey of girl. Okay, or wo doll. The doll, which is doll. Okay, so initially she was a doll. She was eating less. So eating less, that means what? Hypoglycemia. Eating less, that means what? That means hypoglycemia. Next is doll like facies. So she was a doll when she was eating less. Okay, so doll is actually the increase in amount of lipids. Then organs becomes fat, so hepatoreinomegaly. Okay, so hepatoreinomegaly, now she is an angry young woman. Acid, so remember acid is increased, lactic acidosis and uric acid. Okay, lactic acidosis and uric acid. Now, please understand, this was glucosidase. In Pompous, it was alpha glucosidase, and then you have got one more disease that is called as Gaucher disease. So in Gaucher's disease, it is beta glucosidase. So this you have to remember. You have to read the questions very carefully, because sometimes they ask you alpha, sometimes they'll ask you beta. So alpha is Pompey's and beta is going to be what? Beta is going to be Gaucher's. Pompey, pump heart. So whenever you see some heart abnormalities, please understand it is nothing else but Pompey's. And McArdle, since it is having a muscle phosphorylase deficiency, so the problem will be clearly visible, will be seen when you will have an exercise. Okay, if you'll do exercise, there will be exercise intolerance which is going to be there in McArdle's. Okay, so glucosidase, alpha is Pompey's, beta is Gaucher's. Okay, and galactosidase, alpha is Fabry's and beta is going to be Crab's. So please remember, Fabry's has got single B, so it is going to be alpha, and the crabs has got double B, so it is going to be beta. These are actually lipid storage diseases. I'll teach you just in a while, but remember this: glucosidase, alpha is pompous, beta is Gaucher. Okay, beta is actually Gaucher. Okay, beta is Gaucher, and then this. So these I have started the lipid storage diseases. Okay, let me just quickly finish up the lipid storage diseases. So yeah, okay, okay. So coming on to Gauchers, Gaucher is going to have, okay, Gouch. So Gouch is just like ouch. Gouch is just like ouch. Why ouch? Because there is going to be bone pain. And if the child is having bone pain, you will give the tissue. Take the tissue and wipe your face. Crumpled tissue. Okay. So Gouch is ouch. Ouch means bone pain. If pain is crying, give crumpled tissue. Give what? Give crumpled tissue, and the child will remove the ASU. Okay, after that you have got cherry red spots with the tiny organs. Okay, now yes, quickly tell me. Yes, it's your time now. Cherry red spots with tiny organs. Tay-Sachs disease or Niemann-Pick's disease? Yes, quickly tell me. Cherry red spot without hepatosplenomegaly with the tiny organs. Yes, it is Tay-Sachs or it is Niemann-Pick's? Tay-Sachs. Very good. T for tiny organs, T for Tay-Sachs disease. Okay, Tay-Sachs. And what is Tay-Sachs? Tay-Sachs. Okay, so Sax is just like 6. So you can remember from 6, hexa, and hexa is hexosaminidase. Hexosaminidase. Okay. Okay. Maltese cross. So remember, a girl who is wearing some fabric, okay, who is wearing some fabric, is having some cross like patterns. Okay, so this is a fabric, this is a cross, and this girl is sweating because the fabric is tight, so she's sweating a lot. Okay, so just remember this small story to remember that Maltese cross will be there on fabric, okay, which is responsible for increased sweat. Okay, which is therefore increased sweat. Niemann-Pick disease is sphingomyelinase deficiency. Niemann-Pick is going to have nasty big organs. Okay, nasty big organs are going to be there. But remember, of course, it's going to have cherry red spot, but nasty big, yes, nasty big organs which are going to be there. Coming on to enzyme deficiency in Hunter and Hurler. So the mnemonic is actually HIDE. Okay, so mnemonic is actually HIDE. Okay, so what do you mean by this mnemonic HIDE? So remember, Hunter syndrome has got iduronidase. Okay, Hurler syndrome is going to have iduronate. So if there is a T here, there's not going to be T here. So iduronate is going to be in Hurler. Iduronidase is going to be in Hunter. Okay, okay, you got it. Yes, this is something which you have to remember. So HIDE is again a mnemonic. I think I have not ठीक है. एक थोड़ा सा एक चीज रह गई है बताने की, लिपिड एक्यूमुलेटिंग. I'll just somebody please remind me. I'll inform you in the comment section. ठीक है, थोड़ा सा comment section के अंदर में मैं आपको बता दूंगा इसके बारे में. चलिए, coming on to this now, phenylalanine. So I hope madam must have taken like phenylalanine with the help of phenylalanine hydroxylase or tetrahydrobiopterin. This leads to the formation of tyrosine that further causes the formation of melanin. Okay, so if there is no phenylalanine hydroxylase, there will be decreased tyrosine, there will be decreased melanin, there will be hypopigmentation of the skin, hair, and eyes, and of course the phenylalanine is going to increase. So one thing which you have to understand, that there is something which is called as phenylketonuria, that is going to happen because of hydroxylase deficiency. Okay, hydroxylase deficiency. How to remember? Please understand, phenylketonuria. From urea you can remember urine. Urine is nothing but water, and water is something which is hydro. So please remember hydroxylase. Okay, this is going to be what? This is going to be hydroxylase. Okay, and one more thing which you have to understand is PKU. Okay, PKU is just like Pikachu, and the Pikachu has got a small yellow color mouse, small yellow colored mouse. Okay, so this is something which you have to understand, and they can even cause the brain damage also. One important thing is, see, hunter in order to hunt will have a clear cornea. Okay, So the cornea is not damaged in hunters, whereas in hurlers, the cornea is damaged. So this is another thing which you have to understand. Okay. Yes, this has been asked as a question. ATP7B gene is seen in Wilson's disease defect, and in Meniere's disease, it is ATP7A gene. And what is the diagnostic? So please understand, liver biopsy is diagnostic where the copper levels are more than 250 grams dry weight of the liver. So please understand, this is important. Liver biopsy is something which is diagnostic. Okay, so ATP7B gene. So remember, Wilson is nothing but B only. So B for, okay, so B only, Will, Sun. So Sun is actually beta. So this thing 7B is important, and biopsy is something which is important for Wilson's disease. Okay. Yes, yes, yes. Very good, very good, very good. Chalo. So now we will start with the systemic pediatrics. We are more than halfway done. We are more than halfway done, and I think just 1 hour or something, and then we'll be then we'll be finishing up. Okay. Chalo. Okay, 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 okay. Chalo, 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 chalo. So now, just a time. Just give me 1 minute. This 1 minute is to embrace your journey. Okay, just remember, like 6 to 7 years have passed. You decided to become a doctor. Most of you are doctors now. Most of you are going to become doctor. So uh, be thankful to God. Okay, because He's the one who made you to come here, right? He is the one who made you a doctor. And dear students, I know that there are a lot of distractions in this period. There is a lot of boredom in this period. You need somebody. There is a void that's going to be there. But one thing you have to understand, that besides all of these things, families are waiting for you. Patients are waiting for you to get treated. This is enough for any person to stay motivated, to be very focused on to work. And when you are sleeping relaxed, believe me, a lot of people are hoping that next day, next morning, the doctor is going to come and is going to see whether my brother, my sister, my mother, my father, my grandma, grandpa are well or not. Okay. So I'm just honestly telling you, guys, you are blessed by the hands of God, and this is the right time to say thank you to God. Open the comment section and write down thank you God for everything. Okay, write down in the comment section thank you God for everything. Okay, I know I can understand that right now you are just hustling here and there. Most of you are trying from like 3-4 years now to 3 years to get onto the FMGE exam, to pass this exam. But I am honestly telling you, bache, gratitude is something which is very important. Practice gratitude. Tell God thank you so much for everything. Thank you so much for everything. Okay, and see the magic. Okay. Yes, definitely, bache. Beautiful things are waiting for you. Everything is going to be superb. Okay, superb. Everything is going to be so superb in the lives of all my dear students. Okay, yeah. Chal. Coming on to central nervous system now and the febrile seizures. So fever, seizures, and absence of any CNS infection. Okay, so because see, if there is CNS infection, then of course it is related with meningitis. But what we have to understand, meningitis should not be there. And then if there is seizure, that's obviously going to have fever and seizures. That is the febrile seizure. And the age group is actually 6 months to 5 years. Okay, 6 months to 5 years. Okay, 6 months to 5 years. My dear children, I'm super happy that you all are putting your heart and soul. It's 11 o'clock. People have went into their bedrooms to start talking and chatting with their girlfriends and boyfriends, and you people are my team. You are struggling. You are fighting. Okay, and that's the spirit. That's the spirit. We are going to win. We are going to win. Definitely, we are going to win. Okay, we are going to win, bache. We are going to win. Okay, so what is the treatment? So first line, if somebody asks you, you have to give antipyretics and tepid sponging. But then next is the next important part is that, you know, what is the treatment of seizures? So firstly, you have to because it's an emergency febrile seizure, so airway, breathing, and circulation. But if the seizure is like more than 5 minutes, you have to give benzodiazepines. So just remember this, that, you know, uh, this is the Mercedes Benz sign. I have drawn a seizure, and you know that only few people have this Mercedes Benz. So the treatment of F and S febrile seizure is nothing but Benz, that is the benzodiazepine. So remember, generally we give IV, but diazepam rectal and midazolam intranasally can be used. Okay, can be used. Okay, ठीक है. चलो बच्चे, coming on to the next CNS का next part, absence scissor. So please remember, absence scissor has got a beautiful word that is called as abs. Okay, आप हमारे लिए इतनी बच्चे देखो, मैं तो आपके लिए मेहनत करूंगा, आज करूंगा, कल करूंगा, हर रोज मेहनत करूंगा. बस मुझे इतना प्रॉमिस, एक एक कमेंट सेक्शन खोलो और बस इतना कह दो कि जीतेंगे, हम जीतेंगे, और लिखो सर आपके साथ हम भी जीतेंगे, सर आपके साथ हम जीतेंगे, तो हम जीतेंगे. ठीक है, चलिए. एब्सेंस सीजर हैज गॉट 3 words, ABS, abs. So it is 3 letters. 3 letters से याद करेंगे. The frequency is actually 3 hertz, and you can see abs is written like this. A is just like spike, so it has got a spike and a wave pattern. Okay, it has got a spike and a wave pattern. Okay, so remember this. Females are more commonly seen in males. And then, you know, female को कैसे लिखते हो? She लिखते हो. S for school going children. Okay, school going children. And जो तुम्हारा female है, female loves abs. So love is V and E. V for valproate, that is the drug of choice, and E for ethosuximide. And this is something which is provoked, which is something provoked with, yes, provoked with hyperventilation. Okay, ventilation. Okay, coming on to JME, that is juvenile myoclonal epilepsy or Jan syndrome. So Jan's has got how many letters? 1, 2, 3, 4. So Jan's has got 4 letters, 4 to 6 hertz polyspike wave pattern that is seen in Jan syndrome. And remember, the drug of choice for Jan syndrome is valproate. Okay, so can you see valproate was a drug of choice for absence also, valproate is a drug of choice for Jan's also. Coming on to West syndrome or infantile spasm, बच्चे, this is important. This is very, 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 very important. Okay, this is important for FMGE. West syndrome. So please understand, West syndrome is something that is seen in less than 1 year. So West syndrome W, West syndrome 1, ONE1. So less than 1 year. Then you have got a jackknife seizure. Okay, that is going to be there. You will have salam spells also. So remember West. Remember this. Okay, west is actually best. West is actually best. So best, so if anything is best, you will give salam to them. So salam spells. So spasm of neck muscles is going to be there, and the child will be like this. Okay, so this is the salam spells. And of course developmental regression is going to be there. There's going to be hips arrhythmia also. Okay, so hips arrhythmia is actually a chaos. Okay, so in order to become the best, you have to pass from the chaos, so it will have a chaotic pattern. So remember, this chaotic pattern is important. Salam spells is important. Less than 1 year is important, and the treatment, of course, is important. See, the drug of choice is injection ACTH normally. Okay, so normally for your West, you have to give what? ACTH, but you have to add vigabatrin if it is associated with tuberous sclerosis. Vigabatrin. So T is important. T for what? T for tuberous sclerosis. Okay, T for what? T for tuberous sclerosis. Okay, so tuberous sclerosis. Okay, so this is, you have to understand. Okay, okay. Coming on to the next part. Next part is actually meningitis. So remember, what will be there in meningitis? You will have fever, you will have signs of meningeal irritation. Okay, so what is there? Nuchal rigidity is going to be there. Neck stiffness is going to be one of the features. Next is Kernig sign. So they can ask you what is Kernig sign, and then they can ask you what is Brudzinski sign. So what is Kernig sign? So whenever you will try to extend the leg, there will be resistance. So Kernig's is actually the Kernig, E is extension. So whenever you will try to extend the leg, there will be resistance. And what is Brudzinski? Brudzinski is actually the flexion is going to have the flexion. Okay, the flexion of the neck will going to have flexion of the hips. So B for Brudzinski, B for both. So both means flexion of both flexion of neck and flexion of hip and knee. Coming on to the investigation of choice of meningitis, that's going to be CSF analysis, and you will have bacterial meningitis and viral meningitis. Okay, okay, so both of these things are important. So see, in bacteria, bacteria loves sugar, so bacteria loves sugar, so it is going to eat all the sugar. So since it is eating all the sugar, there will be hypoglycemia. In viral, it is going to be normal things. It's actually not hypoglycemia, it's hypoglycorrhea. That means in CSF, the glucose will be decreased. And then in proteins are going to be high in bacteria, normal in viral. In bacterial, neutrophils are more, in lymphocytes are more in viral. Okay. So what is the follow-up investigations? So investigations done after meningitis is actually better, because we have seen in meningitis there is SNHL very, very common. Okay. Very, very common. Okay. Coming on to the treatment of meningitis, so you'll give antibiotics, third generation cephalosporin, and vancomycin is something which is given, and if it is allergic to cephalosporin, you have to give meropenem. Okay, so this is something which you have to remember. So remember a mnemonic, that is CMV. So C for cephalosporin, M for meropenem, V for vancomycin, that is given for how much time? That is given for 2 weeks. Okay, right? Okay, chalo bache, leave solo, leave duet, leave group, and tell me the answer in the comment section. Late onset meningitis, what is the most common cause of late onset meningitis? Yes bache, what is the most common cause? Bache, please tell me, what is the most common cause? See, see, God has sent, okay, God has sent Dr. Solo, God has sent these people. Why? Because the God just want to check that how much concentrated you are, how much focused you are. Okay, so bacha, these all are distractions. Please distract your distractions and feed the purpose. Yes, quickly tell me, what is the most common? Not enterovirus, bacha, not streptococcus, bacha. This is late onset. Yes, late onset is going to be GPS. Very good, bache. GPS. S for slow. S for slow. Okay, GBS, Streptococcus. Group B, Streptococcus. Very good, beta. Okay, Solos, I really like your spirit. See, my spirit has to be stronger. Nobody can stop my children from dreaming big. Nobody can tell them that whatever you are doing is not good. No, my children are strong. My children are capable of doing everything. Even after MBBS, they can do wonders. My children are the real strength. You can see anybody. You can see here, come here, see here. At 11 midnight, also my children are studying with me. Nobody else is conducting the class. Nobody else is putting in the effort. I am putting in the effort. My children are putting in the effort. And somebody will come and say that MBBS is not worth it. I just don't like it. Please stop messaging it. And my dear students, come. Let's fight with everything. With every negativity, we'll fight and we'll win. Write down in the comment section, we will fight. We will fight. Okay? We will fight. Definitely we'll fight. Coming on to Duchenne's muscular dystrophy, bache. Duchenne's muscular dystrophy is the muscular dystrophy. Now, muscular dystrophy means now you will not have the muscles inside and you will have the fat. Okay, you will have the fibers. So can you see this one? The empty one is actually fat and this one is actually fiber. So muscles, okay, now muscles are no longer there. Okay, muscles are no longer there. Okay, okay, muscles is not going to be there, and fibrofatty appearance will be there. Solos Jan, please don't disturb the class now. I just want to inform. Don't inform. We very well know. We very well know. My students very well know. Okay, they are on a purpose. Don't demotivate them. And moderators, editors, if you just can remove all these people, please remove them. Duchenne's muscular dystrophy. Remember, it is a proximal muscle weakness which is going to be there. It is a proximal muscle weakness. It is going to be there. Okay, proximal muscle weakness is going to be there. Okay, in the lower limb hip muscles. So basically, they will have what? They will have a fibrofatty deposition. Okay, there will be having a fibrofatty deposition. The muscle is going to go out, and there will be fibrous and fat deposition which is going to be there, and most commonly seen in the calf muscles. And that is why you are going to have what? That is why you are going to have what? That is why there will be a pseudo hypertrophy which is going to be there. Pseudo hypertrophy which is going to be there. And which is this sign? Yes, which is this sign? The child is taking the support to rise. This is called as Gover sign. Okay, that is a Gover sign. And Gover sign is seen in Duchenne's muscular dystrophy. Okay, Duchenne's muscular dystrophy. So just remember this. This is important. Gover sign seen in Duchenne's muscular dystrophy. And if you can remember, we have a beautiful place in Vrindavan, Govardhan. So D for Duchenne's muscular dystrophy, and G for Gover and Duchenne's muscular dystrophy. Okay, guys, we'll start all these things. I mean, I have got some things to be discussed, like the respiratory system, the small topics. But before going to these small topics, I have got some of the beautiful questions for you. Let's just do these questions one by one. Okay, yes, let's just finish up these questions one by one now. Just 1 second. Yeah, chalo. Yes, quickly type in the chat box. A child presents with delay in the growth. So there is a growth delay, which a chronic diarrhea, characteristic dermatitis. Okay, and yes, the clinical findings are associated with which disease? Yes, quickly tell me, guys. Quickly, everybody says niacin. This is B3. Yes, bache. So niacin deficiency, dermatitis, diarrhea, and dementia, which you have to understand. Whereas zinc is responsible for causing ectodermatitis enteropathica. Zinc deficiency causes ectodermatitis enteropathica. So what you have to understand in these cases, see, there is delay in growth also. There is delay in growth also. That means the brain is also involved, and since the brain is also involved, that's why this is going to be dementia involving feature as well, and that is why the answer is B3. Whereas if it would have been niacin, I mean if it would have been zinc, then of course periorificial. Okay, it is going to show dermatitis along the orifices. This you have to understand. Good, bache. Coming on to this, in a neonate who is born with the normal vaginal delivery at peripheral health center, which of the following procedure is not recommended to be performed immediately after delivery? Yes, quickly tell me. Yes. Immediately bathing. Very good. Bathing should not be done immediately. It is actually done preferably by 24 hours. Okay. So you have to understand, preferably by 24 hours. Coming on to this one, severe acute malnutrition presents with clinical dehydration. Now tell me, what is the fluid of choice? Yes, bache. Quickly tell me, what is the fluid of choice? B. Very good, bache. Ringer's lactate is given in 5% dextrose, because dextrose is something that has to take care for SAM, and Ringer lactate for the dehydration. Good, bache. Coming on to this one, after successful surgical intervention, that is Kasai's portoenterostomy or liver transplantation, congenital biliary atresia typically results in death due to liver failure, would rarely be seen surviving beyond which age? Yes, quickly tell me. That without successful, so if you are not performing Kasai's surgery, what do you think? Biliary atresia patient will result in how much? Yes, will how much time? So the answer is 2 years. The answer is 2 years, bache. Okay, the answer is 2 years. So Kasai, Kasai, Years, years. Okay, so this is how you can remember very easily Kasai's and years. Okay. Coming on to next question. Yes, now tell me this. A child diagnosed with celiac disease. Child diagnosed with celiac disease can safely consume what? Can safely consume what? Yes, quickly tell me, bache. Rice. Very good. Rice is the correct answer. Remember the BROW. Okay. is something which is contraindicated. So B for your bajra, R for is rye, not rice. Okay, it is rye. O for oats, and W for wheat, because all of these things are going to have what? They are going to have gluten in them. Okay, gluten. Chalo bache. So a 9-month-old child having history of BCG, that is Bacillus calmette guerin vaccination, but there is no scar which is present at injection site. Now what will you do? Yes, bache, what will you do? Reassurance. Very good, bache. We have to give reassurance because it does not signify vaccination failure. Okay, it does not signify vaccination failure. Coming on to this one, bache. Yes, bache. So see here in this child, okay, you have seen the answer. I'll just quickly tell you. So upper segment to lower segment is normal, and the child is 12 years and the bone age is actually 10 years, so bone is delayed. Okay, small testicular size, so the puberty is also delayed. So the answer is constitutional delay in growth and puberty. Coming on to this one. Okay, now tell me this. Yes, neonate born to a diabetic mother is asymptomatic. Okay, but blood sugar reveals a level of 25 mg per deciliter. What is the next step? Yes, bache. Next step. Quickly tell me the next step in this question. So everybody is saying A, D. Bache, answer is very good, very good. And the first person to give the correct answer is Bikram. Start oral feeds and recheck the blood sugar after 30 minutes or 1 hour. Okay, we have to give the oral feeding. Okay, we have to give the oral feeding. Okay, because see, it's actually less than 25 mg per deciliter. Okay, so for any asymptomatic neonate bacha, for any asymptomatic neonate with blood glucose level less than 25 mg per deciliter, the initial management is to provide an immediate feed like breast milk or formula milk to increase the glucose, and then you have to recheck. IV glucose is something, okay, wait. IV glucose is something, sorry. IV glucose is something which is given for symptomatic hypoglycemic baby. Okay, symptomatic babies. Chaliye bache. Yes, this question. Okay. So there is difficulty in breathing. There is pneumonia also. Okay. So most likely causative agents is, yes, what is the most likely causative agents for pneumonia? Good, good. People have written correct. Anushi is correct. Nitish is correct. The Desi is correct. Sachidanand, Priyanka, very good. The answer is respiratory syncytial virus. That's also a previous year question. In integrated, okay, in IMNCI, some dehydration belongs to what? Yes, bache. In IMNCI, some dehydration belongs to what? Quickly tell me. Some, very good. Some belongs to yellow. Very good. Some belongs to yellow. Coming on to this, so there are papule, there are vesicles, pustules. Rash is like this. So what is the answer? Chicken pox. B. Very good, bache. So chicken pox. B is very good. Good, Dr. Reshma, medical aspirant, AYR. Very good, bache. Very good, very good, very good. Coming on to this one. Yes, bacha. So having a high grade fever, having seizures, having loss of consciousness. Then there was anemia, there was hypoglycemia. Yes, what is the answer? Okay, so answer is cerebral malaria. Cerebral malaria. So why not others? So remember this fever, see the anemia is actually important for cerebral malaria. So I'm writing the mnemonic for you as well. The mnemonic is chaplain. So C for cerebral malaria, then H for hypoglycemia, then A for algid malaria, P for pancytopenia, L for lactic acidosis, I for increased potassium. Okay, so this is it. N is actually PNH, peroxisomal nocturnal hemoglobinuria. So this is how you have to remember. Thanks for the live. Okay, मेरा बच्चा, thank you actually. चलो. Yes, quickly tell me now this. 11-year-old child is found to be anemic. Yes, hemoglobin is 8 grams per deciliter. History of multiple blood transfusions. Microscopic hypochromic RBC. Yes. Which of the following investigation should be done next? Some people are saying B, some are saying C. Yes. So correct answer is HB electrophoresis. Why, beta? Yes, why? Because we have to check for what? We have to check for, yes, we have to check for, बताओ क्या करना होता है हम लोगों को इसमें? Menzer index. We have to check for Menzer index to check whether it is a thalassemia or a iron deficiency anemia. But the problem in this case is that they have not given you the number of amount of RBCs. That's why we are just seeing the hemoglobin. So we have to do the hemoglobin electrophoresis. Okay, assuming that if there is no iron deficiency picture which is given in the MCQ, then we have to see the then we have to go for the HB electrophoresis only. Okay, coming on to this, a couple has been trying to conceive for 2 years. So for 2 years they were having infertility. Now the female partner is actually normal. Male partner is going to exhibit gynecomastia, small testes, small pubic hair, and history of antisocial behavior also during school days. Yes, what is the Noonan. It is Klinefelter, bacha. It is Klinefelter. Okay, this is Klinefelter which is going to have it. Okay, let's see. Noonan is not. Yeah. So okay, so it's actually C. Yes. Very good, Deepa. Good bache. Good Bharat. Good Anushi. Good students. Good students. Okay, bache. Identify this disease. Yes. Quickly identify this disease. Which disease is it? Hanji beta. Which disease is this? Quickly tell me. Hanji, which disease is this? You are having hematemesis also, jaundice also, splenomegaly as well. Bache, this was a question which was asked in FMGE, and like all of you are surprised, we were also surprised very similarly. The answer was actually portal hypertension. Okay, so the answer is actually portal hypertension and nothing else. So sometimes you have to just apply your common sense and you'll get the answer. The answer is portal hypertension. Okay, coming on to some of the one liners now. Okay, so actually these are true false statements. Okay, so you have to check, you have to tell if it is true and false. So 1 2 3 4 5 and 6. Okay, beta. So can you tell me which of the following is a false statement? Yes, which of the following is a false statement? Quickly tell me, beta. Which of the following is a false statement? 1 2 3 4 5 and 6. First statement says acute rheumatic fever. The first line drug is going to be aspirin. Okay, A for acute rheumatic fever, A for aspirin. Somvia Harikumar says fourth statement. Okay. Nahi bache, that's absolutely normal. I have told you in turners, when you ask the female to turn, the female is going to turn. So turners is going to be normal. Then Pratibha Sharma says B. Acute traumatic fever, to prevent the recurrence, we give penicillin. Bache, it's absolutely correct. In fact, I'll teach you the dosage also. Yeah, this is completely fine. Then Deepa says Tofika says all are true. Deepti says all are true. Yes, bache, you are correct. All are actually true. Cry do chat is also going to have 5p short arm deletion. So remember cry do chat. So cry do, remember 5p. And you have to remember like this, like crying, who is going to cry? I am going to cry. That if my students will say if any of the statement is false. So remember P for 5 also. okay, and P for 5P as well. What is the most common cause of pneumonia in children is RSV, we have just seen, and NPHCHS1 mutation leads to nephrotic syndrome. This is important. So N for nephrotic, this you have to understand. So PHNNPH, so nephrotic, this is nephrotic syndrome. Okay. Okay, beta, some of the NEET PG PYQs are also equally important. Let me just ask you this. Okay, before going on to this detail, let me just tell you xerophthalmia. So xerophthalmia is nothing but a spectrum of ocular manifestations. So what is important in this? This is important. So remember, bitot spot is B and I. So you have to remember 1 and B together. So X1B is going to be the bitot spot. Other things you can remember. But one thing, please remember, conjunctiva is going to come before then the cornea. Okay, so X2 is going to be cornea. Okay, cornea is X2, whereas conjunctiva is going to be, yes, conjunctiva is going to be 1A. Okay, so 1A is going to be conjunctiva, X2 is going to be cornea, 3A is going to be corneal ulceration less than 1/3 corneal surface, 3B is going to be more than, of course, more than 1/3 corneal surface, S for scarring, F for fundus, xerophthalmia showing the fundus. This was the question. Staple food was given as maize and the answer is niacin. Yes, correct, bachcho. Coming on to this one now. Yeah, bache. So periorificial, if they are going to give this, the answer is going to be zinc. Okay. So remember this, if it is periorificial, then answer is going to be zinc. People see this, people mark the answer as niacin, bache. That's not the case. This is zinc deficiency. Please understand this is important. Okay, then of course these things I'm going to take in. Yeah, yeah. Chalo. So we have covered a lot of slides and only very less number of slides are something which are remaining. So let me just quickly go through all those slides, and then of course our beautiful rapid revision is going to come to an end. Just let me go through these slides now. Yes, bache. Acute epiglottitis, quickly tell me which appearance will you see in acute epiglottitis and which appearance you will see in croup. Yes, appearance, quickly tell me appearance in acute epiglottitis. Thumb sign, very good, bache. Epiglottitis showing these two T's all together. So two T's are actually telling you what? Two T's are going to tell you thumb sign is going to be there. So this thumb sign is important. Etiology is important. That is your H influenzae. So remember, epiglottis has got I for influenzae. That is important. Okay, so this is the thumb sign which you have to understand. Whereas if you see this is a church steeple sign. This is nothing but the croup that is going to be there, and that is because of para-influenzae. So I'm telling you these things because okay, in this is croup, this is you have to understand. Steeple sign, narrowed larynx, thumb sign is swollen epiglottis. What will be the treatment? See, in epiglottitis, because it's of course epiglottitis is going to be there, inflammation is going to be there, you have to give IV antibiotics, cephalosporin, and of course airway management. But whereas in croup, that is also inflammation only, laryngobronchitis. So can you see all the three are going to show the inflammation? So not just the antibiotics, but you have to give the steroids also to decrease the inflammation. You have to give epinephrine to open the airway, and then you have to you have to give other things as well, like the airway management and other things as well. Okay, coming on to pneumonia now. So what is the most common cause overall? So streptococcus pneumonia. That's why streptococcus pneumonia was named streptococcus pneumoniae, because that's the most common cause. Then most common virus cause in children, if they ask you, then that's going to be respiratory syncytial virus. But if they ask you about the most common cause in HIV positive, so then you have to understand pneumocystis jirovecii. Pneumocystis jirovecii. Okay. Coming on to pneumonia in like 1 to 3 months, that's going to be chlamydia. So remember this, chlamydia, C is the third letter of alphabet. So remember, this is going to be in the 3 months. Okay. Yeah. Sir, if possible, can you take the question discussion sessions? Okay, so you want the rapid revision of other subjects also, you want the question discussion sections also, you want the image based questions also. Okay, my dear children. Okay, I will try and do that for you. Don't worry. I'll ask the team, confirm from the team, and then we will decide. Coming on to the other things like no pneumonia, pneumonia, and severe pneumonia. So severe pneumonia is like you will have danger signs like lethargy, convulsions, cyanosis, poor feeding. So in this case, you have to immediately refer to the higher center after giving 1 dose of antibiotics like ampicillin and gentamicin. And if there is no pneumonia, that means fever, cough, and cold is going to be there. So just home management, paracetamol. But if pneumonia is actually fast breathing, chest indrawing, this you have to understand. So if there is fast breathing, if there is chest indrawing, B and C coming together, then you call it as pneumonia. Otherwise, you don't call it as pneumonia. In this case, you have to give paracetamol and amoxicillin. Okay, right? Yeah. Coming on to fast breathing, so just remember that less than 2 months 60, 12 months 50, more than 12 months 40. So just remember that 1 year, okay, 1 year is 50. Okay, so if you can remember, 1 year is 50. Of course, more than is going to be 40. Okay, autosomal recessive. This thing I think I have already discussed that cystic fibrosis is autosomal recessive. CFTR gene mutation, deletion of F508 mutation. F is phenylalanine at 508 position, and it was previously called as mucoviscoidosis. Mucoviscoidosis is actually, what does this mean? That there will be lots of mucus which will be accumulated. Okay, so just quickly understand, bache, CFTR mutation, this is important. Then F is important. F for phenylalanine also, F for 5 also. So 508 is going to be the case, and mucus is so much. Okay, so what is the defect? Defect is actually in the chloride channel. So C for CFTR. So C for what? C for chloride channel inactivation is going to be there in this case. And what you are going to do? You are going to do the sweat chloride test. Okay, what you are going to do? You are going to do the sweat chloride test. This has been asked in the question, so I've told you. Yes, but now this table is extremely important. They'll give you something and then they are going to ask you. So let me just मार्क द मोस्ट इंपॉर्टेंट थिंग्स. हाँ जी, सबसे इंपॉर्टेंट थिंग्स मैं आपको बता देता हूँ CFTR की. अच्छा जी, अब मुझे बताओ देखो मेरे को बहुत देर हो गई तुम्हें पढ़ाते हुए. आई स्टार्टेड द सेशन एट 6:30 एंड इट्स 11:30. 5 hours we have completed successfully. Now tell me one important thing. One very basic thing. Okay, one very basic thing. Now tell me that if you, okay, so this is something very emotional for me. Initially I got a message from somebody that he is a new guy. How will he teach? He should not be given the permission to teach, huh? What do you think? Just let me know in the comment section, only for 1 minute. Just let me know, what do you think? How was the session? What do you think? And as of now, how is the session going? Bhavya says best. Bhavya, you are the best. Amazing, guys. Amazing, guys. Amazing. है ना? बूम. चलो. Let's come back. बच्चों, आप लोग, मैं सच में बोल रहा हूँ. I'm just telling you from my heart. God sees only one thing, and that is efforts. You people are doing efforts like a beast. Your beast mode is on. Your beast mode is actually on. Honestly, your beast mode is on, and you are, you are just like, you people are like super soldiers. You are my army. Okay, and the army is fighting like anything, huh? Army is fighting like anything. Army is fighting like rock stars. Honestly, the army is fighting like a rock star. Okay, now see, bache, in what will you see in respiratory tract? So I have told you that in all the tubes, like in bronchus, like in trachea, you are going to have recurrent pneumonia. That's the most common cause. The Staph aureus is the most common problem that's going to be there in CFTR, and of course you will be having bronchiectasis also. Okay, so because there's a lot of mucus, so this lot of mucus is going to, yes, okay. Yes, yes, yes. Don't worry, don't worry. So this mucus is going to have what? This mucus is going to have a lot of bacteria also. Okay, there's a lot of mucus, lot of bacteria is going to be there. What about GIT? GIT is going to have Meconium ileus. It's the early manifestation that's going to be Meconium ileus. Okay, that's going to be what? That's going to be Meconium ileus. That's going to be there, and distal intestinal obstruction. So, which intestinal obstruction is also going to be there. Okay, meconium ileus, intestinal obstruction, and that cystic fibrosis is generally seen with pancreatic insufficiency. So there will be no fat absorption. Okay, fat absorption bhi nahi hoga, so fat will be in stool, so steatorrhea is going to be there. Then fat soluble vitamins will also not be absorbed, so decrease in vitamin A, vitamin D, vitamin E, vitamin K. Okay, so all these things are going to be decreased. And now, of course, there will be cholestasis also, biliary cirrhosis as well. So just remember these things. What are the things? So you will have P for pneumonia, P for pancreatic insufficiency, then you have got your meconium ileus, and then I for meconium ileus, and I for intestinal obstruction, which is going to be there. Then you have to understand, you have in cystic fibrosis there is absent vas deferens also, that is azoospermia. That is going to be what? That is azoospermia. This you have to understand. Okay, so okay, so this cystic fibrosis, okay, cystic fibrosis, uh just you can remember with the mnemonic of PIA. Okay. Yeah. Yeah. Definitely, I've done a lot of research before teaching you, because of course I was the new person to teach you. Huh? Chalo, cystic and fibrosis. F for fractures. Remember this. F for fractures, and C and D come together. So chronic diarrhea. So anybody if asks you the chronic diarrhea plus fractures, so remember. So C, D, and F. All these things are going to be important. Okay, and PIA is the mnemonic. Okay. मेरा पिया घर आया. Chalo, cystic fibrosis. So I have told you that chronic diarrhea and of course the fractures, they are going to give you a hint in the question. They are fond of giving this question. I don't know why. So this is the very important trick to remember this. Okay. Lots of love from Pims. Pims is my alpha meta. Thank you so much for this beautiful thing. चलिए, so confirmatory test for your cystic fibrosis, of course, 2 elevated sweat chloride. ठीक है, sweat जो है वो ज्यादा होना चाहिए 60 से. So you can remember sweat is going to be there. Remember 60 is and the sweat. Okay, so SNS are actually important to be remembered. Then you have got 2 CFTR gene mutation. This is the best investigation. Okay, and of course the nasal potential difference is also going to be there. So these both are important, and nasal potential differences are also going to be there. Now how to treat them? So remember the chloride channel was actually closed. So what is CFTR? C is having chloride channel. So in order to open, so increase the duration of chloride channel opening, we give IVACA factor. So Ca is actually cystic, and F for what? F for fibrosis. So this is actually Ivacaftor. I call it as Ivaca factor in order to make it simple. So C and F coming together. So just remember this. Okay. Okay. Very good. Very good. And then CFTR correctors also, that is Lumaca factor. Okay. So Lumaca factor. Okay, so remember this is important, Lumaca factor. Okay, CFTR corrector, Lumaca factor. Okay, good. Coming on to the CVS now, cardiovascular disease. So just remember, very important thing, bache. In VSD, you know that the blood is going to go from left side. So okay, just let me draw an heart for you quickly. This is the left side, this is the right side, this is the lungs which are going to be there, and who is taking the blood to the lungs? The right side is taking. So more the blood reaching to the right side, more the blood will be reaching to the lungs. And if more the blood is reaching to the lungs, there will be no cyanosis, there will be a cyanotic heart disease. And in what conditions the blood can go from left to right? AST, VST, and even in the PDA. AST, VST, and PDA, all these are having a left to right shunt. Okay, and of course this is going to be what? This is going to be acyanotic heart disease. And of course there can be coarctation of aorta, and in coarctation of aorta also some amount of blood is going to the lungs. So since it is it is going to the lungs, so of course it's going to be very normal. Okay, it's going to be very normal. Okay, chalo, great. Chalo, coming on to the next part. Next is going to be this one. So in VST, the questions is asked is, in VST, what is the most common VST? So it is perimembranous VST. In AST, which is the most common one? So ostium secundum. So S, you have to remember, S for secundum. This you have to understand. Okay, and what will be there in VST? There is a pansystolic murmur. Mnemonic is PARV. So P for pansystolic murmur, V for VST. Okay, and then you have got AST. What is going to be AST? There will be a wide fixed split, wide fixed split S2 sound. This is not SA, this is S2. Okay, wide fixed split S2 sound. Okay, wide fixed split S2 sound. AYR bache, we need 500 likes. It's 485. Yes, I know. So if you can hit the like button and we can reach to 500 plus, then only I think annotated PDF will be shared. So this is the rule of the channel. I can't help you in this. Okay, all right. So after that you have got PDA. Now PDA, you know that it is going to have a machinery murmur. Okay, PDA is going to have a machinery murmur. This is something which you have to understand. So machinery murmur is going to have patent ductus arteriosus. So just remember like this, like if it is a patent thing, okay, patent, okay, patent is having a word tent. Okay, and tent, how is tent applied on any part? So tent लगाने के लिए हम क्या करते हैं? मशीन से होल करते हैं. ठीक है? So patent, tent से you can remember machinery. Okay, you can remember what? You can remember machinery murmurs. Okay, you can remember what? You can remember machinery murmurs. ठीक है? Okay, yes. Okay, thank you so much for 500 likes. But yeah, I will have to confirm from the team. So they said that on 500 they'll share the annotated PDF also. And like all of you, if you can like and we can like reach to 1000, I will be the most highly liked YouTube pediatric faculty in the live session, है ना? चलो अगर 1000 हो जाएंगे तो मजा आ जाएगा. चलो साइनोटिक कंजेनाइटल हार्ट डिजीज. और वैसे भी I don't know if you people know this or not, we have exceeded the limit of most, I mean all the rapid revisions are like 4 hours, 5 hours, but then we are at 5 hours and 40 minutes as of now. And I hope अगर आप बच्चे मेरा साथ दोगे ना, अगर आप सब बच्चे मेरा साथ दोगे तो मैं इस सेशन को the most highly I should say highly viewed and highly conceptual and highest strike rate वाला मैं जो है ना इसको इस चैनल इस पूरे टॉपिक को जो वो बना दूंगा, बिल्कुल बना दूंगा. बिकॉज बाकी लोगों ने 4-5 घंटे में खत्म किया यार. 4-5 घंटे में पीडियाट्रिक्स खत्म नहीं होता. इट्स अ वेरी इंपॉर्टेंट सब्जेक्ट एंड आई एम टीचिंग यू ऑल द इंपॉर्टेंट टॉपिक्स. और अब मुझे पढ़ाते पढ़ाते लग रहा है कि पीडियाट्रिक्स का एक भी क्वेश्चन, नॉट इवन अ सिंगल क्वेश्चन इन पीडियाट्रिक्स यू गाइस will miss. Okay, this is the beast mode. If it would have been easy, we would not have been sitting here. अगर ये आसान होता तो कोई भी कर लेता. हम क्यों कर रहे हैं? क्योंकि हम लड़के जीतेंगे. हम लड़के जीतेंगे, चाहे रात के 11 बजे 12 बजे कितना भी बजे भाई, हम जीतेंगे. चलो, coming on to the cyanotic now. Now cyanotic means what? Cyanotic means cyanosis is happening. So cyanosis can happen in two cases. Okay, in okay, two three things. So just remember, if it is decreasing pulmonary blood flow, just remember in TOF. Okay, in TOF what does happen? In tetralogy of Fallot, what is going to happen? There will be, there is a pulmonary stenosis. Okay, there is a pulmonary stenosis that is going to be there. So because there is pulmonary stenosis, there will be decreased pulmonary blood flow which is going to be there. What is Epstein's anomaly? Epstein's anomaly is atrialization of the ventricle. Atrialization of ventricle. उसमें क्या होता है? उसमें the right atria becomes bigger, right ventricle becomes smaller, so less amount is going to go to the lungs. And what about tricuspid atresia? That means tricuspid valve is not properly opened, okay, it's closed, so that's why less amount of blood is going to go from right side to the from right atria to the right ventricle. In all these cases, pulmonary blood flow will decrease, whereas in TGA, truncus arteriosus, TAPVC, blood flow is going to increase. So all the T's, my there, they are actually the acyanotic heart disease. Acyanotic disease. Okay. Amit ji, या बेटा मेरा देखो अमित, देखो बेटा अमित, अमित एक मिनट दे दो यार, अमित को भी एक बार मैं बता देता हूँ। अमित भाई देखो, सीधी सी बात, इफ आई एम टेकिंग मोर टाइम, इफ आई एम पुटिंग मोर एफर्ट्स, आप बोल रहे हो सर स्टॉप इट, ठीक है। इफ आई विल नॉट कवर द होल सिलेबस, ओके आई विल स्टॉप इट। इफ आई विल नॉट कवर द सिलेबस, देन यू विल से सर योर स्ट्राइक रेट इज लो। आपके लिए ना मुझे एक गाना याद आता है, तू कौन है तेरा नाम है क्या, सीता भी यहाँ बदनाम हुई, सुना है ये? छोड़ो बेकार की बातों में, कहीं बीत ना जाए रहना, कुछ तो लोग कहेंगे, लोगों का काम है कहना। तो बस आपका यही चल रहा है बेटा, तो इसीलिए ना नेगेटिव चीजों पे मत आओ, ठीक है, नेगेटिव चीजों पे मत आओ बेटे, ठीक है। हाँ, ओके, पॉजिटिविटी, पॉजिटिविटी पे आओ, पॉजिटिव, देखो कितना अच्छा अच्छा मैं चीजें आपको बता रहा हूँ, है ना, पॉजिटिव चीजों पे आओ, आ जाओ बच्चे, चलो कम। सो ये एक्सरेज वेरी इंपॉर्टेंट एक्सरेज पूछते ही हैं, आइडेंटिफाई द एक्सरे। सो सी दिस इज अ बूट शेपेड हार्ट, बूट शेपेड हार्ट किस में दिखता है बेटा, टॉफ में दिखता है। अच्छा टॉफ देखो, टॉफ हैज गॉट दिस ओ एंड टी, है ना, टॉफ हैज गॉट दिस ओ, टॉफ हैज गॉट दिस टी, ऐसे ही साइनोटिक हैज गॉट ओ एंड टी, साइनोटिक हार्ट डिजीज, ओके। हाँ, नेक्स्ट इज गोइंग टू बी एग ऑन स्टिंग अपीयरेंस, ओके, एग ऑन स्टिंग अपीयरेंस, ओके। So egg on sting appearance is seen in transposition of great arteries. Okay, transposition of great arteries. Transposition. So very simple. Understand? Egg. So this is actually an egg. Okay, this is actually an egg on sting appearance and transposition. So just remember, we are supposed to transport the egg. Okay, transport the egg. So transposition. Next is supracardiac TAPVC. So supracardiac TAPVC. देखो ना, supracardiac. So supracardiac TAPVC is just like this. Okay, just like this. Supracardiac TAPVC. But अगर मैं इसको थोड़ा सा ऐसे बना दूं तो ये S भी बन रहा है. Okay, so from supracardiac TAPVC, you can remember it is going to show you S, that is going to be snowman appearance, that is just like a figure of 8, and cottage loft appearance, cot loft appearance. Okay, great बच्चे, great great great. शायरी भी सुनाते हैं, शायरी भी सुनाते हैं, पहले ये देख लो. Coarctation of aorta is going to show you this figure of 3. So this is coarctation of aorta, notching is going to be there. And then you have got box shaped heart. This box shaped heart is actually that is something which is seen in your Epstein's abnormality. Epstein's abnormality. So remember, BE is going to be there, Epstein's. So BE is actually BO is equally box. Okay, it's going to be what? It's going to be box. Okay, coming on to cardiovascular diseases, just remember RHD का ना एक prophylaxis बहुत पूछते हैं. So just let me tell you about the prophylaxis of RHD. So either you can give penicillin, but if it is allergic to penicillin, you have to give erythromycin. And penicillin का dose लिखा है, but dose is actually not important. Just remember that orally we give penicillin V, whereas parenterally we give benzathine penicillin. And then this is important. This is extremely important. The duration. Now, what is important? Remember, if it is without carditis, if there is no carditis, we have to give it 5 years or till 18 years, whichever is longer. Then with the carditis, 10 years or 25 years, which is there. And then with RHD or following surgery, if there is rheumatic heart disease, not carditis, but rheumatic heart disease is going to be there. there is going to be lifelong. अच्छा, 1 second, just let me see. Egg on side नहीं बेटा, egg on sting है, egg on string appearance, egg on sting appearance, ठीक है, egg on side और egg on sting appearance. This is important बच्चे. Carditis, please understand, this is important. With the carditis is going to be there, so with the carditis is going to be T. So what is T? T for 10. Okay, so with the carditis is 10, without has this no T. Okay, so this is going to be half, that is going to be 5. Okay, this is going to be half, that is going to be 5. Okay, so this is without a carditis. Okay, so this is important, you have to remember. And with that, yeah, chalo. Okay, so strawberry tongue, everybody knows. Scarlet fever, all my dear students know. Strawberry gum is seen in vaginous granulomatosis. So G for gum is going to be there, G for granulomatosis is going to be there. Strawberry nasal mucosa, that is seen in sarcoidosis. Okay, strawberry nasal mucosa is seen. A nasal, this S is important, this is S is important. Nasal is going to be there, sarcoidosis. So S and A, both of them are going to come together. So this is end of our CVS. This is end of our pulmonology. Coming on to the gastrointestinal tract. So if you are having coiling of the nasogastric tube, of course you will have what? This is tracheoesophageal fistula or esophageal atresia. Tracheoesophageal fistula or esophageal atresia is going to be there. Esophageal atresia. Okay, and what you are going to have in this? So this is actually, yeah, this I have told you, hypertrophic pyloric. This coiling is actually this bache. This is the first thing. Okay, coming on to the next important topic, that is hypertrophic pyloric stenosis. Okay, hypertrophic obstructive pyloric stenosis, it is going to have projectile vomiting, but the vomiting is going to be non-bilious. Why there will be non-bilious vomiting? Because you know, this is the obstruction is in the stomach, and the bile duct is going to open in the second part of the duodenum. So that's a non-bilious vomiting, and because there's a vomiting, there will be dehydration. This line is extremely important. ये line अगर मेरे बच्चों को पता है तो बच्चे मेरे rock करने वाले हैं, बच्चे मेरे रॉक करने वाले हैं. प्लीज अंडरस्टैंड दिस. देयर इज हाइपोकैलेमिक, हाइपोक्लोरेमिक, मेटाबॉलिकल एल्कलोसिस विद पैराडॉक्सिकल एसिड यूरिया. देखो बच्चे, हर चीज कम हो रही है. पोटेशियम कम, क्लोराइड कम, पीएच जो है ना वो बढ़ रहा है. ठीक है, पीएच जो है वो बढ़ रहा है. ओके, या फिर ऐसे याद करो, H पॉजिटिव लेवल्स भी कम हो रहे हैं. K पॉजिटिव कम, Cl पॉजिटिव कम, H पॉजिटिव कम, एंड एसिड यूरिया. ठीक है, एसिड यूरिया इज गोइंग टू बी देयर. ठीक है, एसिड यूरिया इज गोइंग टू बी देयर. ठीक है, चलो. हाँ जी, अब हम नेक्स्ट बात करते हैं एरिथ्रोमाइसिन. ये ड्रग जो है ना, ये एसोसिएटेड होता है CHPS के साथ. यू विल हैव ऑलिव शेपेड मास, बिकॉज यहाँ पर तो स्टेनोसिस हो जाएगा बच्चे. एंड देयर विल बी विजिबल पेरिस्टाल्सिस. व्हाई विजिबल पेरिस्टाल्सिस? बिकॉज स्टमक यहाँ से कोशिश करेगा कि ये आगे जाए. इन्वेस्टिगेशन ऑफ चॉइस इन CHPS इज गोइंग टू बी USG. ओके, USG इज गोइंग टू बी देयर. सो USG इज गोइंग टू बी स्टमक. तो यहाँ से याद रखो, USG करेंगे हम लोग स्टमक के लिए, CHPS के लिए. And you will have what? More than 16 mm. So how will you correct? तो बेटा फर्स्ट स्टेप पूछते हैं बार बार, ये इस MCQ को याद रखना. What is the first step? First step in CHPS is to correct the, okay, first step in CHPS is going to correct the hypo, HNP is hypo electrolytes. जो भी electrolytes कम हुए हैं या ज्यादा, हाँ, electrolytes कम हुए हैं बच्चा, उसको आप लोगों को कम करना, उसको आपको मैनेज करना है. And Ramsted's pyloromyotomy is something which you have to understand, which you have to do. Ramsted's, ठीक है. So please remember, okay, so Ram ji comes with Sita ji. Sitaram, Sitaram, Sitaram kahiye. Okay, so stomach, so remember this, S for stomach and R for Ramstead. So stomach का pyloromyotomy करते हैं. तो अब USG क्या दिखा रहा है? USG दिखा रहा है हाइपरट्रॉफी. इसको हम लोग कौन से साइंस बोलते हैं? इनको कौन से साइंस बोलते हैं? यस, एनीबॉडी नोज? यस, व्हिच इज द साइन? यस, क्विकली टेल मी व्हिच इज द साइन. क्विकली टेल मी व्हिच इज द साइन. वेरी गुड, वेरी गुड. डबल ट्रैक साइन, डबल ट्रैक साइन, एंट्रल निप्पल साइन. वेरी गुड बच्चे, वेरी गुड. चलो बेटा, coming on to the next part now. Yes, coming on to the next part now. Next part is actually Meckel's diverticulum. So can you see this is the, yes, this is the Meckel's diverticulum. This is the Meckel's diverticulum. So क्या है इसमें, क्या दिख रहा है हमें इस पूरे के अंदर में, हम लोगों को दिख रहा है, yes. So in the right upper quadrant, just below the liver, there is an increased intensity. Okay, increased intensity. Okay, so this is nothing else but a diverticulum. So rule of 2, seen in 2% of population, 2x common in male, 2 feet proximal to ileocecal wall. So this is actually ileocecal wall. So 2 feet proximal to ileocecal wall, 2 inches it is going to be there in length. And there are 2 types of ectopic tissue which is present, gastric as well as pancreatic. Okay, so this is important. And remember, this is technetium per techninate scan. So tech is me, देखो, per tech is mech, tech is mech. Okay, so tech is mech, so technetium per tectinate. Okay, per tectinate. ठीक है. अच्छा, gluten hypersensitivity I have already discussed with you guys. Okay beta, coming on to the प्लान ए बी सी एंड डी. ओके, कमिंग ऑन टू प्लान ए बी सी एंड डी. तो फटाफट मैं आपको बता देता हूँ. देखो प्लान ए, देखो कुछ एक चीजें ना, कुछ एक वर्ड्स जो है ना बहुत इंपॉर्टेंट है. ठीक है, मैं आपको वो फटाफट चीजें जो है ना वो बता देता हूँ. देखो बच्चा, इफ देर इज नो डिहाइड्रेशन, एक्टिव चाइल्ड, अलर्ट चाइल्ड इज गोइंग टू बी देयर, जो कि ये लोग पूछते ही नहीं है, ऑनेस्टली नहीं पूछते हैं. ठीक है, जो पूछते हैं वो बता देता हूँ कि अगर नो डिहाइड्रेशन है तो क्या दोगे, कुछ भी नहीं बेटा, ओआरएस देते हैं. ठीक है, ओआरएस देते हैं. और ओआरएस में, ओआरएस क्या है, अगर लेस देन 2 इयर्स है 100 ml दे दो, 2 to 10 इयर्स है 100 to 200 आई मीन 200 ml दे दो, और मोर देन 10 इयर्स है तो जितना देना है उतना दे दो, कोई प्रॉब्लम नहीं है. देखो याद करने का तरीका बता देता हूँ. 2 याद रखो, 5 into 2 is equal to 10, so 50 100 2. ठीक है, 2 into 10 is equal to, ओके सॉरी, 2 और 10 आ जाएगा तो याद रखेंगे 100 and 200, 100 to 200. ठीक है, क्लियर. फिर आता है सम डिहाइड्रेशन. पहचानने का तरीका एक ही है, और वो है बच्चे कि बच्चा इरिटेबल होगा, थर्स्टी होगा, इरिटेबल होगा, थर्स्टी होगा, एंड स्लो रिस्पॉन्स दिखाएगा. स्लो रिस्पॉन्स इन द स्किन पिंच टेस्ट. आपको देना है ओआरएस 75 ml पर केजी ओवर 4 आवर्स, 75 ml पर केजी. सो सम डिहाइड्रेशन के अंदर में आप लोग को क्या देना है बच्चे, सम डिहाइड्रेशन के अंदर में आपने देखना है बच्चा इरिटेबल होगा. बच्चा क्या होगा, बच्चा इरिटेबल होगा. इससे ऐसे बच्चे को आपको क्या देना है, ऐसे बच्चे को आप लोगों को 75 ml पर केजी के जितना, 75 ml पर केजी आप लोगों को देना है. ठीक है, 75 ml पर केजी. So remember, IRRITABILITY. So basically you have got 12 words. Okay, and these 12 words are actually nothing but 7 plus 5, that is equals to 12. So this is the 75 ml per kg. भाई ये mnemonics कहीं नहीं मिलेंगे. These mnemonics you are not going to have in any textbook, and you can't remember all these things without mnemonics. So that's why I'm going to give you all this. ये मेरी मेहनत है मेरे बच्चों के लिए. मेरे बच्चे, they are going to rise, they are going to shine, they are going to do wonders in their FMGE exam. So this is my little efforts for all of you, and I just hope that you are liking all these things. Coming on to severe dehydration, बच्चा lethargic हो जाएगा. You have to give IV fluids, that is ringer lactase plus 5% dextrose. Okay, and you know you have to give this dextrose also. So remember, अगर बच्चा 1 year से कम है तो 1 hour में हम 30 ml देते हैं, and 5 hour में 70 ml. more than 1 year है 30 minutes and 2.5 hours. This is something which you have to remember. This is important. 30 and 70 ml ये बहुत important है. 30 ml and 70 ml, this is extremely important. Coming on to, yes, fluid of choice, this we have already discussed. कमिंग ऑन टू इम्यूनाइजेशन. अब ये भी बच्चे बहुत परेशान होते हैं इसके ऊपर में. बच्चे से सर इम्यूनाइजेशन इज समथिंग व्हिच वी वांट यू टू टीच. देखो बेटा, 2 तरीके का इम्यूनाइजेशन शेड्यूल है. देयर आर 2 टाइप्स ऑफ इम्यूनाइजेशन शेड्यूल. वन इम्यूनाइजेशन शेड्यूल इज समथिंग व्हिच यू रीड इन PSN, so that PSM faculty is going to cover. So I have got immunization schedule of Indian Academy of Pediatrics, so I will teach you about the Indian Academy of Pediatrics. But if you ask me, one schedule that is important, that is of course your national immunization schedule is important than your IAP, but it becomes my responsibility to teach you the IAP schedule. Okay. Kalingari has says you are covering PSM also. Nahi bachche. I am right now. I'm not covering PSM. Let's see how the thing goes. But yes, of course, I'll request the team that मेरे बच्चों का भला होना चाहिए. I just want them to rock shine in their FMGE. So I just want them, मैं अपनी तरफ से from my side any contribution in your betterment if I can do, I will definitely do, because as I have told you, I love you guys a lot. Coming on to the rotavirus, बच्चे, rotavirus is something which is going to have a risk of intersusception. So just remember this. Now coming on to the important things now. Yes, coming on to the 6 weeks, 10 weeks, and 14 weeks. 6 weeks, 10 weeks, and 14 weeks. Let's quickly understand these things, bache. 6 weeks, so remember, and birth. So birth, remember the mnemonic for birth is have on birth. The mnemonic for birth is have on birth. So H for HBV, O for OPV, and B for BCG. Have on birth. 6 weeks, bitches, 6 weeks, very, very simple, very, very simple. So 6 weeks, 10 weeks, and 14 weeks, very simple. So you have to give hexavalent. So pentavalent, I think you know, DTP, then HIB, and of course your yes, hepatitis. ये है ना? Yes. So hexavalent is going to be there. So so the 5 components of your pentavalent is DPT, HBV, HIB. These are going to be there, and one more is going to be IPV. So this is the component of hexavalent. So hexavalent तो आपको देना ही है. You're supposed to give the hexavalent for sure, but what you have to understand that you have to give hexavalent देना है. Then you have to give what? You have to give the PCV and ROTA also. So, this is a very cute mnemonic, very cute trick to remember, that at 6 weeks, at 10 weeks, and 14 weeks. Okay. 6 weeks, 10 weeks, for hexavalent has to be given. So H for hexa, H for happy. And who is making you happy right now? It's me. My name is Parv. P and R is important. P for PCV, R for ROTA. P for PCV, R for ROTA. So can you see hexavalent is DTP, HHI, and who is going to make you happy? PARV, PCV, and ROTA. Okay. कैसे सोचे हैं सर इतने निमोनिक? वो है ना, तू है तो दिल धड़कता है, तू है तो सांस आती है. तो बच्चों, तुम्हारे लिए ये मेहनत करना ऑटोमेटिकली हो जाता है ना? इट बिकम्स स्पॉन्टेनियस. Mnemonics are on spot. Yeah, but many mnemonics are actually on spot also. Just because of you all, I just want you people to clear your FMGE exam, become Indian medical graduates. India needs you, bache. India needs you. Coming on to 6 months and 7 months. So 6, remember this 6 we write it as SINX, and I for influenza. I for influenza. 7 is also influenza. 6 to 9 months. Okay, so 6 to 9 months. Okay, 60-90 का पेग मार के क्या हो जाते हैं? टल्ली. Okay, 6 to 9 months, 60-90 का पेग मार के क्या हो जाते हैं? टल्ली. So टल्ली हो जाना means T for typhoid conjugate vaccine. Okay, T for typhoid conjugate vaccine. So टल्ली हो जाना 60 to 90 months, 90 ml. So 6 to 9 months typhoid conjugate vaccine. 9 months, of course, 9 months पे क्या बन जाती है? माँ बन जाती है ना. After 9 months we are delivering. So 9 months MMR. So this is important. 12 months, remember we write 12 months like Baraha. So ha is important. Hepatitis A is something which you have to understand. Okay, which you have to understand. Okay. Then after that you have got 15. So remember 15वां महीना. 15वां महीना. So 15वां means what? 15वां. P for PCV. Va means varicella. And mahina is actually MMR2. 16 to 18 is of course 16. 16 is going to have hex. Hex means 6. So hexavalent is going to be there. You can see D, P, T, HIB, IPV is going to be there, but remember there is no hepatitis B which is going to be given. Okay, that's no hepatitis B which you have to understand. Okay, which you have to learn actually. And after that, okay, so after that you have got 18 to 19 months. So 18 months, remember 18 is actually 15 plus 12. So what is 15 plus 12? So 15, at 15 you gave varicella, so this is varicella. At 12 you gave hepatitis A, so hepatitis A. And remember, this hepatitis and varicella, both of them are going to have 9 words. HEPATATITIS. So 9 words are going to be there. Varicella is also going to have 9 words. 9 plus 9 is going to be 18. So 18 months, so 18 to 9, 18 months you can give this vaccine. 4 to 6 years, of course, other thing, 4 to 6 years. So 4 to 6 years, you can just remember that at 5 years, 4 to 6, okay, just how to remember. So if I just write HNM, so HNM is 1 2 3 4 5, 5 letters. 5 years, 5 years means 4 to 6 years you're going to give H and M. M for MMR3 and H for hexa. So all the components of hexa are going to be there, except, okay, except hexa. So except hexa, that means you're not going to have, sorry, except H, you're not going to have what? You're not going to have hepatitis B also, you're not going to have HIV also. And 10 to 12 years, of course, Tdap, you have to understand. Tdap, you have to understand. Coming on to hematology. Let me just teach you hematology now. So please understand, bache, if there is TTP. Now what do you mean by TTP? TTP is actually thrombotic thrombocytopenic purpura. So what is going to be there? There is thrombocytopenia. So if it is thrombocytopenia, of course there is decreased platelet count, and if there is decreased platelet count which is going to be there, the bleeding time is going to get increased. So please understand, bleeding time is increased and the platelet count is decreased. Of course it's going to be thrombotic thrombocytopenic purpura or immune thrombocytopenic purpura. But you know that S and T come very close in alphabets, so schistocytes will be seen in thrombotic thrombocytopenic purpura. Okay, and you will have what? You will have viral infection and autoimmune diseases in immune thrombocytopenic purpura. But if your platelet count is normal, okay, the problem will be what? The problem will be aggregation. The problem is going to be what? Aggregation. And for aggregation, it needs two things, either von Willebrand factor or GP1B29 receptors. Okay, GP1B29. So if there is absent ristocetin aggregation, that means the problem is in von Willebrand disease. But if it is GP1B9, then the problem is called as Bernard-Solier disease. Bernard-Solier disease. Okay. So ristocetin is von Willebrand. Just remember my name and you will get the answer. Ristocetin, B for von Willebrand, and Bernard-Solier is GP1B9. So from this B, you can remember the Bernard-Solier disease. Bernard-Solier disease. Coming on to the disease, which is, sometimes we have seen that there are the diseases associated with glomerulonephritis, associated with pneumonitis. It is going to be small vessel vasculitis. Okay, because small vessel vasculitis is something that is going to involve, yes, it is going to involve the kidney also, it is going to involve the lungs also. Okay, like that. Coming on to malar rash. If there are malar rash, it is associated with lupus. Okay, so remember this, malar rash, L is coming here, L for lupus. Then you have got pankha. So pankha Churg-Strauss syndrome is going to have eosinophilia. Okay, it's going to have what? It is going to have eosinophilia. Okay, so this is which you have to understand. Okay, pankha, remember pankha and Churg-Strauss is something you have to remember. So have you seen pankha? So this is the pankha, and then pankha is attached to the ceiling with this straw-like structure, hai na? With this straw-like structure, this pankha is going to be there. So straw is Strauss. So Strauss syndrome is associated with pankha. And if I just remove all these three pankudis, and like this, if I just arrange these pankudis, this becomes E, and E for eosinophilia. E for what? This becomes eosinophilia as well. And if they give you a hint of saddle nose is a hint for Wegener's. Okay, saddle nose is a hint for Wegener's. So this you have to understand. Okay, and yes, saddle nose, Wegener's, this is going to have what? This is C Anka positive. C Anka positive. Okay. Okay, if clotting time is increased, okay, now this is next thing. If clotting time is increased, okay, so what you have to see, if there is girl, okay, if this girl, then it's going to be hemophilia C. If there is boy, there can be hemophilia A, hemophilia C, and Christmas disease. Hemophilia A for 8, 8 is 8. Hemophilia C, C is the third letter of alphabet, so 3 into 3 is equal to 9. and of course Christmas disease. Okay, girls C and G look very similar, so in girls it's only the hemophilia C. And remember this, that in girls and boys, okay, girls and boys is just a classification. So when are you supposed to classify either a child is a boy or a girl? We are going to classify if we are having a problem in the clotting time, if we are having a problem in the clotting time. Okay, so this is how you have to remember. And Christmas disease is nothing but 11th. Okay, Christmas disease is nothing but 11th problem. Okay, so coming on to the last few slides, 6 slides are there, and then we are ending up with the, I mean, this is, this is going to be amazing, super amazing. Okay, chalo bache. Coming on to nephrology, nephrotic syndrome. So I think you understand that what is nephrotic syndrome. So in nephrotic syndrome, there is going to be loss of protein. Okay, because the glomerular membrane is not perfect. So there's going to be what? There's going to be loss of protein, and since there is loss of protein, there's going to be massive proteinuria, like more than 40 mg per meter cube per hour, or 3 positive or 4 positive. That's going to be there. So remember 4. Okay, and this pro, so protein is going to be 4 or 40 mg per meter cube per hour. There will be hypoalbuminemia, there will be generalized edema. Okay, why there is edema? Because loss of albumin, there will be increased amount of water. So, and okay, so let me just tell you. So hypoalbuminemia means this is the blood vessel, this is the cell, and since there is less albumin available here, okay, there will be more water that's going to be there, and this water is going to enter inside the cell. So the cell is going to have what? The cell is going to have edema. And because protein is lost, okay, because protein is lost, protein is decreased, the body tries to increase that protein. So the body is going to increase the production of lipoprotein, and that's why there is going to be hyperlipidemia that's going to be there. Okay, hyperlipidemia. हाँ बच्चे, हाँ, नहीं, definitely we will do what is important for you. Coming on to the minimal change disease. So minimal change disease is actually loss of podocytes. So in nephrotic, understand, in nephrotic disease, this one is the most important one. Minimal change disease is the most common one in nephrotic, which is going to be in chotu babies, 2 to 6 years babies. Whereas you have got FSGS. What is FSGS? Focal segmental glomerulosclerosis. Simple, very easy. Remember, F for FSGS, F for fucked up. So it's completely fucked up life. Okay, when is your life fucked up? In children or in adolescence? In adolescence. So late adolescence, late adults, completely fucked up life. They'll have hematuria, they'll have hypertension, they will have CKI, kidney is completely gone, and there will be no response to steroids also in this case. So this is the problem in this. Okay, coming on to glomerulonephritis, just remember, if in the question they give you 2 keywords like RBC cast in the urine, dysmorphic RBC, cola colored urine, the answer is going to be glomerulonephritis. And there are 2 beautiful, 2 very important differential diagnosis when it comes to glomerulonephritis. One is going to be IgA nephropathy, one is going to be post-streptococcal glomerulonephritis. Please understand, IgA nephropathy is going to occur in less than 1 week. Okay, and if it is more than 1 week, then please consider PSGN. Okay, so occurs 1 to 3 weeks after streptococcal pharyngitis. So how to understand? So देखो, post 1 week, then you can understand PSGN. Okay, PSGN. Whereas IgA is less than. Okay, so IgA in mesangium less than. Okay, it is actually concurrent. So okay, side by side. And then you have got streptococcal and this PSGN. Now another important thing is they ask you that where you will see the deposits. So in IgA, of course, the deposits are going to be there. M and N, both of them are important. So nephropathy is N, M is mesangium. So N and M come very close in alphabets. So just remember this is mesangium and this is going to be nephropathy. And PSGN is important. Streptococcus is important. So S for subepithelial. This is something which you have to understand. Subepithelial. So streptococcus has word S and E. So subepithelial deposit in PSGN, whereas mesangial deposits is seen in IgA. IgA नेफ्रोपैथी। ठीक है बेटा, बहुत ध्यान से पढ़ा करो क्या लिखा हुआ है क्वेश्चन में। देखो यहाँ क्वेश्चन में बर्जर्स डिजीज लिखा हुआ है। ठीक है, बर्जर्स डिजीज लिखा हुआ है, बर्जर। ठीक है, बर्जर का मतलब होता है IgA नेफ्रोपैथी, बर्जर का मतलब होता है IgA नेफ्रोपैथी। ब्यूर्गर का मतलब होता है थ्रोम्बोएंजाइटिस ऑब्लिटरेंस। ये सर्जरी वाले सर आप लोगों को पढ़ाएंगे, ठीक है, डोंट वरी। बट देन बहुत ध्यान से पढ़ा करो, नहीं तो कुछ लोग इसको क्या पढ़ते हैं। हाँ जी, ये क्या लिखा हुआ है, कौन कौन है नींद में जिसने इसको अभी गलत पढ़ा है। यस, कौन कौन है नींद में जिसने इसको गलत पढ़ा है अभी। यस क्या पढ़ा है इसको, जल्दी बताओ। कौन सा कैफे, कौन सी कॉफी, प्रोस्टेट है ना, है ना। हम्म, सो बी वेरी केयरफुल, बी वेरी केयरफुल। स्वजीत ने गलत पढ़ा है, यस स्वजीत कृष्णा, king of alpha, huh? So all of you have read this wrong. So read the questions carefully. What is Buerger's, and either it is Buerger's or it is Berger. Berger is IgA, Buerger is tau. Huh? No, that's a pro taste coffee. Okay, that's a pro taste coffee. Coming on to the inositol purpura or IgA vasculitis. देखो, IgA nephritis is Berger's disease. IgA vasculitis is inositol purpura. So what the questions they'll ask, this is because of IgA deposition, small vessel vasculitis, and you have to understand the mnemonic of HAP, HUP. HAP, HUP. ये कोई तो आया था, किंग्सली, किंग्सली तेरे लिए भाई, HUP ठीक है, और क्यों है वो बच्चे जान सकते हैं, है ना, द किड्स। बीड़ी पीने से, बाप रे बाप। चलो हप, so hup is the mnemonic। भाई कितने सही टाइम पे, it's the very correct time that the mnemonic has come, especially for you my king, Kingsley, for you only। Okay, so understand hup is the mnemonic, H for inositol purpura, A for you will have abdominal pain, okay, A for abdominal pain, and P for palpable purpura, non thrombocytopenic। बच्चे please understand there is no thrombocytopenia because there is no hup, I mean no T in the hup। विश्वजीत भाई बोल रहे क्या है के लिए, हाँ ना भाई, मैं पढ़ा रहा हूँ, पागल हूँ क्या, क्या लोग हैं। Coming on to the next syndrome, next Wiskott-Eldridge syndrome. Mnemonic is water. Wiskott-Eldridge syndrome has T, thrombocytopenia, E, eczema, R, recurrent infections. Bachche, if you are having a triad of thrombocytopenia, eczema, and recurrent infection, this is actually Wiskott-Eldridge syndrome. Wiskott-Eldridge syndrome. Of course, see, are all of the students, they are putting in their heart and soul. They have read, they are with me since like 5 hours, and suddenly a random guy will come and say, oh, read from that and so sir is amazing। Why? Why? They are enjoying my class, I am enjoying their company। Who are you to tell? कल को जाके कोई इसकी बंदी को भी बोलेगा, भाई बहन उससे शादी कर ले, वो ज्यादा अच्छा लड़का है। क्या बेवकूफी है भाई। Coming on to last system, that is endocrine disorders। So one thing they'll ask you is thyroid, okay, so congenital hypothyroidism, the most common cause is thyroid dysgenesis, you have to remember this। So they'll ask you hypothyroidism, the most common cause, so DI you have to remember, hypothyroidism, DY, that is thyroid dysgenesis, okay, thyroid dysgenesis, okay। राधे राधे, सर आपकी गर्लफ्रेंड है क्या। राधे राधे ही हैं भाई जो हैं ठीक है, चलो। कमिंग ऑन टू क्लिनिकल फीचर्स, सो वेरी सिंपल बच्चे, what you are going to have in hypothyroidism, so please remember that thyroid is responsible for maintaining the, yes, thyroid is responsible for maintaining the BMI, okay, BMI। So thyroid is responsible for maintaining the BMI, okay, not BMI, basal metabolism rate। So if there is no thyroid, there will be hypothyroidism, there will be dry skin, okay। Please remember, this is important, a wide open fontanelle and a late closure, okay, this is important। Of course there will be delayed passage of meconium as well, because that is responsible for metabolism, and if the metabolism is not functioning properly, the food particles will not be broken, and if it is not broken, it is not going to go, yes, it is not going to go down. Okay, you got it. So that's why there will be delayed passage of meconium that is going to be there. This is important, but wide open fontanelle and late closure, this is important and important. Okay, important. Okay, wide open fontanelle and late closure is there in case of what? It is seen in the case of hypothyroidism. Okay, hypothyroidism. So O for what, bacha? O for open fontanelle. O for open fontanelle. Versus hydrocephalus. In hydrocephalus, you will see a rising sun sign, beta. Okay, you will see a rising sun sign. And then you have got a investigation, so you have to do a TSH. Okay, TSH you have to check. Okay, so for any hypothyroidism, for that matter, you have to check for the TSH level. Radiological investigations like USG and radioisotope is also done. Acha bacha, one important thing, they ask you, it is technetium 123 or technetium 131 for diagnosis. Okay, so for diagnosis, beta, you remember your years of MBBS. In first year, second year, third year, you just diagnosed the condition. It was in your fifth year, the internship part. 1 plus 3 plus 1 is 5 now. So in fifth year, you started for treatment. So iodine 131 is going to be fifth, and 123 is going to be diagnosis. Okay, it's going to be what? It's going to be diagnosis. Coming on to the type of congenital adrenal hypoplasia. दीनो चौधरी asking कहाँ गया किंग्स? किंग्स तो मैं हूँ, किंग्स तुम हो, जो बच्चे पढ़ रहे हैं वो किंग्स हैं भाई, वो किंग्स हैं, किंग्स हैं भाई, हम हैं। नाम चल जा मैं तेरे यार का। चलो, कमिंग ऑन टू congenital adrenal hypoplasia. चलो बच्चा, चलो 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 चलो, कम कम कम। congenital adrenal hypoplasia, ठीक है, congenital adrenal hypoplasia now, ठीक है। पुतिन साहब कह रहे हैं हम वॉरियर्स हैं सर। पुतिन जी, आप तो वॉरियर नहीं हो, आप विजेता वॉरियर हैं। खैर कुछ भी कहो, पुतिन इज द ट्रू फ्रेंड ऑफ इंडिया, एंड थैंक यू पुतिन। ओके, congenital adrenal hypoplasia, बच्चे आई हैव सीन लॉट ऑफ स्टूडेंट्स, दे आर टेलिंग सर कुछ सिम्टम्स दिए होते हैं, दे गिव अस सम सिम्टम्स एंड देन इन द एंड वी they ask you like which enzyme is absent. Okay, so for mineralocorticoid increase, that means aldosterone is high, that means your sodium will be more, that means your water will be more, that means the child will have increased BP, the child is going to have hypertension. Okay, and the normal BP in case of children is actually twice the normal BP in case of adults. Sorry, half the normal BP in case of adults. Okay, whereas in testosterone, if it is a female, you will have a virilization in the females, like they will give you some symptoms of clitoromegaly. Okay, okay, so this you have to understand that in 21 hydroxylase deficiency, now this is a very beautiful mnemonic, in 21 alpha hydroxylase, please remember this, that this is going to have 2, this is going to have 1, so 2 1 1, whenever 1 is coming, I'm putting a sign of increasing, so 17 1 and 7, then 11 1 will increase and increase. Okay, okay, so this you have to understand, that in mineralocorticoid increase, you will have increase in testosterone only. So 21 alpha hydroxylase is going to have only and only symptoms of virilization. In 17 alpha, only and only hypertension. In 11, hypertension plus virilization. I have told you how to remember this, and if you are impressed with this trick, if you are impressed with this trick, write in the comment section more session. Okay, write in the comment sections more session. Write in the comment section more session. See, some students are writing, sir, this content is same from here and there. Beta pediatrics थोड़ी बदल जाएगी. What do you want? You want me to change the pediatrics? Pediatrics can't Pediatrics can't be changed, dear children. Pediatrics can't be changed. Pediatric is this only, na? Huh? Pediatric is this. So the coaching platforms are bringing shells from the sea, and from those shells I am giving you the best shells, and from those best shells, okay, and from those best shells I'm giving you the technique to remember. I mean, I'm giving you the way to wear those necklace as well. इससे ज्यादा और क्या चाहिए? हाँ, इससे ज्यादा और क्या चाहिए? है ना? पता नहीं कैसे, मतलब इतना कम दिमाग है आप लोगों का. ये जो भी बच्चा है बेटा, एफएमजी ऐसे क्लियर नहीं होता. ठीक है, ऐसे क्लियर नहीं होता. एफएमजी एग्जाम हैज डिमांड्स योर फोकस. ठीक है, और तेरे लिए, ठीक है, ये बंदे का नाम क्या था? इसका नाम है पी समथिंग पी. क्या है पी? कुछ तो है भाई. तेरे लिए तेरा एफएमजी पता है क्या है? फालतू में, सिर्फ ये तेरे लिए है बेटा. फालतू में गधों की एंट्री. मेरे सारे बच्चों का जो एफएमजी का मुद्दा है ना, वो है फॉरेन मेडिकल ग्रेजुएट एग्जाम. तेरे लिए बेटा फालतू में गधों की एंट्री है बच्चे. तेरा ये एफएमजी एग्जाम है. ठीक है, पढ़ाई पे ध्यान दो बच्चे. चलो. So beta endocrinology. So see, this is the normal growth. So if there is normal growth, what is going to happen? The growth hormone is going to act on the liver, and there will be IGF-1, insulin like growth factor 1 is something that is going to get secreted. Okay, and then you have got the Laron syndrome. So what happens in Laron syndrome? Laron syndrome is also a PYQ. That's why I'm taking this. So what happens in PYQ? So there is the growth hormone receptors are not functioning. So so understand this, that because the growth hormone receptors are not functioning, there will be no IGF-1, and since there is no IGF-1, the bone growth is also poor, and of course there will be no feedback inhibition of growth hormone secretion. So normally what happens is, growth hormone acts on growth hormone receptors are not functioning, IGF-1 is not secreted, and there will be no feedback on growth hormone. So the growth hormone is going to get increased, but still the bone growth is going to be poor only. Okay, right? मजा आ रहा है. मजा तो आएगा ही. ऐसे बेवकूफ लोग आएंगे क्लास में, तो ये मजा देने ही तो आते हैं. हाँ जी बच्चों, चलो. So coming on to the last slides, last system, that is actually मैं पढ़ाना तो नहीं चाहता था, but this is something the questions have been asked, so let me just quickly teach you this. Okay, so chronic granulomatous disease, the defect is actually in NADPH oxidase, and because NADPH oxidase is not functioning, there will be decreased respiratory burst in neutrophils. Okay, so just remember, important thing is chronic granulomatous disease and granulomatous. You can remember granulocytes problem, and one of the granulocyte is actually what? It is actually the neutrophil. So the neutrophils are not going to function properly. Okay, so chronic granulomatous disease, and please remember granule. Okay, so granule, so A and N coming together, NADPH oxidase. Okay, so granular disease, so chronic granulomatous disease, NADPH oxidase is not good. So what is going to happen? There will be staph aureus like organisms, they are going to grow. So catalase positive organisms, they are going to be there, and there is going to be what? Yes, there's going to be what? There's going to be pus formation that is going to be there. Okay, pus formation is going to be there. Please understand, in chronic granulomatous disease, okay, in chronic granulomatous disease, you have got some tests which is called as NBT test, and you have got what? You have got DHR test also. NBT test also and DHR test also, that's going to be negative or abnormal. So NBT and, so remember granulomatous, this is NADPH, and from this NADPH you can remember N. What is N? N is going to be the NBT. Okay, N is going to be the NBT test which is going to be there, and because there's a failure, so there will be recurrent abscess that is going to be formed. What is the treatment? So you have to give for the catalase positive organisms. Okay, catalase positive organisms, you have to give S. What is okay, catalase positive organisms, give co-trimoxazole. Okay, give co-trimoxazole. This is something which you are going to give, and of course interferon alpha is also something which you are supposed to give. So this was actually a problem in the phagocytosis because NADPH oxidase was not functioning. Coming on to leukocyte addition defect. Now the WBCs are actually formed. Okay, now the WBCs are actually formed, but the problem is with the addition, and addition is with CD18, 18, and then beta 2 integrin. So integrin itself is telling you integrin is going to be there, and 18 is something which you have to understand. So at the age of 18, most of you at the age of 18, when you are becoming adults, you just want to adhere with your partner. So CD18 and beta 2 integrin, they are gone. So they will, because they are not integrating, there will be infections, but there will be no pus, because for pus you need the integration and there is no pus. The hint given is delayed umbilical cord separation. This is extremely important, okay, for your leukocyte addition defect. Leukocyte addition defect, so remember this is going to be delayed. Okay, delayed. So remember leukocyte addition defects, leukocyte addition defect will be there in the delayed. Okay, there will be leukocytosis. Okay, see, the amount of WBCs are going to increase in the blood vessels. Why? Because they are not getting adhered, so that's why they are very high. Okay, and you have to do what? Flow cytometry, and L is actually the leukocyte addition defect, so flow cytometry is something which is given in it. Okay, fine. So this is, you have to understand, and for treatment we give the bone marrow transplant itself. Okay, coming on to the last part, that is the severe combined immunodeficiency. That is, there is T cell and B cell dysfunction which is going to be there, which is actually an ADA deficiency. Okay, okay, समझ में आ गया? तो देखो, severe combined immunodeficiency, severe combined immunodeficiency, severe combined immunodeficiency. Combined means what? Combined means B cell is also gone, T cell is also gone. ठीक है, तो देखो, कोई नहीं रहा तो अड्डा भी क्यों रहेगा? कोई नहीं रहा तो अड्डा भी क्यों रहेगा? So this is ADA deficiency also. There is going to be what? There is going to be ADA deficiency also. So all the functions, all the problems will be there, but the very characteristic finding is no thymic shadow on X-ray. Okay, no thymic shadow will be there on X-ray. Okay, there is no thymic shadow which will be there on X-ray. Okay, so this you have to understand, and the treatment is going to be bone marrow transplant itself. Okay, cool. So yes, we started at 6:30. Yes, we have ended at 12:30, and this is the 6-hour session. We are the most productive. We are the most productive pediatric learners for the day, dear students. Most productive, most productive. Actually, I planned a doubt class. But then we are very late. So my suggestion. Okay. Surprise singing for winners. Acha, theek hai. So now let me just tell you that, once we are done with this, right now we will finish it up. Okay. Arey, ruk jao. Wait. Suno. So once we are done with this, we will, on our Telegram channel, I hope that you all are aware, on our Telegram channel, we are going to give you a link of Prosium. Okay, so you just go there, and I have designed a very beautiful 20 MCQ chotu sa quiz for you, and the top 5 people, okay, the top 5 people who will be, securing the highest marks, they will be featured on Wall of Fame. Okay, so if you are in the in those top 5 people, you have to send your photo on the Instagram, okay, and you will be featured in that. I just hope that all these cutie children, okay, or children, देखो कितना गंदी इंग्लिश हो गया, all these children of mine who have been working hard with me, पता है मैंने क्या किया है ना, मैंने बहुत वो सारे क्वेश्चंस ना आपको कवर भी करवा दिए इसी क्लास में, ठीक है, because I just want that all those people who have attended my class, okay, those students should get the chance to come in the wall of fame. Yes, definitely. And all those students who will come in the wall of fame, now I'll personally text you in your Instagram as well. Okay, in your Instagram I will text. Okay, so Dr. Bhanu sir has also sent something in in the Telegram, so you can just check. And this is, yes, this is how you can connect on Instagram. Yes, wall of fame is also there. Okay, wall of fame is also there. जाते जाते एक इतनी सी शायरी बोलूंगा, ठीक है, this is a small beautiful शायरी from my side to you all कि चलो ठीक है, so this is a bye bye शायरी for all of you and I'll say this शायरी for you कि जा तो रहे हैं, बिछड़ने का वक्त हुआ जा रहा है, जा तो रहे हैं, बिछड़ने का वक्त हुआ जा रहा है, जाते जाते कोई तो है जो मेरे दिल में समाता चला जा रहा है. Thank you so much for this beautiful lecture, and I am just waiting for that day when you will write that, sir, I did it and I did it because of you. Thank you so much, my dear children. God bless you. God bless you. Come on to Telegram. Come on to Telegram. We'll talk there. Don't worry. And those of you who want this, yes, you can connect on Instagram. Ashvi, I am your brother only, bitche. Ashvi, I am your brother. Beta, just I am requesting you one important thing. Okay. Just I'm telling you that please like the session. Okay. Like the session because I have told you that more you like the session, more it will be easy for me to, to share the annotated PDF. And please, after sometimes, of course, the team is going to ask you for the feedback as well. So give a good feedback so that I can do the another sessions also. Okay. Special appreciation extended to Sir for his exceptional pedagogical expertise and remarkable proficiency in imparting medical knowledge. His teaching demonstrates outstanding clinical insights. Chat GPT Jindabad. Hmm? Thank you so much. Thank you. Yeah, Ashri, you can call me Anna. It's okay. It's completely fine. Completely fine. Amazing, guys. Amazing. Chalo, fatafat say quickly. Just like this session, huh? So that I can, yeah. Just quickly like this session. Quickly like this session, my dear students. And soon the sir is going to ask, how was the session? What is your feedback? So just please, थोड़ी सी मेरी इज्जत रख के अच्छा लिख देना. With this, send PDF. Yes, you can get the PDF on Telegram. Okay, on Telegram you can get the PDF. Okay, chalo, last song and then we'll end the session. हाय मर जाएंगे हम तो लुट जाएंगे ऐसी बातें किया ना करो आज जाने की जिद ना करो. चलो, God bless you. We'll meet you hopefully after some time. All the best for your FMG exam. God bless you. God bless you. Yes. God bless you. So my request to the technical team to kindly close the session.